We hadn't already got started, hadn't we, Chair? Madam Vice Chair, we hadn't started, had we? So I was asked to read something before we got started, if I can locate it right here. Today is the Dr. Martin Luther King Jr.'s 54th birthday. Is it just 50? No, it was 50. Dr. Martin Luther King Jr. was assassinated in Memphis, Tennessee, while there to support striking sanitation workers, to expose the need for economic equality and social justice, aligned with Poor People's Campaign. The fight continues, and on behalf of the Durham County Martin Luther King Jr. Steering Committee, I was asked to read this and ask for a moment of silence on behalf of sanitation workers and the celebration of someone that sacrificed his life for fighting for sanitation workers. So if you want a moment of silence, please. Thank you. All right. And I will go ahead and read the public charge since we are in person today. The Board of Commissioners asks its members and citizens to conduct themselves in a respectful, courteous manner, both with the board and fellow citizens. At any time, should any member of the board or any citizen fail to observe this public charge, the chair will ask the offending person to leave the meeting until that individual regains personal control. Should decorum fail to be restored, the chair will recess the meeting until such time that a genuine commitment to the public charge is observed. And it's at this time, do we have any citizen comments? ACO.
We have no citizen comments as far as people signing up this morning. We have 2 citizen comments that were emailed in that I will read.
Okay, would you share those with us, please?
Sure. The first comment is from DeWarren Langley. First, welcome and congratulations, new County Manager Dr. Kimberly Sowell, on her historic appointment as the first permanent Black female county manager for Durham County government. I look forward to working with you as you transition to your new job. Second, I urge maintaining the My Brother's Keepers manager's position to collaboratively and strategically work with local agencies and community-based nonprofits to oversee policy and program implementation, pursue funding streams, and develop a comprehensive, sustainable model for MBK Durham. I am reaching out again to advocate for the creation of a My Brother's Keepers Durham Advisory Board to provide the leadership and accountability required for a robust collective impact strategy that can transform the quality of life of boys and young men of color. In addition, I ask commissioners to direct staff and Dr. Sowell to support a revised Boys and Young Men of Color local action plan for Durham County by a cross-section of stakeholders to improve the coordination, strength collaboration, shared responsibility, and systematic reforms with clear goals, measurable outcomes, and timeframes to inform collective impact strategies in partnership with the City of Durham and Durham Public School Board of Education. We want BYMOC to thrive, not just survive. According to data from Durham Police Department, over 95% of the city's gun violence victims are Black boys and young men. According to academic achievement, proficiency, and discipline data from Durham Public Schools, boys of color, specifically Black boys, are the lowest percentage that are minimum grade level proficiency and college and career readiness, while also having the highest short and long-term suspensions and dropouts since 2015. Unfortunately, the most juvenile and confinements at the youth home have consistently been black boys. We have a systematic problem that requires a systematic change. We are not doing enough to educate, equip, and empower boys and young men in color in Durham. The data shows we are failing them and they deserve better. Similar to Durham Early Childhood Action Plan and Durham Master Aging Plan, commissioned by the Durham County Board of Commissioners, we need the Durham Board of County Commissioners to actualize and operationalize its commitment to boys and young men of color by directing the new county manager to serve the My Brother's Keepers Durham Advisory Board and a revised Boys and Young Men of Color Local Action Plan to build and sustain a transformative ecosystem to serve as a living, breathing document that guides work and is reported out and is accessed and evolved as necessary. While I understand the administrative is engaging in an operational assessment of MBK Durham to conduct an analysis and evaluate operations and process to identify opportunities for improvement, stakeholder engagement is essential if we are to ensure MBK Durham has the leadership, governance, structure, and community support to build and sustain an ecosystem to provide responsive services that ensure boys of color enter school ready to learn, reading at a level, graduating from high school, ready for college and career, completing education or training, and successfully entering the workplace. The Charles Hamilton Houston Foundation Incorporated will continue to work tirelessly to ensure boys and young men of color in our Young Men of Excellence program and Career Pathway program gain the skills, experiences, and support that will empower them to reach their potential through education and training to achieve career success and economic sustainability and mobility. We welcome for the opportunity to work with the administration to coordinate this effort for this critical and important work to begin without further delay. In commitment of service to boys and young men of color, DeWarren K. Langley. Comment number 2, Chris Tiffany. Public meetings should not be exclusive. 6:30 p.m. to 8:30 p.m. candidate meetings at Holton Career and Resource Center. Despite complaints for years, local government has held their meetings there when the bus does not stop there. Gentrification excludes people. That's the point of gentrification. Poverty reduction by displacing the poor, even poverty reduction initiative, and similar meetings held where bus riders repeatedly have reported and been called riffraff. Riffraff are scavengers who steal from the dead, old and poor. We are despised by local government, even called animals, poor monkeys, and criminals and liars, as well as riffraff, and then they want us to vote for you. Actions speak louder than words. Consistent with the complaints from teenagers and their parents that cops, they're turn away people who do not come in a church van or a Mormon Boy Scout van or in groups with cars. Twice I've gone already early to public evening meetings there, meetings with public notice and local papers, because public transportation still does not go there in the evenings and are turned away by cops there, not even allowed to wait in the lobby, told to get out, even when it's obviously raining. Y'all gonna continue to do that to people. Like again, parents with school-aged children and other members of the public, old and poor or handicapped, who use public transportation to try to get to venues where we are obviously not welcome. Selected invitees only.
Thank you, ACO. And thanks for the citizens who send those comments in. Thanks a bunch. If there are no other comments from the public, and just for the community to just remind them that this is a time on our work session that they have an opportunity to come in and make comments. And I know that it's kind of getting back to the schedule of what it used to be after 2 years. So it's getting familiar with the process again. At this time, we will go, I don't think it's anything else other than moving on to our consent agenda. We have 13 items on our consent agenda, and these are items that our board has discussed, and there may still be questions. So I'm going to ask our Manager Sowell, if she will go through the consent agenda and allow commissioners to ask questions or board members that they have. Thank you.
Thank you, Chair Howerton. So we will begin with 220156, the Budget Ordinance Amendment Number 22 BCC 00078, Public Health, to recognize $262,706 from the NCDHHS Division of Public Health Women's and Children's Health Section, Children and Youth Branch, to support school health nurses and school health serving positions to provide services to students. Are there any questions with that? Vice Chair Jacobs.
It's not working. Oh, thank you. Thank you.
Better.
So it's wonderful to see this funding. And when I was reading the description, it looks like it could be used for not only school nurses, but social workers, health educators, mental health professionals. So, and it's for a 2-year period. So I was just wondering, Rod, if you could tell us, do you all have any idea how this funding might be used? Because I know we've had challenges with hiring school nurses. So will we be looking at maybe using it for some of these other related positions, possibly?
Good morning, Madam Vice Chair and Chair Howerton and other members of the board. It's a pleasure to be here. We have given some thought to how we want to use this. However, like a lot of other counties, this is a huge tranche of money, and we wanted to ensure that the funds were going to be extended beyond fiscal years in order to make sure those plans were coming into fruition. Just last Thursday, I believe it was, we had a conference call with the state, and they assured us that these funds would be extended beyond the fiscal year. So now we can really plan accordingly. We're grateful to this board because you all have allowed us to have additional school health nurses in every school. That's the plan, and we're continuing to work on that. But we do feel as if some other avenues should need to be approached, particularly around social work and around mental health. So the long answer is, long story short, we are in the planning mode, particularly given the fact that we know that this money is going to be extended. So we don't have to spend this in a very short period of time. I hope that answers your question.
Thank you so much. Yes.
Yes, ma'am.
Oh, Roger, just one other quick question. There's such a difficulty in finding nurses and hiring nurses. What's different that will be done now versus before in hiring nurses?
I believe now, Madam Chair, thank you for your question. Now that there are more therapeutics, there's more vaccine, more immunity in the community, we're now seeing a lot of nurses really come back to school health, particularly those nurses who were with us previously. They're now coming back. We feel confident that, again, with COVID sort of acting right, if you will, we'll start seeing a lot more. But we do have plans to have job fairs. We do plan to have a lot more interaction with HR in order to recruit robustly. But, again, the nursing shortage is still affecting everyone. The Great Resignation is still alive and well. But we are hopeful for the future. And most recently, we hired about 4 nurses in 1 week. So we are most confident that that's a sign that things are getting better.
Okay, great. Thank you. Thank you.
Thank you so much, Director Jenkins. Next agenda item, 22-0169, Budget Ordinance Amendment Number 22 BCC 00079 to recognize $5,000 in additional grant funding from the ABC Board to Durham Adult Drug Treatment Court. Any questions or comments?
I just had a comment. I just wanted to commend Roshana Parker from CJRC for the very detailed description that she gave us in this agenda action item about what it really means for participants in the drug court program and how this funding can be used for some of the wraparound services that really help somebody be successful, and how complicated it is that people need help with transportation, housing, all kinds of things. And I appreciate this contribution from the ABC Board, but I also wanted to highlight this because as we think about the use of our opioid funds, I think we are very fortunate in Durham County that we already have really excellent programs that have been up and running for many years that we know need more funding, and this is just another example. Gudrun, I don't know if you had anything else to add. I see you're up here, but just wanted to commend Roshana for this, what she provided to us.
Good morning, Madam Chair, Madam Vice Chair, Commissioners. I actually have nothing to add. We are grateful to the ABC Board for including Durham Drug Treatment Court in their funding list of agencies that they have decided to fund, and the additional money that they provided us actually came from them without asking. And we hope they will continue to support us in the future, because it's their funding allows us to try new things, and you know, some of the drug testing and the wraparound services that you mentioned would not happen without their support. So we're grateful to them, and thanks for acknowledging Roshana's hard work. Appreciate that.
Okay. Next item, 22-0185, purchase 2 BioQuell sanitizing systems for OES emergency vehicles via a sole source vendor, BioQuell Inc. Any questions? Commissioner Burns?
Good morning. How's everybody? First work session. Jim, I'm smiling at you, so you ain't got to worry. It's not bad. It's not bad. One, let me just congratulate you all. As somebody who's had to ride in a lot of ambulances with family members, you always want them to be clean and safe. So I actually do love that we're doing this. I had a couple of questions though about it, because I did read in the sole source form that it could be used for rooms or it could be used in ambulances. Is that something that we might be looking at later? Is that something we might test it out on, or are we just using it solely right now for the ambulances? So that was the first question.
So I believe the initial use of it would be for our ambulances, right, to make sure that we're able to turn them around, make sure they're really sanitized, decontaminated as much as possible. But the units are fairly portable, so they can be used for whatever use we need. If there's a reason to come inside of a room, we can use it for our training area, anything like that. So while our purchase is for ambulances, the units can be used for anything that requires some type of decontamination like that.
Okay, that was the easy one. At first, I had to read all of it when I looked at it last night, because I was thinking to myself, you know, usually when people think about an aerosol that's going out, you think about a fogger. But then I looked, so it's like 35% peroxide, right? So, okay, peroxide isn't going to hurt us too bad. So that's what it's actually spraying out. And I guess my question is, I looked at the capability statement, and it said like it could do 204.5 weeks. My other random question is, I imagine this is going to come with some cost, and I'm not penny pinching. How often does this thing have to be refilled? So that would be my like kind of other question.
Right, and I might have to defer to Chief Lockhart here with that.
How you doing, Chief Lockhart? Welcome.
Good morning, ma'am. The unit actually would be refilled with each use.
Okay.
And it's a vaporized hydrogen peroxide system, but it's a dry system. So that when you get into the ambulance after it's done, there is no residue, there is no moisture left.
Okay. Only reason why I asked, I'm just thinking about like the wraparound costs. I saw this like 66,000. I think I saw the 63. I'm thinking about continued cost, right? I just want to make sure that that's like baked in. That's the only thing I'm trying to kind of illustrate here. So have we baked in the additional costs? Because I see the ambulances running all the time. You know, we have things going in Durham. So, I don't know if we'd be looking at fund balance or if I know that we're taking the funding out of you all's current costs. So are we in a position to make sure that you all can continue to get the dry materials that you all need to make this thing? That's my only question because I didn't see this in here.
Yes, ma'am. We have money available in this year's budget for sustainment, and we'll continue to do that in the future.
I love when departments have their own money. Y'all have a blessed day. Thank you so much.
Any other questions or comments? Okay. 220189. Approved capital project amendment number 22 CPA 00024 and budget ordinance amendment number 22 BCC 00084 for reducing the main library upgrade capital project 6110 DC 094 by $575,000 in 2016 GEO bonds and increasing SL Warren upgrade capital project 6110 DC 097 by $1,580,746 using $575,000 in 2016 GEO bonds from main library project and a $1,005,746 appropriation of debt service fund balance to the PAYGO fund, as well as execution of a construction contract with Muter Construction for envelope improvements and interior repairs. I know we probably have confused some people, so, but are there any specific questions?
I would just like for Perry to talk a little bit about, for the public, for the public's knowledge, I mean, we as a board have talked about it a bit, but for the public to understand the timeline, the work that's being done there, because we've gotten a lot of questions about when is the library going to open, questions such as that.
Yes, ma'am. Good morning, commissioners, and thank you for your question. I think it's pertinent for me to give a little bit of backstory about this.
That would be great.
So the Stanford L. Warren Library has leaked significantly ever since I've been here, I started back in 2000. And so what we're doing is we're doing a comprehensive, a holistic repair improvement to address the water intrusion over at the facility. This includes above grade repairs as well as below grade. The crux of the issue is over at the Stanford L. Warren Library, the basement is below the water table. And so as you can imagine, the complexity, the challenges that we have to deal with trying to keep water out of that facility. And so it just creates a lot of other issues. You know, there's indoor air quality issues that have surfaced as a result of the water intrusion. There's constant repairs that we have to make to the plaster, to the sheetrock, just to all the interior finishes within the facility. And so basically what we're doing is we're going to have to go over there and remove the soil, subsurface soil around the building and apply a waterproofing application to address that below grade issue that I'm talking about. But there's also some tuck pointing to the masonry, to the around the steel lintels, you know, the concrete mortar joints. It's just a lot of work that has to be done. There's also some minor modifications we need to make to the roof. And so, as I said, it's a holistic approach to trying to address the water intrusion repairs and issues that we have over at Stanford L. Warren Library. And as far as the timeline, this work that we have that we're contracting, requesting authorization to contract with Muter Construction, their construction duration is 8 to 10 months. And so that's 8 to 10 months after we execute the contract, we will have the water intrusion repairs addressed. But in addition to that, the library also wants to sort of take this opportunity while the building is shut down to bring it up to standards that you see with the main library and the other regional libraries that we have in our system. And so that includes some carpet replacement, some improvements to the finishes, some painting, just some issues to address some of the damage, deterioration to the millwork. There's a lot of things that we want to do there. I would like to introduce our project manager that's going to be working on that. You guys may know him. This is Joel Jones. And so Joel is new to project management, but he previously worked with our general services department, and he has hit the ground running. And quite honestly, we're very happy to bring Joel on board with our team to help us with some of these projects. And so Joel will be leading this project, you know, from a day-to-day perspective. So, Joel, is there anything you'd like to add about the project?
No, sir. I believe Perry covered it pretty well. I know the library, with its historic presence, I mean, it really deserves the time and attention to see it through and do it right.
Yes, sir. Yeah.
Welcome, Joel. Welcome, Joel. And thank you, Perry. And we're looking forward to, given the other libraries, how gorgeous our other libraries are, we're looking forward to this one to come up to the same type of standards. So thank you for your work.
Yes, ma'am. Thank you.
Other questions?
Thank you, Madam Chair, and thank you for bringing that up and raising the importance of making that library as beautiful as the others. I do think our smaller libraries are such wonderful community amenities, and it's wonderful to see the county taking advantage of this opportunity to do structural improvements and also make it even more beautiful for the residents to use. My question is more of a general question, and it has to do with the transfer of money from fund balance. So we're moving some 2016 bond money, about $575,000 from that bond into this project, and then we're also transferring some debt service fund balance, about $1 million. And there's another, you know, we've had several capital amendments recently, or in the past, I don't know, multiple months, or always really ongoing kind of capital amendments where we transfer money from fund balance, sometimes from general, sometimes from debt service. I guess my question is there a way on the agenda action form? I just want to see what people thought of this idea, really, my fellow commissioners and our staff. But if we could have on the agenda action form under the fiscal impact section, something about how this transfer of money from fund balance is going to affect whatever fund balance the money's coming out of. You know, how does it impact whatever fiscal policies we have? You know, maybe some information about the amount of money left in that fund balance and how that amount of money compares to our target amounts. What do you guys think? Am I making any sense? Anybody else interested in this?
Let Claudia answer it.
I'm here. I know these section dividers. I'm here. Those are great comments and statements as well. What we can do is add some in the fiscal impact section of the supplemental form, a statement that speaks to it. We are at such a good place in our fund reserves as it relates to our debt service fund reserve, which has grown over the years purposefully as we have planned for liquidating debt related to the 26 bond referendum. As you may recall, when we established the bond referendum, we set an amount that we would charge to residents, and it's about 1.75 cents. We charged that next year, so we started accumulating fund reserves purposefully. So when it came time to liquidate those dollars, we could. That's a best practice. So in that reserve, as well as others, we have sufficient dollars. But I do, we can definitely add an amount. These are planned kind of expenses. You know, when we established it, one of our the comments our financial advisor made was that this is a practice that is best, but it also gives jurisdictions the opportunities as they need those resources to transfer either to other capital projects or back to the general fund. There are a couple of our peers, they transfer pretty significant amounts, and we've done it as well. For us at the macro level, we look at what is our beginning fund balance, and as we plan through the year, we plan to make sure we end where we need to be in a solid position for the end. Because our levels are not so significant, they're at the place that they need to be. These incremental adjustments will not cause any impact at all, but we definitely can add those statements.
That would be great. Yeah, basically what you just said, something in the fiscal impact section that quantified how this transfer is not going to affect the solidness of our fiscal position.
Oh, that's a great point. And what we can do, and we do need to come back to the board, and we can do that in May, we brought to the board some conversations about our financial policy and how we needed to refine that based on where we are with our levels. It's required to have a 16% undesignated amount. We're above that now. And so going forward, just sort of how that looks. So yes, we can definitely add that.
Thank you.
Quick follow-up, if I might, along those. Will that be enterprise-wide, or will we include other departments? Because I think, I hate to use a word that one of my other colleagues used, but I remember a couple of months back, I struggle with some departments, divisions, and agencies with their level of implementability. Thank you for that new word, Commissioner Jacobs. And so I would love to not just see that for the people here. Like, I trust that when Perry comes to us about something, it's because something that we need. He's got a financial advisor, he has an engineer, he's a project manager, he has a whole, gambit of staff. I would love to see not only how this might positively impact or not impact different funds and fund balance, but how it might negatively impact it. And if we're going to do it, then we need to do it for the school board as well, because there are significant amounts of lobs that are never used. If we're going to do it, we need to do it for everybody. I don't want to just do it for the libraries and not do it for public health. So I hate to put that additional work on anybody, but if there's a feasibility there, and not today or tomorrow, we need to see if we can do that for everybody, because, we've had to pay, I don't know how much in debt service. We've had to go back to the GAO. This is before me. So if we're going to look at it, I think we need to holistically look at it across the enterprise. So that would be my only thought.
Yes, ma'am. We can do that as it relates to any items that present fund balance of appropriations.
Commissioner Jacobs?
First of all, I think that's a great idea. I think in any of our agenda action forms, just having the context is helpful, because a lot of times we're approving changes to budgets, and we don't have the big picture of what is the context of that. So anytime we can get the big picture, I think it helps, as well as the fiscal impact, as you mentioned. I just want to say I'm really excited about this item. I know the community, as Chair Howerton mentioned, has been, questioning the library has been closed for since May, I believe, of, is that the right time period? Or when did the library close? It's been closed for almost a year. And I know this is an important resource for our community, but I appreciated all of the information that you provided to us, the reports, because, when they say a picture is worth 1,000 words, wow. Looking at those detailed pictures of, all the things that need to be fixed on the library building. It is a historic structure, as you said. I'm sorry, what is your full name? I know I heard Joel, but. Well, thank you. The photographs in the report that showed, this building it's about 60 years old, and if we don't we need to take care of it. And as Perry, you said, you've been here, it's been a problem for 20 years, so I'm glad that we are going to do it right so that it can last for another 80 years. And I also support the upgrading the interior and the lighting, making it more energy efficient, which is consistent with our renewable energy policy. So since we're going to be doing a lot of work on the roof, my question is, are we making the roof solar ready? And is that included in this?
Commissioner, it is not included in this. As you see, we've had significant challenges with trying to bring this project in some semblance of the initial budget. However, I will say that I know through Tobin's Renewable Energy Implementation Plan, we'll be doing an assessment on all of our facilities. And if Stanford Warren Library escalates to that, we'll certainly be doing something along those lines.
Okay, so in other words, if we start looking at that, it's going to delay it more? Is that what you're saying?
It's going to, yes, because again, we would have to do an actual photovoltaic study on the library itself. The footprint of the roof is not that large. Plus, we have all of the mechanical equipment on that roof. Mm-hmm. And so it just doesn't lend itself to a lot of photovoltaic panels per se. But again, as I stated earlier, we're going to do an assessment of all of our county facilities. And if there is any potential for us to do something like that at that facility, we will certainly be looking to do that.
Okay, well, thank you. And in terms of the interior work, is that going to track, you said 8 to 10 months timeline for the water intrusion? Will the interior work be happening at the same time?
To the best of our ability. Again, we don't want to go in and put new finishes in while we still have leaks. Okay. We have to address all of those exterior repairs first. Primarily, there may be some overlap sort of as we get close to the end, particularly as we start to do like punch list work and things like that. But again, we're in the process of actually really scoping out all of the improvements to the interior. And so we'll have a little bit more detail in the months ahead. But right now, that work itself is probably going to take another 3 months. I will say probably a month of that will overlap the 8 to 10 month schedule that we've mentioned before. So again, a little bit more to come on that.
So is there any date we can even say to the community by this time the work will be done, or it sounds like maybe another year, or?
I think it's safe to say another year. Again, we've just had a scoping meeting with the interior designer last week, and so they're going back, revisiting, and really doing a true assessment of what all it's going to take based on the work that we identified. And so we need to hear back from them, really, before I give you something any more definitive than what I've just stated.
All right. Well, we'll have a big celebration when it reopens.
Yes,
On the roof.
Right. So I'm going to ask commissioners, how many of you want to be here till 5 o'clock today? I don't see no hands. So I'm going to ask if someone else has said what you are thinking of saying, just say ditto. And so that we can get to the discussion items, especially on the agenda items. If we can move through those, if we don't have any hot burning questions, let's try and move through the consent agenda and get to the discussion items. Getting to the discussion items, the minutes that have been placed on the agenda, if it's 45 minutes, then at 45 minutes, I will hold that discussion to 45 minutes so that we can move forward, so that we can give the citizens that are here ample time to discuss their items, and we can get an opportunity to ask questions around it, get clear about them. I would just like to, with your help, to move through this agenda so that we are not here till 5 o'clock this evening. Does that work for you? If it doesn't, tell me. If you want to stay, I'm okay. I'll just have to take a nap. Let's go. All right, let's move.
All right.
It does work, it absolutely does, but I do think also this is our only opportunity to ask questions about work agenda items. So just keep, we have to be mindful of both and try.
Absolutely.
I hear you.
Yeah,
Howard,
absolutely.
appreciate it.
Yeah, and the consent agenda we've talked about before, and we want to talk about more.
This is the first
And if you have other questions, we can always send them to staff and have them respond to us. Okay? Thank you. All right.
And I will read quicker than ma'am. Yes, ma'am. So here we go. 220194, standard non-reimbursable utility contracts for the extension of the county sanitary sewer system. Any questions? And Mr. Assistant General Manager Mans probably needs to stay on standby. Okay, good. Okay. 220195, Evoqua, Water Technologies LLC, Contract Amendment for Utilities Division. Any questions? Commissioner Jacobs?
I just have a general request. We're starting to see a lot of items about pump stations, and there's been discussions about pump stations. I think it would be helpful if we could get a memo or something from staff with a list of, what are all the pump stations that the county has, what are their capacities, where are they located, what is the current capacity, what is the expected need, the age of those. That I think that would be very helpful. Thank you.
We will certainly do that. Next item, 220196, sole source exemption approval to purchase pump from Carolina Pump Works LLC. Next, 220197, emergency and scheduled repairs for TWTP contract amendment with TA Loving. 220198, hoist and crane services for TWWTP contract amendment with FHS Inc. 220202, budget ordinance amendment number 22 BCC 00083, appropriating $1,937,915 of general fund balance for the purchase of 7 ambulances through SAVVIK cooperative agreement for the Office of Emergency Services. Any questions?
Commissioner Jacobs?
My question about this is, I noticed that these will not be the idling, the stealth system, anti-idling, like we've just purchased the 5, and I understand that there's a need, but the fact that these are going to be diesel, is there any way we can hold off on these? And I guess I would like to understand, is there a plan, a schedule for replacing the ambulances and kind of the big picture on this?
Yes, ma'am.
Okay.
So the ambulances, we wanted to order them with the stealth power, as we did the 5 previously. With sourcing issues, the stealth power has not been available. The vendor couldn't commit to installing them on the ambulances, the 7 ambulances that we're going to be ordering. But we will be requesting a budget next year to be able to install this stealth power. So what we're hearing from the vendor is, just like costs are going up due to supply chain issues, the stealth power units are not available due to supply chain issues. So it's not that we're not going to install it, they're just not available to install. So we're going to get the ambulances on order so we can beat that mid-2024, which really puts us, if we had to wait, our fleet would suffer. And so getting the units in here and getting the chassis and the ambulances mounted, that'll hopefully allow the supply chain issue to catch back up. Then we'll order the stealth power and have them installed. It's a simple retrofit.
Great. I'm glad to hear that they can be retrofitted. But it would be helpful, similar to the pump stations, if we could understand, I mean, how many ambulances do we have? How often do we need to replace them? And kind of, what is the general plan? Just in a memo or email would be great.
Happy to do that. We do have 36 ambulances.
Okay.
And this is an aging fleet. It's been a while since we've had a significant replenishment, if you will. So happy to send an MO to the manager to get to you. And we'll also look at our fleet replacement schedule. So we're trying to level load. Obviously, asking for 12 in 1 year is not level loading, but due to the supply chain issue and just the sheer delay in getting it here, we thought it would be best to go ahead and make this request, but we'll send out our schedule as well.
Thanks so much.
Okay. Item 220204, approval of FY 21-22 contract for Bull City Community Schools project.
For the sake of time, I'll keep this one really short. I recognize that this is a pilot project that's been going on 3 years, so it clearly predates me. And I appreciate the fact that there was a scope of work added. I appreciate the fact that there was a budget added. Like, these are all, because I like to know where it's going. But what I did not see in there, I saw the survey from about some of the teachers. I recognize that we want to expand it, and we're looking at 7 other principals. My only question, and it's not really a concern before people, catch their hair on fire, I don't know what were the successes over the 3 years. So if somebody could provide that to me before we give any more funding, it's one thing to have everything and say this is what we're going to do for a new project, but this is an old project. So that means y'all should have 3 years worth of data. And to be completely transparent, I have had one community group reach out to me about some of the work that has and or has not been done at Lakewood Elementary. So at some point, if somebody could just let me see a community impact statement or just an email that says this is what we've been able to successfully do. It's on the consent agenda. It's going to go through, and I should have asked before now. I always get on my colleagues about, we got this on Thursday. Why weren't these questions asked before? So I leverage that on myself. So just know I'll be following up with you, Drew, and I won't hold anybody else. But I think it's a fair question to say, before we give you anything additional, what did you do over 3 years? I'm pretty sure it's a lot. I've seen pictures, but I need to see paper.
Thank you, Commissioner Burns. I think those are good questions. This is actually the 4th year we're in now.
Right.
And so the funding that's being approved right now is essentially for this current year. And so there'll be opportunities as well to kind of continue asking those good questions, I think, for next year's funding, which is, a question that will come before the board as well.
Yeah, and I had that similar question, Drew, is that we need to see what's been the impact. And I've been here when we approved this initially, so it's time for us to see the impact.
I agree.
Yeah.
Thank you.
Thank you.
Okay. 220207, approval of amendment to the interlocal agreement with the City of Durham for the Immigrant and Refugee Affairs Initiative. Next item, 220216, Budget Ordinance Amendment Number 22 BCC 00085, Durham County Library, to recognize revenue in the amount of $30,000 from the Durham Library Foundation awarded by the Forest at Duke for collections and annual Library Fest. Any questions?
I see Kathy I see some library staff here. I just want to say kudos for this grant and some of the data you provided us about how great the need is. with during the pandemic, how many people, over 300,000 ebooks checked out and over 100,000 audiobooks. So we know there's a great need, and excited about the Library Fest. So congratulations and thank you for your great work.
And don't you all just love the ebooks and the audiobooks and our ability to access that right from our phone? I just think that's fantastic. Just wanted to say that.
If nothing else, Madam Chair, that concludes our consent agenda items.
All right, cool. All right, let's move on to our discussion items. 220181, a mental health discussion. The board is requested to review a presentation regarding mental health, which will provide a broad overview of the range of traumatic events, impacts on children and families, mental wellness, illness, and a host of other important information. I'd like to invite Joanne Pierce, General Manager, to introduce the resource persons for this item.
Good morning to Chair Howerton, Vice Chair Jacobs, to commissioners. Glad to have this great panel to present to you around mental health, the mental health discussion, and so please receive this as information. Thank you.
Good morning. Can you hear me okay? All right, great. Thank you for the opportunity to present some information to you today. My name is Dr. Ernestine Briggs King. I am an associate professor in psychiatry at Duke and director of research at the Center for Child and Family Health and associate director for the National Center for Child Traumatic Stress. Joanne.
You're the first one doing this, so you're the guinea pig.
I know, it always works that way, right? Like give them
first person.
I know, right? It's always prepped and ready.
Can you just direct us to the next slide and we can just.
Sure. While he's doing that, I'll just go ahead and get started because you know most of this. The last 2.5 years have been filled with many lows and lots of uncertainty. Staying safe not only meant washing your hands. For many, it also meant lockdowns and quarantines, social distancing, and disrupting important social connections to lower the risk of transmission of the virus. It changed the way we worship, the way we gathered, the way we communicate with each other. The pandemic changed the way we educate our children, as many of us caregivers became teachers, and for some, it widened existing disparities in access and opportunities to learn. For our youth, it disrupted and changed the way they celebrated many key developmental milestones. Graduation, prom, college tours, and work opportunities. Our new normal was marked by new experiences, uncertainty, lots of loss, and grief, as we had lost over 983,000 individuals due to COVID-19 in the U.S. alone. The pandemic also highlighted and widened existing disparities and disproportionalities. COVID showed us that people of color were more likely to get sick, be hospitalized with severe course of illness, and die. It also highlighted the disproportionate rate of secondary adversities, economic, social, and health consequences. In some, the toll has been unprecedented, and for many children and families, it has exacerbated their experiences with trauma and adversity. When a child or individual feels intensely threatened or distressed by an event he or she is involved in or witnesses, we call that event a trauma. There's a range of traumatic events or trauma types to which children and adolescents and their families can be exposed. Child abuse, neglect, maltreatment, domestic violence, community violence, and criminal victimization, natural disasters, bullying, school violence, war, terrorism, political violence, and even immigration-related experiences and structural and systemic racism. Many of you may be more familiar with the term adverse childhood experiences, or ACEs. I was going to show you a slide that shows you the ways to think about how trauma, maltreatment, community violence, ACEs like parental substance use, parental incarceration, or even parental mental health problems, and other social determinants of health, poverty, homelessness, food insecurity, all play a role. Unfortunately, for many youth and adults, both nationally and locally, these experiences are prevalent. All right, thank you. I appreciate you. There you go. Yay. Lord Jesus. Help, Lord, help. All right, y'all. I'm going to flick through these. But really want to show you this notion right here, which is how these things are just so prevalent. It's estimated by the age of 16, 2/3 of our youth will experience a traumatic event. Trauma and adversity are everywhere. It surrounds us. They are embedded in the soil, and they are in the air we breathe. The research is clear about the long-term consequences of trauma and ACEs. We see long-term problems with health, chronic disease, diabetes, hypertension, cardiac problems, cancer, and in some cases, early death. We also see increases in mental health problems, most notably depression, anxiety, post-traumatic stress disorder, suicide, and substance use. In fact, the Surgeon General, in a report released in December, declared that there is a mental health crisis hitting youth. The pandemic and other major issues, income inequality, racial injustice, the opioid epidemic, and gun violence faced by their generation are causing devastating mental health effects. We know between 2007 and 2018, suicide rates among young people ages 10 to 24 increased by 57%. And early estimates show more than 6,600 suicides among this age group just in 2020 alone, 53 in our state of North Carolina. More startling are the growing rates of suicide among Black children under 13 years of age, as Black children are more than twice as likely to die from suicide than white children. Suicide is the second leading cause of death for youth in North Carolina, ages 10 to 18, and the third leading cause of death for those ages 19 to 34. As you can think, and as probably you've even experienced yourself, the toll has been remarkable. The toll on our workforce, the toll on our children and families. There's a silver lining in there in that we know that we have good treatments that work, that are supported by the research to address trauma and mental health issues. Unfortunately, children and families are waiting on long lists to access quality mental health services. The cases are unfortunately getting more complex as it's taking its toll on the mental health providers. We have to prepare the workforce and look to innovative solutions such as trauma-informed schools and trauma-informed communities. I'm now going to hand it over to Tara Bowley, who will provide more information about mental health and mental illness.
Thank you, Dr. Briggs-King. My name is Tara Bowley, and I am a clinical associate professor at the University of North Carolina, Chapel Hill School of Social Work. I'm also a licensed marriage and family therapist in practice here in Durham. And so I'd like to just spend a few minutes with providing some information about an overall kind of state of how does a community treat and perceive mental health. I think it's important that we start by just really distinguishing between the difference between mental health and mental illness. We are hearing a lot about mental health now everywhere we look. And unfortunately, many times when we hear that term, we're thinking mental illness is actually what they're referring to. It's important to recognize that mental health is something everyone shares. And so as Dr. Briggs-King shared, we know that there are certain formative things that happen prior to the age of 18 that impact adults' mental well-being. And then once we become adults, we recognize that we are still in the process of taking care of our mental health throughout our life. Mental health involves a combination of things that are around our thoughts, not just how we think, but what we think about, our ability to think, as well as the content of what we're thinking. It also involves our emotions, not just that we have them, but how we experience them. Are we allowing ourselves to experience a full range of emotions that we have the gift of as humans to experience? And it also impacts our behaviors, what we're doing and how we're doing, particularly as we think about what we're normally doing when we are mentally well. Mental illness is actually when a person develops a problem in those areas. So a mental illness is when a person starts to recognize that there's a change, and this change in their thinking, in their feelings, in their behaving is causing problems in their life. It's causing problems perhaps at work, perhaps in school, perhaps with their relationships, or maybe just getting out of bed and getting dressed and doing what needs to be done during the course of a day. That's what can trigger or make one aware that perhaps this is more than just something I'm going through temporarily. Perhaps this is something that needs more attention. So it's important for us that we distinguish the fact that just like our physical health, we also need to maintain our mental health. And in spite of what some of us may have learned in our high school class in psychology, it's not as simple as nature versus nurture. The fact is it's both. It's a combination of what we inherited, of what is in our DNA, as well as our environment. Just like with physical health, we also recognize that certain things like nutrition, routine care, and our lifestyle impact how physically healthy we are. With mental health, it's similar. All of those things matter as well. But in addition to that, social connectivity. How rich is our social life? What is our community like? Is that community supportive of us? Are we fulfilled in our intellectual pursuits, in our spiritual realm and community, as well as our financial and occupational realms? So it's important to also recognize what might make something a crisis. We all know what a crisis is related to our physical health, right? We know why people go to the emergency department generally. But when we think about a crisis with our mental health, generally it's something that other people may identify as a crisis because we don't always know if it's a crisis. So when someone is posing a danger to themselves or others, or just unable to care for themselves or others, that's typically what we as a society constitute a crisis related to mental health. Some of the things that we know is sometimes professional help, many times professional help is most helpful before a crisis or to ward off a crisis. And so at those times when a person may recognize, I've been through something very traumatic, and it's bothering me in such a way that it's impacting my ability to be effective at work, or it's impacting my relationships, might be a good indicator that professional help is needed. Or sometimes a person just has a series of life events over a period of time, and their coping strategies just aren't sufficient. Or maybe they haven't had time to get over each of those things. And so they recognize that they're consistently feeling beat down, and just are unable to have the resilience to pull themselves back up. So sometimes it's also professional help can be important when a person just recognizes something's just not right. I just don't feel like myself, and I just need to talk to someone to figure out what it is. I don't know if it's physical, I don't know if it's mental, but something, I need help. So then the next question we might ask is, what type of help? So recognizing that our community has a plethora of options, I'm going to speak specifically to how to get help for people who are in the private sector, who have employee-based insurance, or who are have self-pay insurance, and my colleague is going to speak more to the public sector just shortly. So types of help, we know that there are facility-based help. We know there are hospital-based and residential programs. There are also day programs that people can go to that are several times a week, and this is for help related to mental illness as well as addiction. Then there are also many types of community-based help, which are people with offices in your community. Many of them are providing teletherapy now, so there's options all over the state to get services, and this can cover things like medication, individual therapy, group therapy, family therapy, and other types of support, including peer-based support. Where do I start? How do I find a provider? For many people, that first conversation happens in their doctor's office, when you visit your primary care physician and just get that screening that many of us get. How do I get help if I need more help? Get a referral from your primary care physician. Another option would be if you have an employee-based employee assistance program. Many times you can get free mental health treatment for a certain number of sessions to just get that assessment going. Referrals from people who've had good experiences with a therapist or with a program are really helpful ways to get in, as well as just searching online. I've provided a few resources for websites that people can peruse to find somebody that they feel like is a good fit for them. It's important that people feel that the person that they're getting help from understands them and represents them in terms of their background as well as their particular nuances to the help they need. How do I pay for it? For people who have employee-based insurance or who are self-insured, many times they can do in-network or out-of-network providers, just like with your physical health. Some people will actually pay out of pocket and use that funding towards a deductible, particularly those with a high deductible health insurance plan, and others can use their health savings account to pay for it. There's also self-pay options, and although sometimes the rates may be high for some people, all therapists provide some level of pro bono services and have some type of a sliding scale. It's a part of the ethical guidelines. With that, I will turn it over to my colleague, Ann Oshel.
Thank you very much, and I just want to express our appreciation to the commissioners for recognizing how important it is to continue to talk about mental health. As the Durham Center, which eventually grew into Alliance Health, our business has been behavioral health for decades. I have personally been in the public mental health system for more than 30 years, and the last 2 years have been unprecedented times, and I will have to say in my decades, I have never seen a mental health crisis the way we're seeing now. And I don't know if you saw the news this morning, but they are actually thinking about adjusting the start time for high school kids to address better mental health through sleep even. So, we are looking at it from all the different facets in ways that we're just not talking about what service people are receiving, which is why I'm particularly appreciative of having Dr. Briggs King and Tara here. I've had such admiration of them for years. To have the Center for Child and Family Health in our backyard is a gift. One of the things that we've talked about for years is, when you hear these statistics, why aren't more people coming for help? 1 in 4, 1 in 5 Americans would meet the clinical criteria for a diagnosis, and less than a third of them will actually seek any kind of help. Even with the services that Alliance provides, we have unauthorized outpatient therapy, meaning that is the kind of the lowest cost, start here type of service, and we unmanage those so that somebody can have up to 20 visits without asking permission for us. And if somebody comes to more than 2 or 3 sessions, we consider that to be a success. And so as we think about how we emerge from the pandemic, especially the effects on our young people, I think we'll hear kind of some new language around trauma that we haven't before in relation to how you kind of survive and thrive in a pandemic. And so what I want to talk a little bit about from the public point of view, because Alliance is responsible for providing care and coverage to the most vulnerable citizens here in Durham County that have Medicaid or are uninsured. And everything that Dr. Briggs-King talked about in terms of just the kind of the upheaval in crisis we have seen over the last year in particular. I think, in the beginning of the pandemic, which is 2 years ago, about at this very moment. This is the most stressed up I've been in 2 years. So that was, there's all kinds of things that we have to begin adjusting and thinking differently about. And so in the last year, we have seen our crisis facilities, our emergency departments, especially with young people, filled beyond capacity. And these aren't kids coming who just have kind of hit a rough patch in life, and these are kids that are seriously contemplating suicide. And so for us, the opportunity to have also unprecedented amounts of funding and to think in our communities about how that money can be well spent, and we can begin to pilot different ways and different strategies other than thinking about it in terms of people just coming for a service. That's important. But I think, when you look at vaccination hesitancy and the different types of work that it had to do, I think we're going to have to treat behavioral health in the same way. So I won't go through this, but, when somebody calls for help, and this is the experience if you call Alliance, is the experience if you call any health plan, commercial or public, requesting services, 2 things happen right away. First, all services are voluntary unless you're a danger to yourself or others. So if you're concerned about a loved one's level of depression or anxiety or psychotic symptoms, you can call and ask for help, but we won't be able to set up an appointment until that person asks for themselves. And clearly that is to protect somebody's confidentiality, but all services are voluntary. The second thing is that no matter what you're calling for, and our access and information line, some people call just to find out when trash pickup is. It doesn't matter what you are calling for. The first thing that will happen is we'll do what we call a lethality assessment. We're going to ask you, are you thinking about hurting yourself or somebody else? That is just standard on any call for service, because the first thing we want to do is rule out that it's a crisis situation. And we have different levels of response of when we have to schedule appointments based on if something's routine, emergent, or emergent. And everybody's call center is connected to 911. We have some pretty elaborate ways to stay on the phone with somebody until we dispatch EMS or the police even. On average, by the time somebody calls to the time we set up an appointment, if it's a routine appointment, it's less than 4 minutes. So this is not the point where you have a full assessment. That happens when you actually get to a service. And I just put some parameters on there. We're required to answer the phone in 7 seconds. The last thing you want is to be on the other end of a lifeline and have it just ring. So there's several things to which Alliance's performance for our call center is measured upon. So, you've heard from Alliance around Medicaid transformation. And we are still deep in Medicaid transformation, and there's several more kind of phases of this to go, including when Alliance becomes a tailored plan beginning in December. And we can certainly continue to have that conversation around the impact of how people receive coverage and how people receive care when you have kind of multiple health plans serving the same community. But I'd kind of keeping to the access to care, standard plans, which are the United Healthcare, the commercial plans that have come in to take Medicaid managed care, which, they are responsible now for the bulk of outpatient services. Alliance will continue to serve those that have more intensive needs. So the majority of people that call that are just kind of hit a rough spot in life will most likely be referred to a standard commercial plan. But our call center requirements are the same regardless. So just as I described what Alliance does, all of the health plans do that. If somebody calls because they just know Alliance's number, it's definitely a more familiar number than some of the newer numbers. If somebody calls and they're not eligible for our services, we do a warm handoff to the member services line on the health plan to which they are already covered or to which they choose. So there's definitely more bureaucracy in some of this for people to navigate, and we really try to streamline, especially for people seeking substance use services, because, by the time they call for help, you want help delivered right away. And you don't want to say, well, I'm going to hang up with you and you have to call this other number and get an appointment that way. So we continue to work as a system serving Medicaid recipients, making sure that all of that is streamlined in the best experience as possible. But if somebody calls in a crisis, it doesn't matter whose phone number they call. It is the obligation of that health plan to make sure that people get the emergency help that they need. And as you know, in Durham, you all have funded a really robust crisis service for us, regardless of insurance, from our behavioral health urgent care to our facility-based crisis. We have now inpatient beds at Duke Regional. The first week those beds were open, they were full. We still have a capacity problem, and we have more resources here than even some other counties that Alliance serves. So I just want to mention a little bit before we offer some of our 2 cents in the ARPA funding that is before the commissioners now of the changing landscape of healthcare. When I first moved to North Carolina, I was a clinician inside an area authority. It was, we served generations of families. Everybody came to the mental health clinic, and it used to be down on Main Street. We've now torn down that building, but, I saw generations of people who had just come to the clinic to see their therapist, to see their doctor, and that's how people got care. And it's changed a lot over the last year, and definitely in some ways that we think once we settle down with the system, it offers more now than it has in the past. And one of those things is that this whole notion about how we're buying health and not just health care. We used to think health care happened in an appointment in the four walls of some building, and now we realize that community-based care shows a better impact. People are more satisfied, they're more engaged in their care if it happens kind of right in their own cultures, in their own communities, in a way that's the most comfortable for them accessing that help, and not taking 2 bus transfers just to get to a clinic at Duke. And you would see all throughout Durham efforts to move health care services into more community-based care. We could not ignore health inequities and disparities before COVID. We definitely cannot turn a blind eye now to what this pandemic has exposed. And again, in setting up services that are much more culturally sensitive, so that if somebody would like a service in their preferred language, we're not connecting them to a translator. We actually have somebody who can speak that language. And then Medicaid transformation, I'll spare you, other than saying it's complicated. It's really complicated, and there's things that Alliance is doing to make sure that, again, people stay engaged in services, they get to the right place at the right time the first time. We can certainly talk about that at a later time. But I will say that, that there's still turbulence in the system. And in a few months, the state is intending to release an RFP for a statewide children and family foster care plan. And yes.
Could you repeat that? I didn't hear it at all.
Oh, sorry. Yes, the train came right at that moment. That was my drop the mic moment too. So, then in a few months, the state is planning on once again kind of releasing another statewide children and family specialty plan, otherwise known as the foster care carve-out. There will be one statewide vendor. If that is not Alliance, then all children served in Durham County foster care will go to another plan. And so more to come on that, but as the timing of some of these changes coinciding with the timing as we are moving out of the pandemic is probably less than ideal. And then Tara had mentioned telehealth. One of the things that we quickly pivoted, when you think about an entire service system that had to go to virtual, I mean, everything from our most intensive ACT teams to how people had methadone dosing. I mean, for the first time ever, and before COVID, we would have never done a methadone dosing on a sidewalk. And all of a sudden, we were doing methadone dosing on a sidewalk. If somebody was in quarantine, we were figuring out how they could have at-home dosing. We were delivering Narcan to every hotel that had people that were quarantining. I mean, it just turned it completely on its ear. And one of the things that we've discovered, both kind of even for the Medicaid population, is that there's a group of people that still would prefer to have telehealth. And you might have seen some commercials. Simone Biles has become a spokesperson for a national kind of call line. So you don't even have to get local care anymore. You can call a national telehealth line. And, in all of these, it remains to be seen if it forever alters how we deliver services, but it's definitely not anything that if the pandemic hadn't happened that we would have seen the increases that we're seeing now and how people choose to receive care. And then the last thing we appreciate kind of the difficult decisions about how to think of ARPA money. I mean, never again will we have kind of millions and millions and millions of dollars being infused in the behavioral health system because of a pandemic. And I have said to my boss, if we ever have another pandemic, that's the day I announce my retirement. I've done this once, and now we need to be smart about how to use some of this for our advantage. And so we just have a few considerations as you all decide what's best here in Durham. And that's, we really do need to figure out the problem that we're trying to solve and fund it to impact. One of the things that the behavioral health system, even at the federal level, is kind of typical for us is we'll fund something for a year we'll request $500,000 and we'll give it $50,000. We'll request 4 years, we'll fund it for a year. I mean, there could be some larger signature items like suicide prevention, access to care, to increase the capacity of both kind of where and what people can receive. It is, especially early on in the pandemic when people lost their jobs and they lost their health insurance, that we have got to reinstate. Insurance and access to services go hand in hand. It is so much more difficult for people that are uninsured, especially in a non-Medicaid expansion state. The considerations for strategically and purposefully funding along a continuum, one of the things that Dr. Briggs-King talks about all the time is let's not wait till kids are just this symptomatic that they're contemplating ending their own life or they're afraid to play outside because of the dangers that lurk. Let's think about kind of the early signs of trauma and at risk, and let's fund it across a continuum. And I know this is something that Alliance, is continually trying to figure out. If we spend all of our money in the most intensive services, how do you get upstream? How do you really think about prevention programs? And prevention works. The opportunity for innovativeness and proof of concept. With 2 years of ARPA funds, we can make some assumptions about community-based care. We can test those assumptions, and then we can decide from there what might be sustainable programs that have showed some promise and move the needle on some things that we're most concerned about. And then the addressing service gaps in holistic care. We talked a little bit about addressing the social drivers of health. This is another area where the commissioners have been very generous in the work of Alliance, and that's in housing. The next thing we should all be concerned about is the number of newly homeless, especially families. And if you don't address that early on, that's how people become chronically homeless. And we just received a SAMHSA grant for about $230,000 to provide supportive housing for families that have been impacted by COVID. And these are not people where we're waiting for schizophrenia. These are people that have probably never accessed mental health services but been negatively impacted and have lost their housing, lost their sources of income. And so we're piloting that program now here in Durham. It's called Durham Rise. And then the last thing is around the cost sustainability. You know, one of the things that we would be interested, just from kind of the Medicaid as a payer, there are, you know, we are not the only payer, we shouldn't be the only payer, but Medicaid is a payer, and thinking about the cost model of any potential funding using Medicaid as the sustainability cost model beyond the initial ARPA money. So to really think about what are those sources of revenue beyond this initial 2-year funding, we would be happy to be part of any conversations regarding that. We've done some cost models of looking at different types of services. So that's kind of, I think, the end of and I don't know where we are on time, but I'm sure Joanne somewhere around here will let us know if what time is remaining for questions. But thank you again for this time.
Thank you, Anne. Pronounce your last name for me.
Bowley.
Bolin?
Bowley.
Oh, Bolin. Bowling and it's Briggs, right?
Briggs King.
Thank you all for this report, and I think you've heard from most of this board that this is a serious conversation for all of us. I know, Ann, you've heard me in the directors meeting really lifting up this conversation because it's something that we are really committed to. I just have one question and then have the board see if they have any questions. Ms. Bowling, you mentioned something about your conversation about suicide, the rate of suicide, and Black children are more likely to die from suicide.
That was actually Dr. Briggs King.
Okay, the wrong person. Okay. But this conversation is, and also the cultural aspect of suicide and what happens in our culture and how it impacts Black and brown people from birth, that our society damages Black and brown people from birth, that the issues that we have to deal with from a cultural perspective, and then they go to school. So Black and brown children are traumatized, as Black folks were traumatized right away when we come out of the womb. So when you talk about trauma, where is the beginning of the stage to even be able to begin to attack that?
Yeah, that's a good question. We know that stable, safe, and strong families, stable, safe, and strong, nurturing families are a good place to begin to create some level of protection around children. So if we can strengthen families, right, and provide them what they need to be in healthy, both mental health and in terms of their physical health, then we have a starting place to protect kids. But we can touch kids in every point of the system they touch, in their schools, in their communities, in their daycares. We have the knowledge to think about strategies to avoid trauma, right? Some of it you can't avoid. You talked about the racism that is so prevalent and so part of the context. But there are other things that we can do to really prevent mental health issues from forming and really foster what Tara mentioned in terms of that resilience, that thing that we know can help families bounce back. And part of that is connection, right? We know that when you have strong connections, you have the opportunity to change the course of children's lives. And so whether it's a school system, whether it's a community, whether it's a church, we have to think around holistically around how kids operate, how they move in the world, and think about in what ways can we strengthen all of those systems that touch children and families?
And then the other piece of that, I would guess, would be the people that are operating with these kids.
Teachers,
Yeah,
guidance
and
counselors.
Do they have the facility to address their own trauma?
Yeah. Well, you know, in the pandemic, we are working through it, right? And so we as providers are living this life, right? And so we have to make sure that our providers, our mental health providers, get what they need to navigate successfully so that they can pour into the children and families that they serve. And so, you know, part of that is attending to the needs of the workforce, giving them the training that they need, helping them to understand how trauma impacts mental health and what strategies could be used to mitigate those adverse effects. And so part of what we do at the Center for Child and Family Health is train providers across all 100 counties of North Carolina on what we call evidence-based treatments. And these are treatments that work. We're doing it in Durham Public Schools. We're doing it all across our county, but we need more. We need more providers to be strengthened and get the tools that they need so that they can serve children and families. And then we don't have to stop with just providers. We can think about supportive people in all of those points of contact in the schools, right? And so right now we're working with guidance counselors, we're working with teachers, we're teaching them about the impact of trauma and how that shows up in their classroom. They can't teach kids ABCs and math and science when they're struggling with the traumas that they're facing on their daily lives. We have to have some opportunities to do that. So when Ann talks about prevention, those are the types of upstream interventions that we need to invest into our community to really make a difference.
Thank you. Thank you very much.
Thank you. Yes,
Commissioner Burns.
Commissioner Burns.
Good morning, ladies. I like saying that, good morning, ladies. 'Cause, you know, we're ladies, so I appreciate it. I will be very quick, and so if I start to talk fast, please don't take it personal. I just want to give time back to my colleagues. Let me see, Dr. Briggs-King, Ms. Bowley, and Ms. O'Shea, thank you all so much for being here today. So really, really quick, Commissioner Howerton jumped on a couple of the things that I want to go to. I did want you to restate the fact, though, because I did look through the PowerPoint presentation. I think you said it around slide 2 or 3 where you were saying that black children, is it twice as likely to be suicide? It's not on the slide.
It's not on the slide.
Yeah,
It's in my
she
notes.
read it, which I have no idea why, because that's what we need the public to see.
Okay.
I want you to say it again. If
I will make
is
my
it
notes
twice as
available.
likely
To die than white children.
Between 10 and 18.
And those are children, we're talking black children under the age of 13.
That's what I wanted to hear.
Under the age of 13.
And I don't know if you know these women who were sitting behind you who are about to be a part of this presentation. But see, I see y'all. Y'all need to see y'all. Because we're talking about black maternal health. So we got these ladies fighting for babies that not even going to get here. And we have you ladies talking about black babies who are not going to make it to puberty. So what we need to do is make sure that y'all talk to each other. So you can't do it in here because we on time. Y'all need to go in that foyer. Y'all need to have a prayer meeting. And then y'all come back to us and we figure out what we can do. Can y'all do that?
Okay, we can
So
do
that's
that.
the first item of business. Secondly, I'm going to come back to you because you mentioned the SAMHSA money. Now, I'm going to mess this up, but it is substance abuse and mental
Health
addiction.
services.
Am I make somebody say it? What is
Substance
SAMHSA?
Abuse and Mental Health Services Administration.
Thank you. So I know that you all said you got $230,000. Now, somebody keep me honest, if I'm not mistaken, because thank you, NACO, National Association of Counties. They got about 2 bunches of ARPA funding last year. I think it was $3 billion in May and $1.5 billion in March. So I'm imagining that 230 that you all got was non-competitive out of one of those tranches. Correct? Okay, did you all, the only reason why I'm asking, as we're thinking about ARPA and thinking about what we're doing, one of the things we always talk to our public health directors about is how can we make sure we're coupling this? I would never shortchange any of this because I imagine that the social workers need a break, right? There's a reason why this board voted unanimously to make sure we had more social workers in school. But I've read so many articles about the therapists need a break because we are driving them crazy, right? Because we're going to see them. And I thought about something that you said about the therapists now need to look like the people talk. I have one of my girlfriends, she went to her therapist the first day, and the woman said, "I don't vote." She says, "You have a blessed day." Like, sis, we are not equally yoked because you don't vote. So she left the therapist. I don't think that should have been a litmus test. Maybe my friend's crazy. I don't know. Maybe it's not politically correct to say crazy. But my question is, as we are getting closer and additional tranches of money are coming down, my question to you is, do we see an additional, and I know it went to the states, and the states gave it down to the counties, so I won't put, I think it's like 23 states. My question to you is, do we see another tranche of that unrestricted funding possibly? And to be clear, that will not keep me from thinking holistically about how we can support you. But do we see a third tranche possibly?
Do we see a third what?
A third iteration of funding, because they've done two. They did May, they did March. Do you think we'll see it again?
Well, maybe, but not likely.
Okay.
All of our COVID relief money, we did boost to rates for service providers. We did a number of things. Commissioner Carter's on our board. That COVID relief money expired March 31st. There are some federal COVID funds that are extending till June 30th, but we think over time that money will decline and then no longer be available.
Last thing, I ask people this all the time. I'm asking you all to do it the same. You mentioned that there's a Foster Care Cover Act. There's a RFP that's coming out, and you said that in the event Alliance Health does not get it, that there's a chance that Durham's children will have to go to somebody else. I must say this in front of all of y'all. If you all need us to write a letter of support so that our children can get the support that they need from people in this community, by all means, I don't think any of the 5 women on this board would say that we would not be signatories on a piece of paper supporting you all getting that RFP, getting that funded. Thank you.
Thank you.
The foster care bill that's coming through, money, is that the same one that we've been working on for years with the
So
legislature?
there's child welfare transformation happening on the DSS side, and then there is the Children and Family Services Plan that is happening on the DHHS side. And those are independent but entwined. But in terms of funding, they are treating them fairly independently.
Okay. Commissioner Carter and then Commissioner Alam. We've got about 10 more minutes.
Thank you, Madam Chair. I'll try to be fast. First of all, I want to follow up on what Commissioner Burns brought up about the foster care carve-out. I know that Rob has some concerns about that and met with the commissioners who were on the Alliance board and asked if we would indeed craft a letter. I don't know if it was necessarily asking for Alliance to get the RFP. I actually think it was to change what the state's going to do in general to be more beneficial to children everywhere, but including in Durham. And so I'll get some more details on that and figure out what they would like for us to do, and I know we'll do it. Thank you all so much for your work, first of all, and thank you for coming here to us today to help us understand what mental health is, what mental health problems are, what drives some of that, what some of the statistics are that you shared with us, what the public health, mental health system is doing, just everything. I really appreciate it. I do want to say that I feel like, need more help in deciding how to spend the money we're going to get on what, mental health improvements we're going to try to fund in this county. What types of professional health, where do we need more of it? Where are the gaps? Do we want more supportive housing, suicide prevention, school-based mental health, crisis intervention teams, ACT teams, crisis facilities, peer support, eviction diversion? It goes on and on and on, and I don't know. And so I'm hoping that there is some sort of a holistic assessment that points out the gaps that will guide how we make our decisions. So thank you for any additional sort of help you can give us in that regard.
Well, I've been talking to Ann and also General Manager Hager about mapping that we need to do a mapping to know where is the services that we need? What is it that we really need? How do we target rather than just trying to do everything?
Yes, yes, thank you. I will say from the public mental health perspective, it's good, it's a good amount of money, but you can't do everything. And so I think in a lot of ways, it's the same gaps that we've always had, they've just widened.
And I would like to say one thing in support of, increased attention to school-based mental health. That's a system, and it reaches 33,000 plus children, many of them children of color. And I think that's a system through which we can work to improve the mental health of our children and families. And I'd like for us to consider how to do that as well.
May I add something, Madam Chair?
Who was that?
That was me.
Sorry. Knew I heard a voice, was like, where was it? Go ahead.
I'd just like to add one other piece of information to add to what Dr. Briggs-King had mentioned about, particularly with youth. One of the most important things in thinking about the lens of trauma and looking at our youth is the lens we bring when we see it. And so for many people, if they don't understand what trauma looks like and how it manifests in a young person, it looks like defiance. It looks like problematic behavior that many times draws the attention of law enforcement. And so it's so important that it's not just our mental health professionals that understand how trauma plays out in our communities, that it's also what we call the gatekeepers, the school systems, the teachers, the nurses, law enforcement, all the people who interact with our young people need to understand how a young person experiences trauma and what they do as a result of it, so that they don't inappropriately shift the focus in a direction that's going to determine the outcome of their life.
Yeah, that is so true, Tara. I mean, 85% of the kids in the juvenile justice system have a trauma history. I mean, if they had just gotten their trauma treated and diverted in a different direction, I wonder what their trajectories would have looked like. Yeah?
Yeah, the son that would still be alive today, if I had known, if his teachers had known the trauma he was dealing with, losing a brother and interacting with a police officer, that a police officer just shot and killed him. So the trauma of young people losing brothers and sisters is real. Yeah. And when they come in contact with law enforcement that have no idea that that person is just having a crisis, we lose them. I'm sorry, I'm just there. Commissioner Lum.
Thank you, Chair Howerton. Thank you all so much. This was a really great presentation and really informative. I wanted to piggyback off something that Commissioner Burns was mentioning about our next presentation.
Can you speak a little louder? We can't hear you.
Yeah, I think it's really timely to have y'all presenting back to back. And also I'd love to hear, Commissioner Burns was mentioning, like, y'all are here to provide the services to our children once they're already here and growing, and our Black maternal health partners are serving our communities and making sure that our children come and are healthy in this world. I wanted to see what type of mental health care services possibly could be partnered with y'all around like postpartum care and making sure that mothers have the treatment and access to care that they have. And I had one question that is kind of for y'all, but maybe Drew might also have some insight into it. I wanted to talk about like the accessibility of mental health care, and if there's ever been done an analysis for Durham County of health care deserts, especially mental health care deserts. And I know we have the annual citizen survey. Is that something, if we haven't asked those questions in the past, that we could possibly ask in the next annual survey, asking residents, do they have proper access to mental health care? And that way we can see, like when we're looking at funding like ARPA or other fundings, where is it most needed? And same thing, tying that into telehealth accessibility and how that will tie it into our broadband expansion plans, because there are parts of our community that do not have access to telehealth, and making sure we have that. And then, so that was kind of a question, kind of just like something that I've been thinking about. And then, what are ways, I know the city has started to do this with their 911 response center of having first responders or mental health professionals at the 911 center. And since the county runs its own, and I can reach out to Sheriff Burkhead as well to ask him about this, of like what is a possible partnership for Alliance Health and our county 911 response center.
So I can speak just from Alliance quickly on this. We, I think it's a great idea to assess if there are kind of pockets within the city and the county in which it's harder for people to access services. We, every year, we are required to do what they call a network adequacy report, and it's posted on our website. We, it is kind of all of Alliance, but it's also county specific. We do everything we can to reach as far as we can for people to give feedback in terms of both how they access services, how they experience services, and what would they like us to fund. So that's a wealth of information, but I will say that the standard for Medicaid is within 30 minutes or 30 miles. You know, so it is not something that we would prefer when we think about community-based care, that you think about kind of the pockets where kind of the, you know, we use a lot of census tract data. So we take census tract data, we overlay it with what they call social vulnerability risk data, so we can see, you know, what are the cost-burdened renters, what are people where the unemployment rates, and then we look at that information and we overlay it with Medicaid addresses. And we can do some really microscopic outreach to those particular zip codes and neighborhoods. You know, that's the direction that we're headed, to work with the county, and I'm sure Drew and I can have a lot of conversations about how we can make sure that, you know, from kind of the whole county perspective, the vast majority, probably about 90% of people that are on Medicaid recipients live within the city limits. And, you know, and so there's some things out of necessity, like our behavioral health urgent care is off of Chapel Hill Road, not the most convenient location, but the only location we could find. And so, you know, we think about the hours so that for people don't have to take off work, and for kids to be able to go to school and come if they need to afterwards. So we would be happy to explore that more. And we do work a lot with the public health department in kind of every facet. You know, and it's probably time to revisit that, as Rod has nothing but free time on his hands these days, you know. You know, to think about where that synergy is, especially as Alliance becomes a tailored plan. One of the advantages of a tailored plan is, and my guess is that as you hear the next presentation, you will see the opportunities in this, is that we will integrate physical health, behavioral health, and pharmacy for the most vulnerable. And so we will be required to address the physical health and the behavioral health across all components with that. So,
thank you, Ann. I think Commissioner Jacobs have a few questions, and we are going to, can you wrap yours up in about 3 minutes? If we can do that, we'll need to move on to the next conversation.
Thank you. Thank you all so much for giving us this big picture. And I think that next steps, we really need to hone in on the Durham specific data, and also, you know, what are our getting back to what your slide at the end, and understanding, you know, what are our current resources and what are the gaps, and that continuum of care. And I think that I would really like to see, we have so many people within Durham County government that are a part of the system, because we are the point of contact usually at the crisis point, whether it's in DSS or it's our community paramedics or law enforcement or in our detention center or in our homeless shelter. We know the prevalence of people who have mental health issues. So I would really love to see us build on all of our staff, public health, to get feedback, but to really get a grasp on what are people seeing who are working every day And then we do have a lot of resources, which we haven't really talked about. I think a really big problem is the fragmentation. People just don't even know where to find the help that we have. And I know Chair Howard and I have had conversations about having a call center or just one easy number, one call. You can call if you need help, and you'll get directed to the resources we have. It is just a very hard system to navigate. So I would really like to hear more about that. And also for us not to forget, we have an ACEs coordinator in Durham County government. We have an early childhood coordinator. We have an early childhood action plan. We're doing intercept mapping on our crisis response system. So we do have a lot to build on. But we told our community a year ago we had $1 million extra to invest in mental health, and we haven't done it yet. And now we're getting into our next budget season. We have the ARPA funding. So I really hope that we can pull people together and figure out how to make some investments as soon as possible, because it is a crisis. And we do have, frankly, people who don't have access to, do not have health insurance. And I would really like to see what happens with Medicaid transformation. That's new. And so I'll stop here, but I guess I'm really anxious from our manager to pull folks together. We have so much talent and expertise and resources, and to pull everyone together on this really important issue. Thank you.
Thank you so much for being here and bringing all this information. And I know we are throwing a lot of questions at you, and that means you see the passion and the heart for this conversation. Our manager is listening as well, so I think that means that there's some more small group conversations to be had.
Chair Howerton, can I make just one quick announcement?
Sure.
So May is Mental Health Awareness Month. And shortly you will have someone from Alliance come before you. Every year you sign a proclamation around Mental Health Awareness Month. We have already started some prep work leading into this, and which is really around healing in all of our broken places, about how we reemerge from the pandemic. And Rod assures me that COVID will cooperate, and we will have our Making a Difference breakfast in person again this year. We may not be able to have it kind of to the size that we have, but stay tuned for that invitation. And for our new commissioners who haven't been to our Making a Difference, it's a celebration of the community for every hero that we have that makes a difference in children and families every day. So I just wanted to bring to your attention that that May is Mental Health Awareness Month. We will also have a day where we ask everybody to wear green. Green is the sign of hope and recovery. And so you will see it all on our social media, and this year in particular, there are things both to honor and to celebrate. So thank you.
Thank you.
Thank you.
And Madam Chair, if I may commend General Manager Pierce for her work on pulling this great team together to provide this great update today. Thank you so much.
Thank you, Ms. Pierce. All right, our next conversation, Commissioners 220215, Black Maternal Health discussion. This is also a 45-minute discussion. The board is requested to receive the report of the Durham County Department of Public Health regarding Black maternal health. This report will provide information on the current process, programs, and efforts which address the state of Black maternal health. And I'd like to introduce Jenkins, Durham County Public Health Director, to begin this conversation. While you're getting ready, we're going to take 2-minute break.
so green is talk.
All right. Let's see, do I have?
Y'all can be ashamed of yourselves.
We need to, we need a food break. What you need? I can't hear you.
Oh, okay, good.
Hi. Oh, yeah, you want to present last? Sure. So you want to present after they present? Sure. Yeah, yeah. Yeah. Organize it the way you need to. Just organize it the way you need to. Okay. We're going to go ahead and get started. Jenkins. Go ahead.
Good morning again to our Madam Chair, Madam Vice Chair, fellow commissioners, Attorney Darby, and Manager Soel in absentia. As we approach Black Maternal Health Awareness Week, which is next week, by the way, we are grateful for the opportunity to provide information on the current processes, programs, and efforts which address the state of Black maternal health here in Durham. I am eternally grateful to public health staff, being led by Deputy Public Health Director Liz Stevens and Madam Director of Nursing Hattie Wood for bringing all this together, several weeks, lots of meetings. But more importantly, I'm very, very grateful for our community-based organizations that are represented here, taking time away. We know they're taking time away from care, and we thank them for being here with us. Presentations will go as follows. We will start with public health, and then we will turn to Dr. Maria Small. I'd be remiss if I didn't say thank her for being here, making arrangements so she could be here. And we will follow up by exiting and allowing our community-based organizations to come and do presentations as well. That being said, we'll turn it over to Madam Director of Nursing, Hattie Wood, to start our presentation.
Good morning.
Good morning.
And thank you for the opportunity to speak today. I'm speaking on behalf of the Durham County Department of Public Health. I am honored to serve in the role as the Director of Nursing and the Division Director for the Medical Services at the Durham County Department of Public Health. As Director Jenkins stated, Black Maternal Health Week will be next week, April the 11th through the 17th. And one thing that I'd like to note, that this marks the 5th year that Black Maternal Health Week has been recognized. This year, it was founded and led by Black Mama Alliance, and it's a week of awareness, activism, and community building. And there are several intentions of this week to deepen the national conversation about Black maternal health in the United States. We need to address that. Amplify community-driven policy, research, and care solutions. And there are several intentions of this as well. What I'm here to speak on today is what the Durham County, I'll give you the objectives of what we'd like to present. We want to provide information to you on the current processes that we have and the programs at the Health Department which address Black maternal health. Deputy Assistant Health Director Liz Stevens is going to present the data on maternal health clients who have accessed our maternal health clinic at the Health Department. We also want to provide information. Dr. Small is going to provide information on the impact of the COVID pandemic on Black maternal health as well. And we want to present to you resources that we'd like in public health that are required to invoke changes to Black maternal health outcomes. And then we will have presentations. The community-based organizations will be presenting to you their objectives of their summary of the state of Black maternal health in North Carolina and Durham County, reproductive justice, mission and impact of 3 local NGOs, CBOs, and those particularly are HEARTS, MAMI, and EBB, and the resources that are required of them to invoke the changes and to do this work that they do. And they would talk about equitable partnerships, shared decision-making, and funding. So what do we do at Durham County Department of Public Health Maternal Health Clinic? That's one of the clinical areas that I have oversight over. And we consider the whole area as women's health, and the maternal health clinic is embedded within that. So what we do is we have a lactation support that we provide for all of our maternal health patients. We now have a full-time nurse in that position, but its percentage of it is grant funded. We're asking if the county would fund this position 100%. The data shows that a lactation consultant is really decreases being able, breastfeeding decreases infant mortality. This lactation consultant, our nurse, she's a public health nurse specialist. She provides a one-to-one breastfeeding class that introduces maternal and infant health benefits offered to all patients, and she starts this at 30 weeks. We also have our centering program in the maternal health clinic, and that's an alternative to traditional-based prenatal care, and we've had this since 2004 in our maternal health clinic. COVID all came in and deterred us being able to provide this service for the last 2 years, and we are definitely looking forward to showing back up and getting our centering pregnancy program started back up. The evidence has shown that centering pregnancy classes decreases preterm and low-weight babies, particularly in Black women. So we will continue to do that great work as soon as we're able to open up our classes again. What we also do, we have our Care Management for High-Risk Pregnancies program, which is an awesome program. Having been with the county in public health for several years, it's gone through many changes, name changes, which I'm sure you may be familiar with, Baby Love, and there was OBCM, OB Case Management, and the new name there is Care Management for High-Risk Pregnancies, and that is what they do. This group comprises of social workers and nurses, and they provide services to uninsured pregnant and postpartum women to address the factors that impact poor maternal and infant health outcomes, including infant mortality. They are able to link these moms and these clients to resources in the community that they may need. And one of the things that I really am excited about is that this group, these social workers and nurses, if a patient misses a maternal health appointment, the nurse, the senior public health nurse, merely needs to walk back to where the care management team is and alert them that this patient has not come for their appointments. They've missed so many appointments. The care manager then links with the patient to ensure that they come in to continue their care. So this will increase access to any of the needed medical, educational, and social services these pregnant ladies may need, because they can link them to the resources. They also provide support to the once they're postpartum and they've delivered the baby, links them to assistance with transportation, housing, if they require family planning, food access, if Medicaid, and other resources. And one of the great things that I get to do is to be the director of nurses to all the public health nurses in the health department. And of course, our maternal health clinic is staffed with public health nurses. Public health, I don't know whether you know, it is nurse-driven. And so what we like is also our public health nurses provide enhanced health education to our maternal health patients. We have developed a customized patient education booklet, which we printed. And then we are going to, coming soon, there will be an app that will be on the client's phones that they can access. And this is something that the staff have developed themselves. We have enhanced health education. Our public health nurses provide third trimester education to all of our clients. You know, a client needs to know, you know, if I'm going to have my baby, where am I going to have my baby? What should I expect during delivery? Information about circumcision. Some may choose not for that. Vitamin K, we give them all the tools and the education they need for delivery, carrying their babies. A component of being a registered nurse is that we are able to teach and educate. And that has really been profound in my career as a nurse, being able to educate my clients and know that I've somehow been impactful and made a difference in their lives and the lives of their newborn and their baby. So also, we talk about the mental health. I think that was addressed significantly. We provide maternal and postpartum screening for depression. We do the Edinburgh Postnatal Depression Scale questionnaire, which screens for possible symptoms of depression and anxiety, and we do it at every trimester, first trimester, second trimester, third trimester, and after delivery. So that is what we do, and if there should be an issue, then we can do a warm handoff, and that's where the collaboration would come in with other partners that they would need to have mental health services if it's needed, and what resources would be available for them. The clinic has done significantly in reducing the barriers and access to prenatal care. I can remember an instance when appointments were weeks and weeks out for being able to access and start your prenatal care. We have provided expanded access to appointments to ensure that patients can start prenatal care within the first trimester, and that is significantly important. You need to get your prenatal advice. You need to get your irons. You need to be ready so that you can bring forth a healthy and viable pregnancy and a healthy and viable baby, and that you can maintain your health during pregnancy. So this is what the Durham County Health Department entirely is doing, and not just the maternal health clinic. So we offer implicit bias training for all staff at the health department. We also have a Nexus Racial Equity team, and it's actively seeking advanced racial equity by pursuing a comprehensive action plan. And all staff, we include initiatives for and input from community members, partners, and the health department staff alike, and the county. REI groundwater training. I am so proud and happy to say that every maternal health staff has completed the REF groundwater training. This is highly significant. When I walk into them, I can remember, you know, as having, when I was pregnant, when I walk into a maternal health clinic or to receive services, I'd like to know that somebody is on board and knows what my struggle might have been or might be, and what my barriers might be to being able to access quality care. And so with the REI groundwater training, one of the concepts I like about our nurses is that we need to meet our clients where they are. You know, we need to be able to provide this care to them. I am happy to say that Durham is the first county in North Carolina to publish a local version of the North Carolina Early Childhood Action Plan. Many of our staff in the health department participate in developing this plan, and one of our senior public health nurses in maternal health served on the planning committee, and it is a very passion of hers. So what's being done also, the Division of Health Education and Community Transformation, they received a series of 2-year grants to address the health of women of reproductive age and children aged 0 to 5. Our Nutrition Division provides one-on-one medical nutritional therapy counseling with registered dietitians for clients who identify as having nutritional risks. And they have unlimited one-on-one medical nutrition therapy with the registered dietitian, especially for excessive weight gain, gestational diabetes, and hyperemesis. And now Liz Stevens, the deputy, will present some of our demographics and our stats in our maternal health client patients that access for maternal health in our clinics.
Thank you. Thank you, Director of Nursing, Hattie Wood. Good morning, Commissioners, Chair Howerton, Manager Sowell. I'll be very brief, just to speak a bit about the patients that we see in Durham County as part of our prenatal care. So as we think about the different items that Director of Nursing Wood just described, it's important to think about how does this impact Black maternal health and maternal health for Black and brown women. So the vast majority of patients that we see in our clinic identify as Black or brown. 20% of our patients identify as Black, 73% identify as Hispanic, and a significantly smaller number, 5%, identify as white and 2% as Asian. This is looking at demographics within our maternal health clinic, low-risk clinic, for the past year. Each year we see approximately 1,000 unique patients coming through. Next slide, Head. So one of the points and one of the measures that we pay close attention to is this early entry into prenatal care. We know that there are a multitude of positive outcomes both for mother and baby, depending on care starting early. And we do see disparity here. So our white patients appear to start care, again, this is based on data for the past year within our clinic. White patients appear to start care earliest at 15 weeks. Hispanic patients would come next at 15 weeks, 4 days. Black patients follow at 16 weeks, 4 days, and Asian patients as well, 16 weeks and 2 days. And then this is just a snapshot of what births in Durham look like compared to trends statewide. So you'll see here in Durham, we have about 4,000 births each year. This is data from 2020 from the State Center for Health Statistics. Our births tend to be slightly higher than the state average among Black or African American women, also among Hispanic women. Our births in Durham tend to be among women with slightly higher education level of attainment compared to state averages, and slightly higher rates of being married. Our rates of gestational diabetes and overweight or obese do fall slightly below the state average for those measures.
Public health what? I didn't hear that. Public health.
One of the other asks is we'd like to have a public health nurse educator in the maternal health clinic. This would provide full-time coverage, which would increase the breastfeeding initiative and could play a vital role in implementing the CDC's Hear Her campaign. And so I'd like to give you a little information about the Hear Her campaign. It seeks to raise awareness of urgent maternal warning signs during and after pregnancy and improve communication between patients and their healthcare providers. Maternal mortality is a concerning public health problem in the United States. About 700 women die every year due to pregnancy-related complications. Although rare, these deaths are particularly tragic because about 2/3, 2 in 3 deaths could have been prevented. Dr. Wanda Barfield, the director of the CDC's Division of Reproductive Health, quotes, I will quote what she says, "A woman knows her body. Listening and acting upon her concerns during or after pregnancy could save her life." And the CDC's Hear Her campaign is one campaign that could play a vital role in decreasing the outcome of maternal and fetal deaths among Black and brown women in Durham County. We'd also ask for funding to offer doulas for all Durham County maternal health patients. This effort is supported by ACOG's 2019 report and the March of Dimes report. And I'd like to put a plug in here also for a doula program for our detainees in the Durham County Detention Center. As you know, public health has the oversight over the detainee health care. And so having said that, that comes up on the medical services as well. The women that are pregnant at the Durham County Detainee Center often have no support. And they go for high-risk OB. They would be at the high-risk OB clinic, but they are clients of Durham, under public health. We'd like to develop a MOU so that we could, all those women would have access to a doula and have a support system as well. We'd also ask for funding for at-home blood pressure devices. We initially had funding for that, and we no longer have that funding source, so we can't give the incoming maternal health patients an at-home blood pressure cuff. So I just want to take a minute to step back on that and say, so we would monitor their blood pressure at their next visit. So how long has your blood pressure been elevated? If a client was at home and doing self-monitoring and their blood pressure was up, they could make a call to our triage nurse. We could get them in instantly. But to delay that, because their appointment is not until as such, we don't know what the significant outcome can be to the hypertension on that. So that's one of the asks that we'd also like to have. And it also supports the 4th trimester, and then the CDC's Hear Her campaign. It supports that as well. One of the other asks is that we'd like to have a Durham County Women's Health ultrasonographer. Reason being, I come in, I tell you I haven't felt my baby move in 2 days or a day. So you've got to do a referral for me. I've got to go to the hospital and have an ultrasound. And that is, to me, is a delay. If I had a sonographer there and an ultrasound that could be performed right there on site, then you could make an informed decision. Your baby's fine, your baby's just larger, just not moving as much, you're almost due to have your baby. Or you could see, yes, there's a decel in heart rate. Yes, there's this going on. We need to get you right now. We're going to send you via ambulance to labor and delivery. That is what that would aid, initiate safe and appropriate prenatal care, genetic counseling and testing, where you could do measuring and sizing. If you see something different, go ahead and initiate that genetic testing and counseling, and it would aid in reducing infant mortality. I know you can tell I'm quite passionate about this. I was a maternal health nurse for years. I had the wonderful opportunity to work at one of the local institutions down the street, and then I came to public health, and I also continued to get my hands in it by working at our satellite clinic at Lincoln over the years. So maternal health is dear to me, and having been born in Durham and having worked in the uninsured and underinsured and residence clinic at the University Hospital down the street. This is a population I've served for years, and that is all that I have for the Durham County Department of Public Health report. Thank you so much for listening.
Thank you. Thank you. Any, do you have something? Very it goes.
I don't see the slides yet, but I'll go ahead and start. Thank you. I am Maria Small, and I am an OBGYN at that university down the hall, down the street. And this month will make, as of April 1st, 15 years that I have worked there. I also, like my predecessor and mentor, was born in Durham and grew up in Durham. And I have been working in maternal fetal medicine or high-risk obstetrics since I arrived here. I also serve as the co-director of women's services for the Durham County Department of Public Health, along with my colleague, Dr. Beverly Gray, and a couple of other hats that I wear. I, along with one of my colleagues in the room, serve on the North Carolina Maternal Mortality Committee. I serve as the chair of that committee and can provide some insight from that lens. And I also serve as I chair the OBGYN section of the National Medical Association. So I'll start with this slide, if you can see it now. It's a slide of a fetus in utero, and what I didn't realize when I first saw it was that this had made a large impact on a lot of individuals, particularly in training. This was designed by a Black medical student, and it shows a Black body, which often is not what's shown in our medical education and medical textbooks. I didn't mention it says an African American COVID task force. I've also served on that and helped start that group. So a lot of the work of this talk is through that lens as well. I think I'll go. So COVID and maternal mortality is becoming a topic that we are all unfortunately more familiar with. As many of you in this room know, Black women in the United States have a 3 to 4 higher risk of maternal death in the U.S. compared to white women. Deaths from COVID are higher for Black mothers than other groups, and unfortunately, vaccination rates are also lowest during pregnancy. Some of the data from Mississippi showed some of the huge disparities in death related to COVID, where approximately 63% of individuals who died in pregnancy or in the postpartum period were Black or Latinx, and they were also largely represented by being unvaccinated. Pregnant people with COVID are 15 times more likely to die if they're COVID and unvaccinated. And there's a higher risk of being hospitalized and in the intensive care unit or on breathing machines, ventilators. And so we consider COVID to be a high risk factor for severe disease and death. And as we've talked, many of us in groups, in community groups, pregnancy also qualifies individuals for urgent therapies like the monoclonal antibodies, similar to what individuals would receive if they had other immunocompromised conditions. So these are data from one of the larger studies about pregnancy and COVID-19. Preeclampsia, eclampsia, is the hypertensive disorders of pregnancy, and those are more common if you have high blood pressure before pregnancy, but they're also more common if you have other conditions that are more frequently found in Black women, like lupus, other autoimmune conditions. So one of the things that, and this is not on my slide, I'm going off script now, but one of the things that was done during the pandemic was durable medical equipment was covered by Medicaid. So high blood pressure assessment using home blood pressure cuffs was easier. There was access to scales for individuals who had Medicaid, and even pulse oxes for home use. And so these are, this condition, preeclampsia, eclampsia, is unique to pregnancy and is one of the leading causes of death during pregnancy. But surveillance for preeclampsia, eclampsia is made easier if you have access to something like a blood pressure cuff at home and know how to monitor your own symptoms. So because COVID does very unusual things to your vasculature and to blood pressure, this disease of pregnancy is made worse by COVID. And then the risk for severe infections, intensive care unit admissions, maternal death, those are all higher for COVID. And I didn't go as deeply into this as we have, but the risk of severe illness, preterm delivery, and death are highest for Black and Latinx individuals, largely because of a lot of the social drivers of health that have been discussed here and that are going to be addressed even more as we proceed. So in pregnancy, higher risk of miscarriage rates, preeclampsia, eclampsia, which are those high blood pressure diseases that are common to pregnancy. And in our state and in Durham, we are one of the regions of the country with some of the highest rates of high blood pressure or hypertensive diseases. Stillbirths, and I'm sorry I put preeclampsia twice, and preterm birth. North Carolina received, I think it was an F this year from the March of Dimes for our preterm birth rates. So this is an area that we in particular need to work harder on, and we have ways to work on that, and many of them are not based in all that we do in the hospital, but many of them are based on what we do in the community. So these are the slides that basically, in a nutshell, the vaccines are safe during pregnancy and may be even beneficial to babies. And this is from the COVID vaccine CDC site. Among individuals who are vaccinated, Black pregnant individuals have the lowest vaccine rate, so this is something we're still working on. And then a plug for support for our federal legislation, the Momnibus. One of the parts of this Momnibus that actually is as of April 1st, we have 12 months of coverage for pregnant individuals who give birth and then need coverage in the postpartum period and have Medicaid. So this is something that that my colleague alluded to for the in terms of COVID funding. This is something that COVID funding, a upside of this virus is that we have support for the fourth trimester initiative, and fourth trimester is that period after birth. So there's 3 trimesters, the third trimester when you're delivering, and then the fourth trimester after you've had the baby. And so the majority of maternal deaths occur after birth, and many of them occur in that year postpartum. And that's when people don't have access to their substance use clinics because they may not have Medicaid or any other insurance. They may not have access to the cardiologist who was helping manage their severe hypertension that was uncovered during pregnancy. They may not have access to any number of individuals like the pregnancy care manager who was helping to coordinate a lot of the services and supports that they would have otherwise received in the community. And so rather than disrupt many of those things that were established during pregnancy, that fourth trimester coverage can help, we hope, extend and expand that reach and that soft touch. And with that, I'm going to stop here and hopefully pass on to some individuals who are doing a lot to increase the touch during pregnancy, postpartum, and beyond, as we talk about cycles of generational trauma that can impact one trimester going into the next trimester. I also didn't mention that Hattie Woods and I serve as co-chairs of Born in Durham, Healthy for Life, which we hopefully will be able to talk to you all about, but it's a coalition of individuals who are committed to reducing infant mortality, maternal mortality, and promoting health equity in Durham. And as someone said, we don't know where a lot of us are, where we're working, what we're doing. That's one of the purposes of that group, is that we come together and strategize, work together. A lot of our work has been virtual and through talking about COVID and where people can get access to different services and things during the pandemic, but we have capacity for so much more in this city. So thank you for your attention.
Thank you. We're going to ask the other group to come forward, and then commissioners will be able to hear full conversation and then see if there are questions. Do we have enough chairs? Okay. Who's going to start it off?
Hello, everyone. Good morning.
Morning,
So great to see everyone in person.
Share your name with us,
finally.
please.
Absolutely. My name is Joy Lampkin Foster. I am a mother, a doula, reproductive justice advocate, an equity advisor, and a co-founder of the Triangle Black Maternal Wellness Collaborative. I am so excited and honored to be here today with my sister colleagues, just to share with you all some of what we have been experiencing as boots on the ground folks here in Durham who work with families every day, and to really share our perspective on what some of the solutions are. I loved hearing that previous presentation about mental wellness. We know that at the root of maternal health is mental health. We know that mind and body are just so connected, and that if you are stressed and traumatized, then that we cannot expect for you to have a positive birth outcome. Trauma lives in the body. And so we really want to talk a little bit about our personal and professional experiences working with families and what we can do as a collective, our colleagues at the health department, and then all of us who work together daily, what we can do together to really wrap families in support and make sure that all families here in Durham are able to thrive. So with that, I would love to pass it over to my colleague Joy Spencer to share a little bit about the background on key issues that we're seeing.
Thank you all. Very honored to be here. Thanks for taking the time for us to acknowledge and highlight Black maternal health. I'm Joy Spencer, a mom, advocate, Durham resident as well. So we just wanted to quickly summarize how we view the Black maternal health crisis. As you know, it's gotten national attention from our Vice President Kamala Harris and countless others around the need for legislation, funding, and other efforts to diminish our rates. We just heard from our colleagues at the health department how, we have the most resources invested in our healthcare system, but some of the worst birth outcomes in the world. Unfortunately, that trend does not escape us here locally. Here in Durham, we have a higher Black infant mortality rate than national and state averages. North Carolina has one of the highest preterm birth rates, which is the #1 cause of infant death. And when we look at Durham, mentioned in the previous conversation, North Carolina has a D rating for preterm birth, and that is for Black women have a 48% higher chance of going into labor preterm. And when we zone in on Durham, unfortunately, our preterm birth rates are trending down and worsening year by year instead of getting better. And so we have an opportunity to do that better. 1 in 4 Black women are unable to access care in their first trimester, which we know is critically important for testing and monitoring. We have unique opportunity for resources and research, but we also experience what we call a maternity care desert because you go to the hospital or you go nowhere. And so there is a lack of holistic and culturally affirming care options. And what we also know is that for every Black maternal mortality, there are 70 people who almost die. And 60% of pregnancy-related deaths are preventable. We know that community support, financial assistance, and doula support are some of the things that increase those outcomes, those birth outcomes. And so we're here to share how our organizations provide those services.
Hello, everyone. My name is Maya Jackson. I'm the founder and director of Mame Inc., which is a community-based doula program here in Durham. The reproductive justice is such a framework that is deeply rooted within all of our organizations. As Joy Lampkin said, we see all of these things on the ground, and really because Black and brown people have really never had a choice or agency over their bodies. And so the framework starts with the human right to maintain personal bodily autonomy, have children, not have children, and parent the children we have in safe, sustainable communities. As people, who come from historically excluded communities, we don't really have that option. Most of our communities don't have access to trees, clean water, adequate housing. So because of that, we want to make sure that that basic needs of a human being and human rights is at the forefront. This work is foundational to community, especially led by community-based and rooted work. We increase access to services and address the social determinants of health. Our work supplements the medical providers and health department by addressing clinical needs, by providing peer support. And I would like to say that our work supplements all systems. So whether it's health, education, criminal, all of these things impact communities of color. And through our work, we support those systems by giving our communities more access. And then as community leaders, we've always filled the gaps left by these systems. We're not alone in this work, but we will be uplifting the 3 CBOs today, which is HEART, MAME, and EBB.
As Maya mentioned, we are not alone in this work, and we are just grateful to be able to be here to uplift other community-rooted organizations we work closely with on a daily basis to wrap families in support. I just wanted to highlight a few here. Sankofa, which is the only Black midwife in this region who's servicing Black families and providing that option for people to receive care that way. The Renee, which provides services at the intersection of tech and maternal health. Fatherhood of Durham, which is the organization in Durham that's really making sure that fathers are being invested in and uplifted in their role in maternal health outcomes. And so that's just a few. We believe in the power of community and the power of coming together in collaboration. And we really want to be able to take this opportunity to strengthen these partnerships and figure out how we invest in this work that needs to be strengthened, scaled, and sustained over time. As Maya mentioned, we're going to be uplifting 3 today, Hearts, MAME, and Equity Before Birth. And these are examples of the impact that's being made by community-rooted and community-based organizations here in Durham.
Hello, everybody. I am Tamika Brown. I am the founding executive director of what I like to call your favorite nonprofit organization, right? And what I do is I go into the high schools and I go into the communities and I teach teen moms and teen dads who have become pregnant between the ages of 13 to 22. And I help them with the resources and the services that they need to be self-sufficient and independent so that they can become the mother and father that they would like to be for their child, okay? So I'm gonna pause right there because I'm gonna ask you a personal question, okay? You don't have to answer out loud. Just answer in your mind, okay? Just think about it. I'm gonna take you all the way back like Betty Wright. I want you to think about your very first time, okay? And I apologize if that time was not as pleasant for you as it may have been for others, okay? The population that I serve are teenagers that engage in sexual intercourse, okay? With that being said, that could be voluntary, that can be involuntary. That could be peer pressure, that could be against their will, that could be curiosity kills the cat, that could be whatever is going on in their mind. We've already addressed mental health, right? But what happens when they do decide to engage in that sexual intercourse and that 99.9% birth control method failed? Then what? What happens now, right? So we have a 13-year-old that is now pregnant. Where does she go? Who does she turn to? That's me, okay? That is who I serve. And with that being said, I know you like impact numbers. Y'all like want to know what have we done and where are we going and what do we need in order to continue to sustain our work. So I'm going to provide that information for you at this time, okay? So Hearts was inaugurated in 2012. I started as a pilot program at Hillside High School, okay? I have been serving the teen mom population in the community for 10 years. And since our inauguration, I have served over 127 teen moms, and that was the ones where I was consented to serve, meaning not all of the parents gave their child permission to participate in our organization. However, I did provide them with the resources that they need, even though they were not actively involved in our program. Okay, so why this work is important to us is because Durham County is ranked number 44 in the state for teen pregnancy. We're not the worst, and we're not the best. We're falling right there in the middle because we know there are 100 counties, right? Of that, 229 teen pregnancies reported in 2018. But let me bring that local for you because Durham Public Schools reported in 2018 and 2019 that 227 teen moms dropped out of school due to the fact that they did not have the support system or childcare in order to raise their children. So with that being said, that's what Hearts has strived to do. Oh, let me not forget the 18% of teen pregnancy repeat pregnancy rate. So that means the teen moms that have come pregnant out of the 259, 18% of those have become pregnant again with their second child before they turn 20. Okay? All right, Hearts impact for 2021. Oh, first, let me tell you the services that we provide. Because of those stats and those impact numbers, we focus on 4 main important areas when we're talking about teen pregnancy and Black maternal health. That is self-development with a concentration on sexual and reproductive health, family development, financial awareness, and of course, education. To this date, Heart has graduated 92% of the participants in our organization. We did have a 100% rate, however, some of them moved to another county where I did not have the capacity to serve, okay? So let me focus on last year's numbers. What we were able, that was kind of overall summary of the past 10 years. Last year in 2021, I was in the midst of the pandemic. We did survive. I am currently serving 15 teen moms and 2 teen dads in our community. I have provided 86 one-to-one case management sessions, 19 theory-based group sessions, which equates to 200 hours of direct life skills trainings for these ladies, okay? The ladies that you see sitting around me, they are my community. They are my doula support services. They provide direct services to our organization. When our teen moms become pregnant and they reach out to me, referred to me from the school system, I automatically call these ladies. They are enrolled into their organizations so that they can help me provide that medical attention and that doula medical support that these teen moms need in order to access the health care resources that they need, and most importantly is to have that community support and to have just the support that they need in general from becoming pregnant. When I asked you to think back to your very first time, I'm not sure if anybody in the room is a teen mom. That's what I would normally ask for everybody to raise their hand if they became pregnant between the ages of 13 to 22. But I didn't want to get that personal with you all today. But with that being said, when a young mom becomes pregnant at a teenager, she hides her pregnancy. She can't tell her mama that she is pregnant because she's scared of the outcomes. So what does that mean? That means she doesn't have access to her health insurance card, right? So she has to go to the health department. That's if they will allow her to be seen, all depend on her age, without her mother's consent. So they hide their pregnancy so they don't get that preterm. They don't get that pregnant. Y'all better call me on time. Y'all know I can talk Hearts all day. Oh, I got to roll it out. Okay. All right now. All right, I'm bring it to a close. But they are the population that is undereducated, underserved, under-equipped when we're talking about Black maternal health. And there are not a lot of stats about teen pregnancies and Black maternal health. As I was doing my research, I was only able to find 2. And I would like to share that with you as I bring it to a close. and we can finish this conversation. Oh, now it don't want to be here. Oh, got it. The ones that I was able to find specifically for teen moms was in 2019, the birth rate for Hispanic teens and non-Hispanic Black teens were more than 2 times higher than the rate for non-Hispanic white teens. The birth rate of Americans, Native American, was highest amongst racials. Pregnancy and birth are significant contributors to high school dropout rates amongst girls. About 50% of teen moms receive a high school diploma by the age of 22. My question is, how come all teen moms can't receive a high school diploma? Hearts is needed in every high school in Durham, North Carolina, but we do not have the financial capacity and resources to make that happen.
Thank you so much, Tamika. I'm going to pass it over to Maya.
So we're gonna have to wrap it up. This is such an important conversation. I'm sitting here and hating to stop it, but we've been going on for almost an hour. And I know the commissioners have a lot of questions, and just trying to figure out how to manage that because we are going to end up, we've gone over time already. So, and we didn't get to ask the former group any questions. Is there one question that the commissioners can ask and not draw it out long, that they can ask one question so that we can move on? Otherwise, we're not going to be, we're going to be totally off schedule. If you can not give a whole lot of dialogue, just ask one question so we can move on. Can we do that?
Chair Howerton.
Okay, can you?
Before they do that, can they just at least do their conclusion slide? Because I don't know what that is. Is that fair? Like, I don't know how many slides they have.
Yeah,
left,
if you
can they just do their conclusion slide?
If they could do that in 2 seconds and wrap that up, and then.
Sure. I can wrap it up. So, yeah, we'll just take it to the last couple of slides. I just wanted to highlight that we are not just service providers. We are thought leaders in our community. We have been a part of efforts to bring in what will end up being probably $2 million to Durham through the Pediatric Supporting Parents Initiative. We have been a part of policy recommendations for Head Start. We have been at the helm of making sure that the Early Childhood Action Plan in Durham had an equitable process. We have made sure that Duke Health was aware that their policies were actually keeping lactation consultants from being able to pursue that opportunity and make sure that Black families can be served. So just wanted to highlight that we work together to make sure that across Durham, not just at birth, but in early childhood period, that families are able to get the best support possible, and we inspire and hopefully advise other folks throughout our community on how to do that. And then in conclusion, we just want to be able to work with our county health department in equitable ways. We have really just wanted to figure out how we can get funding, how we can get support, how we can get at the table for decision making, and not at the last minute, but at the beginning of these conversations when it comes to maternal health. There's so much more that we could say, but that's the crux of it. How do we do equitable partnership between community and our government and our other large institutions here in Durham?
If you go to the last slide, Joy, go to that one.
The last one?
Yes. This is the last one, if I may. If I may, I really just want to highlight, we were really hoping to get back and be able to explain some of the impact to you all. Currently, in full transparency, we work in silo and not in true collaboration with the Durham County Department of Public Health. And so what we're asking for is some deliberate efforts to help us make equitable partnership, which will include being able to have some decision-making power, being able to, the innovation that our nation and our state has recognized within our organization. We would love to see some investment into that from local government. We know that what we are doing is working, and we just want to be able to do it out of silo and in conjunction What happens in a medical provider's appointment will be much more successful if folks are able to walk out of those doors into safe, secure families and environments, and that is what we provide in addition to increasing direct access to medical services and supports. But hopefully we can continue this conversation. In our experiences, unfortunately, we have been excluded from a lot of opportunity and a lot of conversations, and so what we are asking is to have some true commitments and some equitable opportunity to sustain, scale, and expand our work, because what we are doing is truly helping to improve, and we are specifically focused in on Black maternal health outcomes.
Let me finish. Can I just say one thing? In regards to the Hispanic population, please do not be confused with the high numbers. It's a very diverse community that we deal with on a regular basis that have very complex situations. And so even though you see a rise that they are receiving services, a lot of needs are not being met. And when they come to our organizations, we do not have the resources such as translators and other opportunities to be able to support them. So I just really want to highlight so that way you can understand those gaps.
Yes. So, Ms. Pierce, Director Pierce is in the room, and what I will ask is that you, that Ms. Pierce schedule meetings with you and with our manager, that there be a conversation where, because because there's so much rich conversation right now that we can't make any decisions right now. So what we need you to do is that you meet with her and her team to decide what next steps.
Yes, ma'am.
Does that work for you?
Yes, ma'am.
Yes, that sounds great.
Manager Pierce, manager, that work?
Yes, ma'am.
Commissioners?
It doesn't work for me.
Okay.
And all due respect, y'all need to ask, like, now. I know we can't say anything now. I'm not asking them to ask anything now, Chair Howerton. Now, the recommendations that were given by the Hear Her campaign, I know about those. You know why I know about those? Because I brought them up last year on June 3rd. It has been a year. And more babies have died. And we made a promise in our budget that we were going to move forward and do things. I agree with Commissioner Jacobs. We stated that we had this extra $1 million for mental health. We haven't moved on it. We made a promise to y'all. We haven't moved on it.
Correct.
We cannot keep having meetings.
Correct.
So I would just ask, you all have some ask up there. Some of them I like, one of them I don't like, and I can talk about that offline. I do not want to push this very important conversation. Y'all probably needed more than 45 minutes, but you also probably needed to be more succinct. And that's just something you got to work on. Each of you all respected in your fields and the work that you do. You brought $2 million in. I heard what you said about not being able to work with the juggernauts that are the hospital systems in this area, and not even with our own public health. That did not fall on deaf ears for me, right? If we have so much money and infrastructure going into this one thing, then why are people still dying? And I actually think that some of the answers might be sitting right here.
Yes,
so
ma'am.
I'm okay with you all meeting with Joanne, but I would respectfully request that when they come back for us, we did this last year on June 3rd. I didn't even know some of y'all. I didn't know all y'all were going to be here today. And my email got lit up because you said you all did not even know about the conversation.
Yes,
and we
ma'am.
met with y'all last year. And now we meeting again with y'all this year. I got 5 women up here that's counting on me to vote for stuff that they want. Well, this is what I want. So I'm done.
Commissioner Burns?
We just can't keep meeting.
Commissioner Burns?
I'm done, but we're not going to keep meeting about black babies dying.
Can you hold this conversation until we have a time to devote the time that we need for this conversation? Because it needs time to be devoted and understand where we need to pull money from to invest. You've heard us state our interest and our commitment. So there is nothing about not doing anything. What we need is for you to meet with our staff, be succinct in what it is that you need, so that we understand what we need to do. Can I get you to do that?
Yes, ma'am.
Thank you so much. I appreciate seeing all of you today. Okay.
Thank you all so much for the opportunity.
I think, Commissioner Carter, you have one more thing?
And y'all need to meet with the commissioners,
Thank
too.
you.
Don't just meet with staff.
I just wanted to thank you all so much for the work that you do and your expertise and your very, very compelling presentation. And also Hattie Wood, I wanted to thank her and Dr. Small, excellent presentations today. And I think I would not be speaking out of turn if I said this Board of Commissioners is committed to contributing financial resources to the outcomes that we want to see, including you all here, our health department's request, which I really appreciate the specificity of that. So look forward to more work.
Thanks so much.
Thank you.
So we have one more, we need to move on to our next item. Can you just hold that till later?
Are we free?
I just wanted, that we've been waiting for this presentation for a long time, so I just wanted to, again, thank all of you for this, our public health staff, all of you. I think we know what the solutions are. They're in the room, and we know we have the expertise and the resources here in the community. For me, it's hearing you all. It's similar to the mental health conversation. You would talk to, one of you mentioned the silos and the fragmentation. We need a seamless system, and so I look forward to what we're coming up on our budget, and that's what this is all about. And I just wanted to say to Hattie, I support what you've laid out as what you all have, what you need, and so I look forward to you coming back. And the data, I really appreciate the data specific to our community that you have presented to us as well. And somebody who personally has benefited from having 3 births with a midwife, I know what that means.
Yes,
and so I just want to say I'm looking forward to next steps. Thank you.
Thank you. Hopefully we'll get some specific commitments. We've had a lot of conversations with a lot of asks, but not gotten anyone to tell us yes. And we've kept being told that, oh, we need, I can't make that decision. I can't make that decision. So we have our asks. We have had conversations. What we need to do is know what the county is committing to support us with, and we know what we need support with. And so hopefully that conversation will come attached with some action steps, so that we appreciate you all's commitment to moving it forward, but we have met tirelessly with no firm commitments, and so that's what we are here to do. That's what our ask is. Indeed, we need something in writing that says, yes, we hear it, but we need it to be in brick.
Ms. Spencer, we have made a commitment to you.
Understood.
So if you will meet with Ms. Pierce, and we will move forward. This process today is to hear from you, not to make a decision today.
Right.
We are listening to quite a few different groups today. No decisions are being made today.
Understood.
So we appreciate you being here. We have a commitment to working with you and supporting you, but decisions will be made at a later time.
Understood.
Yes, ma'am.
Thank you so much.
Thank you.
Thank
for
you
having
all
us,
for the
ladies.
opportunity.
Thank you.
Ladies, and I know you see how everybody else came up here and they had to ask on their final. I can beat up on my folks all day, but I'm about to beat up on y'all. Don't ever come in front of 5 people.
We have, the next item,
Just have it.
Commissioners, is 22-0217. It's FY 22-31 Capital Improvement Update. The board is requested to receive a presentation from staff on FY 22-31 Capital Improvement Program Update. We have representatives from the North Carolina Museum of Life and Science, Durham Technical Community College, and Durham Public Schools to share highlights on projects that may be included in a potential 2022 bond referendum. I'd like Claudia Hager, General Manager, to begin the conversation and introduce the additional resource persons. Thank you.
I will just quickly say, we began these conversations last fall, and so staff has done a great job of revisiting our master facilities plan, our capital improvement plans, along with our community partners. So today you'll hear how we've kind of revised those CIP plans. We will have future meetings to focus on other requests, but today we wanted to focus on the potential bond projects and due to the time-sensitive nature of these projects. So with that, I'll turn it over to General Manager Hager.
Good afternoon. Dr. Sewell has given us a great transition. Keith is going to go fast. It's something he and I both can talk a lot, but we're going to try to go through this quickly. Today, we will follow up from conversations in your March discussion. I think there was some sticker shock, and we heard you. We went back and revisited sequencing and timing, and also our projections of what it would cost, and we shared some information that showed that we could do it with a slightly lower number as far as the increase of the tax rate. But Keith will go into that, and again, we'll tag team some. We do have our partners from the North Carolina Museum of Life and Science, Durham Technical Community College, and Durham Public Schools. They'll join us a little bit later, but we'll take about 10 minutes to go through this part, and then ask for them to share. Keith?
Thank you, Claudia. Good morning, Commissioners. Nice to see you all in person. So a few bullet points of what we're going to go over is just some of the changes we made to the CIP per some discussion that was had around hearing 3.5-cent tax rate increase for the totality of the CIP, largely driven by the GEO bond referendum. We'll show you a few of the changes that we made to reduce that tax rate needed down to 2.5 cents. We'll talk about that, and then we'll talk briefly about future referendum timings, and then we'll leave room for board discussion. That's my portion of it, and then folks from DTCC, DPS, and the museum will come up and talk about some of their projects as it relates to the GEO bond referendum. As always, when we talk about the CIP, we like to remind the board of the guiding principles we use. Projects need to align with board goals. They need to be consistent with the facility master plan recommendations. We always are concerned about our AAA bond rating and the debt related, how much debt we take on that is related to that bond rating. So that's always in the front of our mind when we're creating a long-term capital improvement plan. And we try to give priorities to projects not completed in previous CIPs. Largely, this CIP is made up of 4 major areas. That's Durham County projects, Durham Public School projects, Durham Technical Community College projects, and Museum of Life and Science projects. It is very education-centered. The CIP calendar, we hope to have a CIP approved sometime this month, sooner rather than later. There's a history of some things that have happened, but right now we're at the tail end of this process with some discussions per what County Manager Sewell brought up. So really just want to key on point out a few key changes from the March meeting, which was the initial CIP presentation, and try to key in on the first 5 years, which are highlighted in red here. I'll only show you this slide to prep you for the next slide, and you'll see highlighted in yellow, those were the areas where we made some minor changes in the CIP in terms of timing, not project cost necessarily, but timing to move some projects out to reduce this initial potential tax rate increase needed next year related to a GEO bond from 3.5 cents increase down to 2.5 cents. The projects that we moved out were the DSS main renovation project. We're still a ways away from everyone getting an agreement about what to do with that wonderful building beside us. We also have some time that we're going to need to do to figure out how to implement the renewable energy plan as it relates to high dollar projects. And finally, some of our IS&T projects, which were scheduled for the upcoming year, may slow down as we have some serious review to do on some of these major projects and then move those out. So basically, we move those projects out a year or so just based on where we assess ourselves at the moment. What does that all mean? When you look at the CIP where we're at right now, it is a very front-loaded CIP. Normally, we try to balance these things out. But if you see the first 5 years from FY 22 to 26 versus FY 27 to 31, you see about 2/3 of the CIP in the first 5 years. And that is largely related to requests from Durham Public Schools, Durham Technical Community College, the GEO bond referendum. There's a lot of pent-up needs, particularly in our public school system, that you all have heard about any number of times, and we are trying to address in the first 5 years of this CIP. But having that much dollar in the front part of the CIP is pushing this 2.5-cent tax rate increase. This annual debt service payment over time, what I wanted you to see, that yellow line that you're looking at, is what the amount of debt in any given year was in the previous CIP you approved, in 20 to 29. The blue line is the amount of debt we're willing to consider and take on with the new CIP. I guess the way to equate this is you all are willing to buy a much more expensive house now and pay for it, and willing to find the money to pay for it, than you were in the 2020, 29. When I say that, that's because DPS came to you with significant project increases. That's because DTCC is asking for significant funding. The museum and any number of other projects that the county has, animal control facility, emergency operations center, and any number of projects. But I just wanted you to see the difference in the amount of debt we're going to have to pay to support the capital spending we currently have in this CIP. What are our major revenue sources? GEO bonds, LOBs, which is another long-term financing instrument. It just doesn't need citizen approval. And then there's bank financing for shorter-term projects where the lifetime of the project and the existing thing is less than 20 years, so we use a less than 20-year financing, which is usually bank financing. The majority of projects requested for completion are in the first 5 years of the CIP, like I showed you earlier. On to the big news. Proposed November 2022 general obligation bond referendum, we're looking at $550.2 million for 3 areas related to children of all ages. We're talking about Durham Public Schools, Museum of Life and Science, and Durham Technical Community College. Those are the 3 areas making up the GEO bond referendum. This is the amount. I'm going to show you another. I'm going to go past this a little quickly. It's $423.5 million for Durham Public Schools, $14 million, roughly $13.99 million for the Museum of Life and Science. And for DTCC, it is a significant increase from historical standards. It's $112.7 million. How does that compare to the previous GEO bond referendum in 2016? We had $90 million for DPS in 2016. We're looking at $423.5 million in 2022. The Museum of Life and Science, roughly $14 million, each of those GEO bond referendums. DTCC in 2016, $20 million. DTCC in 2022, $112 million. And then there were some main library renovations in the previous one. There are no county projects in this particular GEO bond referendum. But we're in a different world of the amount of capital projects we're talking about, $170 million versus $550 million. 2016, voters were willing to approve because we went to the voters and said up to a potential 3-cent tax rate increase. We actually implemented a 1.75-cent tax rate increase in 2017-18. The proposed property tax rate increase needed right now, and again, it's not 23-24 yet, but we will see them, but right now, and I'm holding pretty firm to this number, it's up to 2.5 cents, and probably going to be close to that number. This is an important slide that I want you to take in. This is the amount of dedicated revenue that it takes in any given year to pay for debt service. What I want you to understand, dedicated revenue is 2 articles of sales tax, most of the occupancy tax, and some other revenues, and then additional property tax revenue to pay for annual debt. In 2017-18, dedicated revenues, sales tax and occupancy tax was $37.5 million. 1 cent of property tax in 2017-18 equaled $3.5 million. We had a tax rate increase of 1.75 cents. The total tax rate at that time in 17-18 was 9.71 cents. 23-24, I'm estimating dedicated revenue that's not property tax to be $50.6 million. 1 cent of property tax equal to $4.89 million. And we're looking at a tax rate increase as high as 2.5 cents for a total tax rate of 11.1 cents. The key thing I want you to see is that bottom table where it says the difference. The dedicated revenue annually between 2017-18 and 2023-24 is $13.1 million. And 1 cent of property taxes now equals $1.3 million more money for each cent. So if I'd said we were doing a 9.71 cent tax rate increase right now, equal to what it was in 2000, that's an additional $13 million. That's 26, you remember that's $26 million more you all have annually now in 23-24 to pay for debt without a tax rate increase. That's allowing us to go to that blue slide I showed you. Does that make sense? This is more money you have coming in. This is why we're able to consider $550 million general obligation bond referendums and other spending like that. Having said that, we still need a tax rate increase on top of that. But I just want you to know a big chunk of this increase is being subsidized by already implemented board policy through dedicated revenue sources. Any questions about that? Any confusion? Okay. I'm happy that I was that clear. This is the capital financing plan. I won't go through this in great detail. This just basically shows you the amount of debt that we have in any one year. That's the top table going out 10 years estimated. And then you're looking at that sort of third table where it shows you revenue types. That's how we're paying for the debt in any given year by certain basic revenue types, along with an estimated 2.5 cent tax rate increase in 23-24. And we use the bottom table shows you the ins and out of fund balance we're using from some dedicated funds related to the capital financing plan fund. What I want you to notice is look in 24-25, look in 25-26 in that total table. We're cruising right now at around $90+ million of debt service. Once you start spending money on schools, once you start spending money on county projects, once you start spending money on DTCC projects, the payment's going to come due, and our annual debt service payment is going to jump from 91 million estimated in 23-24 to 130 million, to 152 million in 26-27. We're getting into real debt payments here, but we're growing into it, and we can handle it. Any questions about this? I won't linger on this, but just wanted to show you. As always, we want to talk about the estimated debt service. We have several years of short-term financing before we actually issue any debt. So, for example, the schools or DTCC in this upcoming GeoBond referendum museum, we will spend upwards of $50 to $80 million, depending on what Susan discusses with short-term loan, usually banks, how much we will spend with a short-term interest-only loan. Then we will issue 2 years later, no longer than 3 years later, we will go issue GEO bonds for real and then pay off the short-term loan. We just say that, but that's where you see the lag of $90 million in debt to $130 million in debt 2 years after the GEO bond has been approved and we start spending. Does everybody understand? We basically use short-term loans for 2 years and then we pay those off. What's it called? It's a house. What's the term when you have a house?
Refinancing.
What? A construction loan, yeah, any number of them. Once the GEO bonds are actually issued, debt service must be paid annually regardless of economy or board priorities. GEO bonds are basically you get a lower interest rate because you tell the issuers of those bonds that the voters have approved, have given you all the right, not only the right, you have to increase property taxes necessary to pay off that debt if the economy were to tank. I don't expect our economy to tank, but that's the value of having voters-approved GEO bonds. LOBs aren't necessarily in that same, they're not voter-approved, but you ought to keep your AAA bond rating, have proven to raters, the issuers of bonds, that you will pay off your debt no matter what. Okay. Any questions about that? Because I am going through this quick, hopefully.
You're doing great.
The county expects to pay up to $55 million in related debt to the GEO bonds. Usually it's about $1 million for every $10 million that we loan. So if we do $550 million in GEO bonds, it's roughly going to be, if the interest rates are around normal, about $55 million in annual debt service related to those GEO bonds. We talked about a 2.5 cent tax rate increase required to support that debt expense. That is down from what we showed you a month ago in 3.5 cents. The recommended tax levy would start in 23-24. Funds that aren't immediately spent on debt service would be committed in a special fund for future debt service. Basically, they would fall to a fund balance in which we then spread out to limit the growth and tax rate increase needed in the out years. And that's
debt service fund balance that we've been tapping into.
There's 3 different funds, but yes, debt service fund balance, capital finance plan fund balance. Yes, ma'am. That is correct. So we talk about a 2.5 cent tax rate increase in 23-24, but we also have another planned GO bond referendum out in 26-27. Plus, we have debt that we're paying on in some of those years on county projects that are going to be coming due. So we're also looking at potentially a 3.1 cent tax rate increase out in 26-27. How confident am I that we will need 3.1 cent tax rate increase out that far? Not very confident, but honestly, I don't have a crystal ball. I do not know what our revenue growth is going to be. I do not know what interest rates are going to be that far out. We will have to see, but my plan, based off of conservative estimates, is a 2.5 cent tax rate increase in now, 23-24, and then 3.1 out a little bit later.
Let me pause for one quick second, Keith, if you go back.
Absolutely.
Yeah, our capital finance plan, the model has been in place for since the late 80s and is solid. The way that we underwrite our debt, we've been using the short-term financing approach since the former CFO, George Quick. We were the first county in the state, first jurisdiction to do that type of private sector financing. So although we say we're not quite sure, we have great estimates based on trends and patterns. And as Keith said, for this, we do try to be conservative. You want to make sure you're not overstating revenues and you get in a situation that you're short. So although it is an estimate, it's a good estimate. And we refine it every couple of years. We always go back on terms.
Exactly.
Did you say 2.5 each year, or did you?
No, ma'am, it would be, in theory, it would be a one-time increase, tax rate increase, not for the fiscal year we're looking at coming up, 22-23, but next year this time, I'm going to be at Claudia, the management, Dr. Sewell will be saying, remember, the board, the citizens either approved, if they approve a GO bond referendum, they basically told you that they're willing to raise property taxes 2.5 cents. And as part of the 23-24 budget process, we will have a 2.5 cent tax rate increase related to the CIP. That is not the same thing as you all potentially raising the property tax rate for annual operating budget. That's a different discussion. Clear? What does a 2.5 cent tax rate increase mean for potential house valuations? At $100,000, that would be an additional $25 on the tax bill. $200,000 would be $50. You can see the range there. You can see what the monthly cost would be for a household of those amounts. So let's say, amazingly enough, the average house price in Durham County now is $350,000. That's an $88 increase in that property tax bill. And that's it. That was the quick and brief discussion. There are some other slides after this that you can look at that talk about next steps related to the GO bond development process, having to go through all the different LGC and politics side of that. But are there any questions? Yes, ma'am.
There's a technical question, and that is, I can't seem to pull up this presentation, this specific one. I can pull up all the others, but just not this one for some reason.
Can anyone else? Does anyone else have? I loaded it as a PDF this morning. Yes?
Couldn't either. Thank you. Okay, so that was this morning. Whatever. I'll check my email. Thank you. I'm glad to have it. Just glad.
Well, we'll send it, and I'll also reload it to Legistar just in case.
Thank you. But I was really thrilled to see the projected tax increase go down to 2.5 cents, which is less than what the voters approved on the last bonded.
Up to 3 cents is what was on the GO bond referendum. Yes, ma'am, Commissioner Jacobs.
So
yes, ma'am, Commissioner.
Was that, no, when you said that, I was just wondering, was that decreased because of the couple of things that you reshifted?
Yes, ma'am. Yes, ma'am.
And it will continue to be refined until we get to the point of raising the actual tax.
Okay.
What we're seeing, the max is 2.5. But we're hopeful it may be lower.
Okay.
But with that number, we're being conservative aggressive, if that's the best way to say it. We've learned from other years, but that is correct.
Okay. I think Commissioner Long was next, and then we'll go ahead.
Thank you so much. I really appreciate this presentation. I had 2 questions. So, and I know you don't want to conflate this, like our taxing with this program, but also just wanting to see like an impact of with the tax assistance grant program that we passed last year. What type of impact do we see on growing that program to potentially minimize the impact that this tax increase is going to have on the average median income folks that we're including in the tax?
That's a great question. I believe to date we've had about close to $400,000 worth of grants that were allocated. The overall budget allocated for grants is close to $900,000. So we do have capacity to help offset that type of expense. What we've always said is that we would come back to the board if additional resources were needed. So for the pilot, this was a pilot year, and I'm sure this is something we will continue to watch, but we do see that as a place to help offset some of those increases.
Thank you. And then one last question. I was going to bring this up with Dwayne separately, but since y'all are here, I thought I'd ask. I had seen this program that San Francisco, and I actually pulled it up, I'll send it to you guys. They were instituting like an empty homes tax, where basically to kind of put pressure on landlords who are keeping homes vacant instead of providing them at an affordable rate, to have a separate tax for them to increase revenue for the county, but also to encourage landlords. And I know there's preemptions in North Carolina around like different taxing rates, but if there was a possibility for a program that could.
That's a great question. That we will definitely have to follow up with Dwayne. North Carolina has lots of limitations when compared to other states. We've tried to be as creative as we can with some of the programs that we've done, but we'll follow up with Dwayne on that one specifically. Thank you.
Okay. Commissioner Jacobs?
Thank you. And just to let you know, Commissioner Lum, the DSS board is looking at revising the criteria for the low-income homeowners relief program to be able to qualify more people in our community. And that will be coming, once it goes through the DSS board, then it will come to us. And there was an interesting article in the newspaper about in Charlotte, homeowners trying to address the issue that we are seeing in North Carolina right now, which is Wall Street buying up our homes, which is very, very concerning, because once we have investors buying homes, they can then control, for instance, what the rents are and things like that. So this is a serious issue we need to all be aware of. So I'm a stickler, for details. And what I would love to see is, before we approve this at our next meeting, I really want to understand, which we've gotten in previous iterations, a more detailed breakdown of what all the projects are that are in the CIP. For instance, right now we have about $30 million allocated for the Board of Elections, but the 2021 master plan doesn't reflect the most current information that we had gotten from the Board of Elections, which is, hopefully we're pursuing the option, which was a lot less than that. So, that's kind of one thing I want to mention. Also, in our I just want to say that our master plan is already out of date, right?
It is.
Because even the impact of the pandemic has been, for instance, the item on Health and Human Services. Well, we're starting to talk about, at least in DSS, that we're going to have a lot of people continuing to work remotely. We will not have the pressure on expanding our office needs, operational needs in DSS if we are going to pursue more virtual options for county employees, or even 4-day work weeks, or office sharing. I'm just saying that I want to recognize that even though, Keith, you referred to we are following our master plan's recommendations, I want to acknowledge that that's already out of date.
And I will make a quick note about that.
Yeah.
For DSS, we did incorporate some of those changed work patterns, which lowered the number of additional spaces that we would need for employees. So if you were to compare the master facility plan from 2018 or 2019 to the one now, you would see, based on projections, it's a lower square footage needed for DSS, and Perry can explain, but I'm sure as they've talked further, that number has gone down even more.
Right. And I would like to understand, especially the cost that is included, like I said, for Board of Elections, but also for the public safety facility, because our board had previously spoken about trying to reduce that cost, since the purpose was really a giant vehicle storage facility, and that cost still seems very high to me.
Yeah, we can follow up, and I think it's also a victim of supply chain issues, inflation, and other factors. So it was lowered before, but a lot of these projects have increased, some as high as 30%, just by virtue of construction costs.
Okay. And so, and we have taken the the broadband out of there, is that correct?
Well, it was never officially in.
It's in the CIP, but it's not counted against debt service. I have another revenue source, which is potentially ARPA funding. So it's not counting against the totality of our debt service payment, even though we're acknowledging it potentially as a capital project that potentially would be funded with ARPA funding.
Okay. And related to the Durham County Stadium expenses, has there been any conversation about other sources of revenue for those, like public-private partnerships or sports commission, or?
For that one, Commissioner, if we can follow up on that one for another discussion, and because a lot of the county-related ones, we do need to make sure the partners are in the room, and for some, we just need to do more fleshing out. What we try to do right now, and for instance, that one, it's probably in 2027, I believe. Our focus, in order to move forward with the timing for the referendum, was to try to really look at the projects in the next 4 or 5 years. And so that's where we've done most of our pressure testing. There are some that may go down or be pushed out. Some may go up because prices are high. You can't find space. And so strategy-wise, we will come back to the board and talk about some of the later ones. But we also recognizing that if they're beyond 4 years, you will have at least 2 or 3 more times to refine that number. So that's contextually important to put in to everyone's forefront.
Okay, great, thank you.
Okay, Commissioner Burns.
That was a really good explanation, Keith.
What part? So I can
All
remember
of
to tell
it
my wife
was.
that I
I
made a
think at
commissioner
times-
smile.
I think at times we browbeat people with like the data is too difficult, but I do applaud you and Claudia and hey Susan, nice to see you here too. We don't do a good, so you did a really good job explaining that, and thank you for taking the time to stop at certain points. I really appreciated that. I feel like there might be people in the community, if they went back and looked at it, they would have a better understanding of it. So that's the first thing. A lot of folks always thank staff. I wanted to make sure I got that one because I understood everything. Now, if you ask me about it tomorrow, in this moment, I get it. Commissioner Alam and Commissioner Jacobs actually hit on something. And I know that Janine and Director Rose are not here, but it wasn't missed on me. I'm always thinking, again, I said it last meeting, I don't want to vote out the people that voted us in here, right? So I'm always cognizant of that. So while I'm thankful for that 3.5% being down to 2.5%, one of the things that, that Janine brought up was there were 19,000 families that we could have possibly supported with the low income housing program. And I know that you all are going back and you all are stress testing it. Like if we decided not to do 10 years and we did 7.5 years, we could capture some more of those. And you know what, if we did put an extra $500,000 in there. So I just wanted to elevate that, not before, because that's three of us that actually I see the benefit in that, and that might take some of the pressure off of our residents, right? Because $88 to some is not, that's groceries for somebody, right? And so I did want to throw that out. I was going to ask about what we moved, because 1 cent is a lot. I'm like, what did y'all move to get it down to 2.5 cents? But before you jump in, I did want to say, for the broadband, I picked up on that. The GEAR grant application has been pushed out a month. Are we getting an application in?
Well, for the broadband,
For
yes.
the broadband.
Yes, that one, we are, the actual ISPs, the internet service providers,
Right,
the ones who will apply to that.
Right.
We have an RFP out right now to have ISPs to partner with us
Right.
to do broadband.
Right.
So some of the ISPs are applying for that grant. I think the closing date is May 4th.
Yeah, they moved it from April 4th, which was the day. The only reason why I bring it up, y'all, that stuff changes so much. We were at the ARPA meeting last week, and then we were on the county managers meeting on Thursday, and next thing I know, they said, well, we're going to make them all sub-recipients as opposed to, I was like, what has happened? And I bring that up because if that is a significant chunk of money that we can use that we don't have to put on people, that's great. And about what we took out, I'm seeing what some of it is. I'm with Commissioner Jacobs. I'm in agreement that, I want us to have a better elections facility. Can we look at what makes, I know we were looking at some grocery stores, some storefronts, and a lot of that property is getting sucked up. Is that one of the reasons why we're having an issue with saying we're going to buy, build, or lease? Is that one of the reasons why?
Well, buy, build, lease is Right. It is a challenge of inventory.
Right. Okay,
so inventory is sparse right now, whether it's land, whether it's vacant properties. As you're talking about the Board of Elections, so there's just not a lot of different options for that. Keith can go through what we pushed out, but it's more of a refinement of sequencing and timing. So, for instance, we did sort of move the timing of, as we shared, the DSS main building. We know there have been conversations about that for some time. We will bring information to the board. But even if it slips up a little bit, that's something we know we can handle. But it's not going to cause a big issue. So the other one was the
IS&T projects and the renewable energy plan, and just getting our head wrapped around what are some big ticket items. So that's probably going to take this year to think about, and we had money budgeted this year, and so I just moved it out a year. There are two sides of this equation. Never forget, that's the expenditure side, the cost of projects, but also adjusted upwards. Our sales tax collection, remember we talked about dedicated revenue. Occupancy tax is finally starting to get back to where it was pre-COVID numbers. That's a significant increase. So some of my revenue projections bumped up a little bit too. So the ability to pay for a project and moving a project out is the alchemy, the magic that says, oh, okay, now I need 1 less cent, potentially less next year and for a couple of years. And we use judicious use of fund balance, like we're using some of our cash that we have in savings account. Not general fund balance dedicated for capital projects to soften that blow. So moving revenues around a little bit, increasing them a little bit. There's a document that Claudia and I put in the Legistar thing. It's a 2-pager. We shrunk it down to 2 pages that sort of gives an overview of the fluidity of the CIP, which is project cost versus the revenues to pay for those. Both of those have multiple variables that can change the overall outlook over 10 years.
So we look at them, especially on the cash flow side, we look at that annually when we set the budget. And we watch that very carefully. You know, our jobs are on the line.
And Keith, I think it's important for us to note that we didn't compromise on any priorities.
We did
Like, right, we're being just judicious in how we're paying.
Absolutely. And for everyone's edification, DPS projects are fully funded at the request DPS has made to the county commissioners multiple times. DTC projects are fully supported at the request made by DTCC, heard by you all from life sciences, building and other things, and the museum. So yes, the only projects that were adjusted a little bit were smaller projects internal to the county. Smaller is a relative term here.
And I noticed that as well, going through it, Keith and Claudia. You guys have done a great job and did a great job in managing that conversation, especially when we almost had a heart attack when we looked at I did, at 3.5
Well, it's okay.
cents.
I mean, it sort of shocked me too, because in 2016, we needed 3 cents for half the money.
Yeah.
So how are we going to get to this at a higher number? So I get it, and so we had to go back and say, well, how do we explain this so it makes sense? Because to the average taxpayer, they're going to say, this makes no sense.
Well, you know, the thing that I've remembered over the years that I've been on this board is the initial presentation is always that way for us. We're always like freaking out. And then after you go back and readjust, it becomes more palatable. So thank you for all of the hard work that you put into doing that. So yeah, we appreciate it. Yeah.
Can I ask another question, Madam Chair?
Go ahead.
Thank you. I am still hoping to feel assurance that Durham Public Schools' full request that includes enough funding to meet their energy efficiency goals and their modernization, goals and their energy generation goals. And I guess we just don't have a clear sense of that. I mean, I did read, I promise, I read all the responses that you sent us about that. One thing, it sounded like they wanted to do kind of an energy audit, similar to what we had done, maybe needed some funding for that. But I hope, that they've included within that large number, dollar figure amount, $500 million that's in the first bond or whatever. 400 and something in the first bond. I hope it includes, adequate and sufficient resources.
There is and Mr. Davis will speak to this. There are dollars within their original scope to address some of the projects, but just like us, some of that will have to happen over multiple years. Our allocation was close to $32 million. It's over 10 years because it takes some time to ramp up, et cetera. Again, that is one. I know there's a big push community-wise to look at how do we do a green bond. Our practice is to make sure that we have a plan first, and then we move forward with supporting it from a debt perspective. We have ways to support it once that plan is finished. And so there's always a way that we can address it, because but we want to make sure, well, what's integrated and what's funded already. Some of the questions y'all asked us about our own energy strategy.
Yeah, that would be good to know.
And that's from a best practice perspective, why you would not see a line item that specifically says green bond, but because we know that some of that is in some of the efforts happening already, but we also first need to have a plan, just like we did in the county, as well as the city, that's independently fleshed out.
Yeah. Are we going to, maybe we should, ask the school district, is that something they're planning to do?
I'm sure that's something they are planning to do that. And again, we're talking all around Mr. Davis.
I really like how our staff had a specific line item for our energy initiative efforts, and I thought that's great, and it makes it very explicit, you know, for taxpayers and us as commissioners to see, wow, this is what we're spending. So.
Two things I'd like commissioners to remember. Number one, the CIP is biannually updated. We will be sitting here 2 years from now having a review of a 10-year span then, to which schools may have clarified, added to that 10-year plan around the renewable energy, so it may become clear at that point or earlier. Secondly, I want the board and the citizens to know when they see $423 million in GO bonds for DPS, that is not the only funding source that DPS is getting from the county over the next several years. There's significant LOBS funding also going to Durham Public Schools. It is well over $500 million in total that DPS is getting. We just focused on the GO bond amount. You will see an amount in the DPS presentation that's higher than the 423. Know that we're supporting that with LOBS funding. We are fully funding the DPS request for their capital projects using GO bonds and other funding sources. Stop there.
We will transition to, if the board is comfortable with our staff's recommendations, to first the North Carolina Museum of Life and Science and their team. Then we'll have President Buxton to share with Durham Technical Community College, and Fred Davis Jr. will come with Durham Public Schools. We asked them to be high level, and you know, they could talk for some time. It's been a great partnership with them, and I will now turn it over.
Good morning, Madam Manager. Commissioners, thank you so much for making the time to hear from us today. I'm so thrilled to be here with you in person. My name's Carrie Heineman. I've joined the museum since you all met a year ago. I'm also joined by Roy Griffiths, who joined the museum 3 decades ago. And we've got Kate Center, who is our new VP for Development, with us here today. We're excited to share with you a little bit. Of course, just a brief reminder, we've been with you for 8 decades, and we've been serving the community proudly across that time. You've seen we've made a lot of evolution over those years, and today we sit before you an award-winning educational and cultural amenity for the community. We deliver about nearly $50 million in economic impact annually. Also, just to remind you how we do the work we do, I'm taking you through the strategies that we focus on, delivering exceptional experiences for the community, reaching out to our very diverse and growingly diverse community. We strive to be a science venue for everyone, to nurture scientific thinking, which we all know over the past couple of years, it's made the case that we really need to ensure we have a scientifically literate community and electorate. We are very committed to conservation, and from the mid-'70s, I suppose, on, we've been very committed to the efforts of hands-on experiential learning in our efforts. Just a word on how we're recovering, which is very well, thank you. We're up to about 527 attendees is our projection for this year. That includes nearly 15,000 household memberships. We also have about 1,500 Ignite Learning memberships. Those, to remind you, are those $5 memberships we make available to members in the community in need. We identify those families through about 25 social service community partnerships, about 25 agencies and organizations. Those Ignite Learners are visiting to the tune of about 10,000 this year. We're excited to get back to our Durham Community Days. We'll put 22 community days on the calendar this year. We look forward to serving about 120,000 children. Our big opportunity for getting back is those school groups that we love to serve and hope to serve and try to serve, but of course, DPS aren't doing quite as many field trips given COVID this year. And of course, we have our free under 3 program where we welcome all children under 3 years of age, and we had about 33,000 or anticipate about 33,000 joining us this year. A reminder, again, we work very closely with a lot of organizations in promoting community science. That includes Families Moving Forward, El Centro Hispánico, El Futuro, and the Haiti Heritage Center, with whom we've just, we're partnering on a climate change grant we received from the Borough's Welcome Fund. Early childhood development, we are working hard to support the efforts that the community and DPS put in place for early learners. You'll see how we're doubling our Play to Learn exhibit space this year. Again, of course, for school-age children, we're committed to summer camps. We have inaugurated a new Sparks Leadership Program with Brogdon Elementary this year, which is an after-school leadership program for students, and we're looking to expand that in the coming years. And we also inaugurated a Youth Climate Summit this year in February. We welcomed 50 students from around the state. More than 50% of the students who were there were actually from Durham, but we engaged them in robust discussion and encouraged them to do action planning in their own communities. This is a project we'd like to see grow and thrive in the coming years. Brief update on the 2016 county bond projects. Thank you again for supporting the work we do there. What you're looking at here, I hope maybe you've been up to visit, is our Earth Moves exhibit, reaching back to our heritage as a former quarry. We're exploring the geosciences here. This is a great example of how we leverage those bond funds to go out and inspire further investment in our projects. So this one in particular had a lot of additional investment beyond what the county put out for us. Studio Earth is a newer type of support that we're putting on our outdoor exhibits. This is an outdoor classroom space. We are committed to experiential learning with a low emphasis on didactics, but this is an opportunity for us to do some facilitated learning as well in this vicinity of new exhibits. Of course, we put our parking deck in place. We have turned to using that several times already this year. Those community days are days in which previously parking would bleed out into our surrounding communities. We're very excited to have a state-of-the-art parking deck for our visitors at this point. Our Woodland Classroom came about from the 2016 bond. That is an American Institute of Architects regional award-winning design. It also played the role of allowing us to facilitate classrooms for people who couldn't serve their kids in their households. We had 4 classrooms of students all through the fiscal year 21 COVID years where we brought children in and could provide a classroom experience for them when they didn't have appropriate resources at home. This animal quarantine building, we're almost there. We've got our temporary occupancy for that building at the moment. This is one of the pieces which will allow us to go back for reaccreditation. We are an accredited zoo, one of only 250 in the country of about 1,200 organizations that support animal care on their campuses. So we're very proud of that role, and this animal quarantine building allows us to keep our accreditation. Again, some of the other work that we're doing with the 2016 bond, Explore the Wild is getting an upgrade in all of our signage. We're really focused on urban ecology as an educational point. And here you'll also see that from an accessibility perspective, our signage will include plenty of Spanish language going forward. And in this case, we've also included the Tutelos Saponi language as well. Our sailboat pond had its 12-year-old mechanicals upgraded. And then you'll see here also a wetland walkway, which, true to our nature, is accessible by folks in wheelchairs as well. It's universally accessible and an opportunity for people to really get out and get intimate with the water. And finally, if you come up to see us right now, you'll see we're in the final stages of a few of those 2016 projects. Our entry plaza and lobby are being expanded so that we can welcome both individual attendees alongside those big school groups that come in. So this will make it a much easier, welcoming experience for them. And then our Play to Learn programming. We know that the community is committed to universal pre-K education. This is our early childhood development space. We've doubled the space that we're devoting to this area. We hope to work in partnership with DPS to help promote registration in those pre-K programs for children. We'll also be taking the opportunity to include a maternity room as well as a sensory room in this update, which will be ready for the end of the summer, early fall. Just a quick look at where we are from a space perspective. You can see Durham County growth is that gray line. Our attendance is the red line. You can see our growth is influenced by the growth of the broader area. But you'll also see on that gold space how we are leveraging all of our land. So you can see as recently as 1998, we were utilizing about 50% of our 84 acres. And right now, we're pushing up against 95%. So with that, and the fact that we're reaching capacity on our 84 outdoor acres, it makes sense for us as we move into 2022 bond requests to look at upgrading our insides. So we are excited to explore the upgrades of about 9,000 square feet of new exhibits in our buildings. Of course, we're looking to inspire those next generation of local workers, create the space to inspire future scientists, future tech workers, but it's important that we ensure that we're focused on the critical issues of our time. So being relevant to that crew is important to us. On the first floor, now we have a weather exhibit. We'd really like to explore the impact of climate and humans on the planet. Upstairs, we'll be looking at exploring the technological and scientific advances taking place in the world, but of course, a lot of those advances are taking place right here in our region, so it's a wonderful opportunity for us to explore those. As I mentioned, we see this as a great opportunity to signal to the broader organizations in the region that we're a good investment. When you invest in us, we can turn and leverage that investment, bring other people in to help us improve those offerings. A great example of how those upgrades to our exhibitions also inspire improvements in our programming and in our outreach. We talked about the wetland walkway allowing us to get more engaged in urban ecology. We talked about our Youth Climate Summit. The museums also played a leadership role in heat mapping locally and working with organizations locally. This ties into the groups that were here before. We've been working with Equity Before Birth in looking at how heat islands disproportionately affect communities of color, and in particular, maternity issues. So we've been going out and doing quite a bit of climate resilience planning with communities across our region. Of course, another area we're committed to, along with climate, would be making sure that as we grow and expand, we do so with a reduced impact on our environment. We're very focused on ensuring we help to sustain the rich biodiversity that we enjoy here in Durham. So here you'll see we're looking to add a couple of photovoltaic arrays to our campus, on our warehouse, and on the butterfly house. We're looking to install some dark sky compliant, environmentally friendly lighting. That will allow us to expand the hours we serve our community, so maybe taking advantage of those evening hours. Since we can't really expand our physical space, we can expand potentially our service hours. And then we're looking toward shifting our full fleet of vehicles toward electronic and looking at adding more electronic charging stations to our campus as well. And of course, looking to our revitalizing our infrastructure. We're actually on a trend line to welcome nearly 700,000 people toward the end of this upcoming bond period. And people who come to the museum have become accustomed to a certain level of experience. It's a high level of experience. We want to maintain that for our visitors. Our visitors come and spend from 4 hours to sometimes all day at the museum. We need to be able to ensure they have the amenities to take advantage of the educational experiences that we have there. And for us, with all this growth, it can take about a day. So we're looking to invest in areas where we convene meeting spaces, so an indoor auditorium upgrades, adding some outdoor programming capacity, as we've all learned during COVID. That's a really nice opportunity, and people feel safe in that space. We're looking to make an upgrade to our Sprouts Cafe, enabling remote ordering from across the broad campus so that people can get hungry at the 84th acre and then walk in and pick up what they want to eat, but also taking advantage of that space to teach and discuss culinary chemistry, to talk about food insecurity, sustainable farming efforts, and just the value of healthy eating. So we're very excited to explore those infrastructure upgrades. And of course, as part of our DNA, we're constantly looking at ways to improve our accessibility, whether it's through language expansion, whether it's through neurosensitive spaces or continuing to be accessible to those with physical disabilities. And that's kind of, in a nutshell, what we're hoping to do in the coming years. And we thank you again for the opportunity. We thank you for the longstanding partnership, and we welcome any questions or comments for us.
Thank you. Thank you for your presentation.
Thank you.
Claudia, anything for you?
No, I would just say thank you very much.
Thank
Excited.
you. Board members,
Mine is really quick.
Commissioner Burns.
One, nice to meet you. We have met in person. Carrie, as always, I do sit on the museum board, and I do remember going through the interview process, and I wish that if we're bringing somebody in who is from outside of Durham, they could have the intentionality that you have had. And she will reach out, she will call. It's not just me, but it's other people in the community. There are stakeholders in this community who have never been to that museum. I think we talked about the chancellor had never been there, and you made sure. There were children who, they go when they're in school. There were other children who had actually never been to, hadn't heard of it. You were really creative in the way that the store worked, so we were able to bring it. That revenue was brought in. I did see, I'm not going to ask the question. I saw the teach of culinary chemistry, so they're going to have culinary at Northern High School. That's right up the street. Like, this is a wonderful time to look at a partnership. I love the green energy. I just want you all to know, like, I'm behind this one 100%. It is not some of the outright kind of what in the world ask that we have seen. I think it's fair, and I applaud you for at least letting us see, because I wasn't on the board in 2016, letting us see what those bond funding dollars went towards, how you implemented those, and what structures are in place now. I enjoyed the campus. The last thing I will say, we talked about, I think it might have been Keith that said it, who said we're funding things of all ages. I have enjoyed this museum in all facets of my life. I think I told you when I was in college, we used to rent it out for parties. I would not. But thank you for everything that you've done at that museum and making everybody in Durham feel welcome and like they can enjoy it. That has been huge for me.
Thank you, Commissioner Burns. Commissioner Jacobs.
And thank you. I want to echo what Commissioner Burns has said. I appreciate all the creativity and intentionality that's reflected in what you all are trying to do. And so following up on that, I would love, you talked about some of the early childhood spaces that you're creating in the museum and some of the partnerships with Durham Public Schools. So I want to make sure that our Durham Pre-K program gets connected to you. So I'm going to ask Drew to make sure that we get connected because this is a big investment that we're making in the county, and it would be great to have our pre-K providers also a part of the network and being able to be a part of what's happening, and even thinking about some other county departments like our cooperative extension, our library, who have some great youth programming, but especially around environmental issues. There's great things happening with our cooperative extension, soil and water. There might be some other opportunities to partner there as well. So
I agree. I was enjoying the previous presentation, and my mind was kind of exploding with ideas for partnership.
So I think there's some other ways to get everybody connected. Thank you.
Thanks, Commissioner Jacobs.
Commissioner Carter?
Ditto what everyone has said. I'm following Madam
Great.
Chair's instructions.
Thank you. Commissioner Long? I like that ditto stuff. I just want to say thank you as well. And just for a flashback, I used to serve on the board years ago. And I remember when you got the sliding, I don't remember what you call it, but
Treehouse.
it's treehouse.
Hideaway Woods.
And I had done that since I was pretty young. So I slid down that thing. You never heard so much yelling in your The kids thought it was hilarious because they thought it was nothing to it. So I haven't been over there in a while, but I look forward to visiting really soon. It would be great to have something for all the board members to be able to come over and visit at the same time.
We'll look forward to hosting you soon.
That'd be great. Thank you so much. If there are no other questions, okay. Thank you for your presentation. I have a question for the board members. Are you going to forego lunch until 2 o'clock? Or do you want to go back and take a few minutes and grab something and bring it back with you? What's your preference? You want to take a few minutes and, okay. Before the next presentation starts, why don't we take a few minutes and go do that and just bring it back out here so that we don't have people waiting, okay? And we've got some munchies, crackers and chips or something. Would any of you like something? Are you okay? All right, we'll be back in, what, 10 minutes, 5 minutes? 5 minutes, we'll be right back.
protecting somebody.
Right. Well, at least we're all kind of pretty much pros at working remotely. Dealing with other things that sit here.
Yeah, exactly. Well, that's the thing. You get one.
This is interesting. One thing I would chat with Kim about is.
Hey. I know you guys are eating. The general service, they lost that form, so we just need a signature for your key.
Okay.
That's it, that's all.
Okay.
I'm interested. We spent half of our children's lives.
Oh, okay. Great.
Yeah. And we have others that are like, in the Museum of American History, they're, institutions that think are,
You just want us to sign our names off.
right? Yes.
No, we're good.
For 20, 30, 40 years,
Did everything 94? Anything?
Got my finger.
Okay.
Thank you.
Okay, welcome. As the manager get back, we can start.
Thank you, Macy.
Yeah. Yeah. Right.
You just gotta.
And I don't blame them for asking.
Right.
Claudia. We can go ahead and get started.
We will have our next presenter.
Thank you.
Partners with the Durham Technical Community College, and President Buxton will introduce his team. We'll get started.
Thank you, General Manager Hager and commissioners. It's great to see you. I've got Dr. Kara Battle with me, our Chief Academic Officer at Durham Tech, in charge of pretty much everything. When you think of community college and you think about what's happening in classrooms and labs, Dr. Battle says grace over that. And our Chief Financial Officer, Andy Kleitch, with us as well. I've got some other colleagues with me who are new that I'm hoping I might have a chance to introduce you to at some point, and also wanted you to get a sense of our most important partner here in the Durham County Commissioners. I also, Manager Sowell, want to recognize we have a strong partnership and great working relationship. Folks like Claudia Hager and Keith Lane, and very much appreciate that partnership as we navigate new opportunities. And speaking of that, I just want to say that from our standpoint, when we look at the opportunities before you, we see a county commission and a region and a community that has made investments in this area that has resulted in many, many more people continuing to want to come here and work and live, and many more companies wanting to locate here and attract talent and grow here. And what we, as we began to look at this capital improvement plan, wanted to take stock of is, given that reality and the changing dynamics in this community of people wanting to come here, companies wanting to locate here, what is the role that we play in then providing the education and training opportunities and connecting our residents here in Durham with the great career opportunities now available, and connecting our employers and our partner employers to the great talent that we have here. And so we wanted to take a look. There we go. In 3 areas where we thought we needed to position ourselves to respond to the demand in this community and really respond to what you have created in attracting talent and companies to this area, and really looked in 3 areas. What are the new facilities we need now and moving forward that we can't accomplish the kind of education and training we need to with our existing facilities and footprint? What are some of the key repair and renovation needs? And then what are the property acquisition needs that really protect the county and the college's interests as it relates to Durham Tech? What I want you to know is when it comes to new facilities, we are looking at areas that we know are in demand now and projected to be in the future that require in-person, hands-on training. Things that can go online, things that can be done in classrooms and flexible settings. We have those facilities, we have that technology. We're not looking for facilities to do that. We're looking for things that we know now and in the future, and that's what I want you to think about: life sciences and health and wellness, or our healthcare-related professions. We have to do that in person. That's not changing anytime soon. And we also know they are in demand and projected to stay in high demand moving forward. And also, they are the areas where we continue to see increases in enrollment even through the pandemic. So even capping our associate degree nursing program, even having to look at how we're going to do life sciences, those are not areas where we saw declines. And with the companies that are coming in and the pressures on our healthcare system of a growing population, these are places where we're continuing to see demand, not only from employers, but also from our residents. I'm not going to delve on the repair and renovations, but there are some significant needs that we have that we can take care of, or at least begin to address when we do these two new facilities, given the space that will free up on campus. And then finally, as I'll show you in a map, there's some property challenges we have both internally and on our boundaries at main campus that I think is in the best interests of the county and the college to make sure we are protecting from market forces that may redound to our benefit or not. So first thing I want to talk about is the two projects that are new facility projects in the bond. One deals with a new life sciences training facility that about 8 months ago we began collaborating with 4 important partners of ours, 4 biotech companies that we do either customized training or have partnerships through BOLS or other programs in biotech about what a joint training facility could look like on Durham Tech's campus right off 147, with strong access by our residents with public transportation, but also our companies in this region. And so we brought those 4 companies in. We partnered with O'Brien Atkins, who is doing our campus master plan revision, to do some work on what a one-floor facility and a piece of property we currently own and that we lease out, but we would build on that site and the kind of functionality we need so that the companies could use it as a training facility for some incumbent workers, and we could use it as a facility to train new employees. The companies basically said to us, the most important thing to us is you've got a place to train new employees because we are challenged, and we are challenged more every day. So what you see here is a quick look at what this one-floor facility would look like. And the ballrooms, those are simulation labs in these 6 areas on the side: aseptic processing, fermentation, purification, and the like. That would be simulation sites within the facility for prospective students and some customized training to happen with those and other companies in the area. This is an example from some other higher education facilities of what those sites would look like when you look at things like device assembly and packaging or aseptic training, and what this in-demand training facility would look like if we were to build it out. Second new facility relates to our health and wellness programming and what, as you know, is in escalating demand for personnel and shortages in this area around healthcare workers. We are the only community college in the state of North Carolina that serves 2 tertiary care facilities in UNC and Duke Health Systems. The only one. I'm going to show you some pictures of the facility we use to serve those 2 tertiary care facilities, but first just want you to see the programs of study that we provide that provide direct routes into not just Duke and UNC, but home and long-term care and other health and wellness related professions, and what the programmatic space needs are on that right-hand side to do the proper preparation and training. Simulation is critical in these applied fields. Just like I showed you the simulation environments for biotech, we need those kind of simulation environments so when our nurses or our surge techs or anesthesia techs or nurse aides are going into practice and their clinicals, they have an understanding and a feel for what those settings look like. This is especially important coming out of COVID because we have the ability, if we have strong enough facilities, to do some clinical at our own facility. That was really important during COVID when things shut down and we couldn't send for instance, nursing candidates out to many spaces to do clinical. We were able to, but it was a much more difficult process. You can actually do clinical at your own site, and with the incredible pressure on clinical rotations for these students right now, given the growing population and health, we need to be able to do some more of that if we're going to expand the number of, for example, associate degree nurses that we serve. This is particularly important because with our accreditation bodies, we can't just say, we're going to serve double the number of nursing students. We've got to have the space, the literal space, and the equipment in order to do that. And so when you look at what we use today, on the left, you'll see that's what our associate degree nurses work with. That's a classroom and a simulation lab all jammed into one. Over on the right side, that's our medical assisting, which is a very high demand field for us right now. On the left is supposed to look like an operating room for our surge techs. I've been in a couple operating rooms. That doesn't look like many I've been in. And then on the right is our simulation lab that we use across. This is not what our tertiary care hospitals need. This is not what our students need. This is not what our accrediting bodies want to see when they expand operations. So this is what we're trying to replace with a facility that can, in fact, meet the needs of our students in this region. Finally, I want to talk about the third project in the 2022 proposed projects, and that's property acquisition. Just to orient you, if you go north of this, you'd get up to Troy, Middle, and Reservoir Streets before you hit 147. If you're on the left or the west side, you're getting close to McDougal Terrace and NC Central in about a mile. If you go south of this, Unity Village Park and Heights. Beacon Heights, right down there, housing community, and then over to the right, you get to Briggs and 147 as you're going out. And by the way, that's where we're looking to build affordable housing down on South Briggs. What you see in this diagram is the physical plant that we have in the middle of the campus is dominated not just by our own facilities and some parking areas. The two areas in the green are where we propose to put on the left side or the west side the Allied Health Building, Health Sciences Building, and to the right or the east side, the Life Sciences Training Facility. We have the space, the land to do that. The reddish pink or purple, I'm not great at my primary colors, but that is property we do not own. So internal to our campus footprint and right on our western boundary, that is property that we're kind of at the whims of the market, what those owners might want to do, to whom they might want to sell, whether or not it would in fact align well with campus needs. If you look on this and you see the white building, the Nathaniel B. White building up on the top, the northern side, just north of Lawson to the east, that was the first building in 1961. 60 years ago, that was the Durham Tech campus, or the Durham Industrial Education Center campus. Obviously, we've grown in the last 60 years. The challenge with our footprint on main campus right now is beyond these two new facilities. As we project out into the future, we do not have a lot of space to grow, whether that is a new industry training facility we would need, or whether that's a collaborative community facility that could be health and wellness or recreation or childcare that we might want to do with our community partners. We just don't have room to grow. The spaces in brown are either parking lots or really challenged topography that either falls off and makes it very difficult to build, or down on this southeastern side is basically wetlands. So really the only opportunities that the county and the college are going to have as we move forward are those pink areas, and we just think the county and the college needs to be in control of its own destiny as we move forward. What we've tried to do, and I'm going to wrap up here, in these projects is focus in on how do we respond to demands that are here now for the county and the opportunities for county residents. What are the things that demand in-person, hands-on training that we know we need to have? How do we position the college and the county for growth down the road and do it at a time as prices are escalating before we get further? And then finally, how do we set up our other buildings that are on campus that we can then use them in the back years to do some renovation work that respond to emerging program needs or those that remain? You have other information in your slides about the renovation projects in some areas where I know staff is looking at annual appropriations and things like HVAC. I'm not going to go through those. You have them. I'm happy to answer questions. But Madam Chair, that concludes my presentation.
Thank you so much. Thank you, all of you. Ms. Battle, thank you for your presentation. I just got talked to about you this weekend. Last week, I was in Fort Lauderdale, and I can't tell you the gentleman's name, but he's just talking my ear off about Durham Tech and President Buxton. And do you remember who he was, Wendy? He was from Wake Tech.
Matt Smith from
Is it?
Matt
Wake
Smith,
Tech
sure.
was with
Yeah,
us.
okay, okay. I know one of us would remember it, but I was very proud of the work that you guys are doing together. So thank you. Questions, concerns, Commissioners? Commissioner Carter?
Yes, thank you so much for the presentation and your approach to your capital needs. Really appreciate it. And Dr. Battle, thank you for doing everything at the college. But, you know, what a wonderful and valuable education, you know, residents are able to get at Durham Tech, and just really appreciate what a gem you are, and how much more we want people to recognize that and take advantage of it. I am really also very pleased that you have identified needs and that you came forward with them and made a substantial request. I don't remember where I saw this, if it was in this packet or a previous packet, but compared to other counties, I don't believe we've been spending as much on capital needs for our community college. I feel like I saw that somewhere.
You did. Actually, President Buxton shared that information with us. It was maybe 2 or 3 weeks ago.
So very compelling, you know, if we needed any reasoning or additional excuses to approve this and move forward with it, that was very compelling, I thought. So thank you.
Thank you, Commissioner Carter. And I'll be happy to give you one number, since you mentioned it, if I could, Madam Chair.
Go ahead.
To our east, that little community college, Wake Tech, over the past 10 years, they've done about 10 bond projects, $560 million. We've done one for 22, 1.5 with some renovation. The challenge that we have right now is the areas that we need facilities to prepare people. It doesn't matter if Wake Tech is bigger or Wake County is bigger, we're trying to get our residents into those same jobs. And life sciences is Exhibit A, healthcare-related jobs, Exhibit B. We want our residents to fill those jobs. And there are more than enough to go around, but we know we need to do our share. And so when 10 of the 15 largest jobs announcements coming into 2022, 10 of them were in Durham County. We feel challenged to respond to that and be your partner to do that.
Thank you so much. We want our workforce to be ready for the jobs we're recruiting, so for the companies we're recruiting. Thank you. Thank you all.
Thank you.
Commissioner Long.
Thank you, Chair Howerton. Thank you, JB, for this presentation. And my questions are going to also be directed to Dr. Battle, since she runs everything. With the expansion, how many more students do you anticipate being able to accept in service?
Excuse me, thank you for the question. For the life science building, we anticipate being able to double the number of students we're currently seeing. Currently, we are operating outside of northern Durham and partially off of our main campus, so bringing everyone to the same space, we think we can double that experience. As far as the health science building, there are some limitations as far as accreditations and how many students we can have, but with more space, we can serve more students. So I don't have a number for you for that one, but definitely increase the number of students that we're serving for health and wellness.
And then my second and last question was, I just got intrigued by this by looking through your list of programs that I always knew you offered this, but aligned with Director Jenkins' presentation earlier about wanting to recruit more public health nurses. This is more so like a question to my board and like our staff. What type of programs could we potentially create as we're trying to recruit more nurses for Durham County that's partnered with Durham Tech, that, like, you know, if students go to Durham Tech, get trained, and become nurses, and being able to offer them jobs into Durham County after.
We would love to be part of that conversation.
Okay, Commissioners Jacobs and then Commissioner Burns.
Well, thank you all so much. And this is very exciting because I'm just really appreciative of the pipeline that we're really finally building in Durham, between Durham Public Schools and Durham Tech at the center and the heart of it, and then with our employers. And I wonder if you could just tell us a little bit more about some of the public-private partnerships involved with this, because, obviously there's a lot of opportunity for the private sector to also provide funding or support in different ways, and then especially with the students, how we then really actually connect them to the jobs, so if you could talk a little bit about that.
Dr. Barrett, will you say a few words about our emerging DPS partnership on the life sciences front?
Yes. So currently, in the fall, we will be offering a CCP, Career and College Promise, opportunity for Durham Public Schools for the biowork and life science program. So though those students cannot be employed until they're 18, they can take the training prior to 18. So they're going to come to our campus. It'll be a hybrid version. Initially, they'll come to our campus for the laboratory portion, but the hopes is that we will soon offer it on their campus and in their space in the spring. So that's one of the partnerships that we have. We also have partnerships, the RTP Bio that was announced, I think it was about a week and a half ago now. So the partnership with Wake Tech and Durham Tech to kind of blur the lines between our counties, Wake and Durham, and just, focus on serving the students and getting them into these well-paying, life-changing jobs that are out there in life sciences. So there are several companies who have joined and who are part of that partnership. And then with our own life science building and the Bulls building up local labor markets, which you are very familiar with, we have 4 prominent companies that have partnered with us in order to fund the stipends for the students and are funding that effort, and are also looking to help fund some of the renovation of the building that's on campus. And I'll turn it over to President Buxton to tell you more.
Yeah, so let me say a word about the 4 companies, and it may be at 4, it may be that we bring more into the equation. They have been at the table since the beginning, and they are remaining at the table, and whether it's the kind of capital expense construction side, that's an ongoing conversation, or maybe more to the point, to the equipment and ongoing operations and equipment refresh side, they want to be a part of this solution. And so they have been very strong partners. The schematic I gave you is from our work with them. This is what they helped us co-design, because they know they need this, and they see this as representing life science companies in the area. We know we need this to feed people in. So I think we have a strong opportunity with this building funded by the bond to then have them come in as our strong equipment, ongoing refresh and expense partner, or potentially as a CapEx partner.
Great. And similarly, with the healthcare program, as Commissioner Alam was mentioning, we know this is a national crisis, right, with COVID, and I hope we could partner, with our public health department, with NCCU's nursing program, Duke, the medical centers as well, for really creating that pipeline. And you mentioned the blurring of the lines between Durham Tech and Wake Tech, and Matt Smith from Wake Tech was on the RTA tour. And if you have time to stay for the next item, because Durham Tech is within the 1 mile, is within the greater Triangle Commuter Rail Corridor, and that is going to be a really important conversation about connecting people to, Durham Tech being a part of the conversation about the commuter rail, connecting people to jobs, education, and how we do the last mile connection to Durham Tech. So you're in the corridor.
Yes, and have a Go Triangle conversation at 2:30.
Oh, wow.
If I could mention, since you mentioned it, and Madam Chair, if you got 30 seconds, I don't know if you've received this yet, but Duke President Price and Duke Health Systems Chancellor Gene Washington are sending you a letter in support of the healthcare building project because of the need that they have, but also referenced in that letter is their continuing conversation with us about investments they're going to make in us in order to provide the kind of training and increase our facilities. So I just want you to know that other higher education and employer partners are stepping up to support the effort and support your effort.
Wonderful, wonderful. That is wonderful.
Thank you, as always. And also, I want to acknowledge your other staff because he brought everyone. Just in case we had questions. And workforce development.
Jerry Jones, our new Director of Workforce Development, Center for Workforce Engagement. Melissa Ockert, who deals with all our health and wellness. She's our dean. And then Susan Bowen, our new Chief of Campus Operations, which brings some new capacity for us to do these projects.
So
thank you, Commissioner Burns.
Oh, yes. So welcome, welcome, welcome. I did have one ditto, so I'll throw the ditto out there. This is one that, again, no surprise we all care about. I did want to follow up and kind of sort of elevate something that Commissioner Lom did point out. I think for me, one of the issues that we have with even our school nurses is it is very competitive out there if you're a veteran nurse. We're looking at $10,000, $20,000, $30,000 advances. You're looking at them doing $190 an hour in California. That demand is high for new nurses, but the thing is that salary requirement is. So I would like to see what that conversation looks like, with DPS. So I just wanted to echo those sentiments. I did want to jump out there and just ask, it is not missed on me. Every time I drive down Miami, Wake Tech is building something new on that campus. And so I do understand the sense of urgency that we have to build on our campus. And students are like everybody else. We want to go into buildings and learn where it is aesthetically pleasing, right? So sometimes you'll just go to something else because it's shiny and new, and there's something shiny and new in Miami. Well, let's have something shiny and new on Bacon and Lawson, right? My only question is, I see that when I'm looking at these proposed additional land spaces, so these would just help me out because I promise you I was paying attention. Would the new building be proposed on one of the pink spaces or the suboptimal building area? Is that where I'm?
No.
The 74, so okay, I'm not.
The two new facilities are on green areas, property we own at present.
Okay, even better. Okay, so that answers that. And then I guess the very, very last thing I would say, so one of my commissioners brought it up, so it is not an idea I had. And I hate that I don't see Andy Miracle, but not that he was supposed to be here. I think that as a board and as a community, we have all this synergy around jobs right now, right? You know how hard I've pushed. We got the EDA grant to help with the aseptic space. You have 4 really great partners. But it is not missed on me that we have a lot more partners coming in. I just want to elevate the idea that it might not be such a bad idea as we are talking through negotiations, whether it's with JDIG or EDPNC or with the Department of Commerce, that we get some buy-in for you. Whether it be on equipment, whether it be on buildings. If they're going to come here, they're going to invest here, they want to work with our people here, we would like to see them perhaps do a specific investment into building up that campus. And I know which one it was Commissioner Carter who had that idea. And I remember I thought it was a great idea at the time. And I would be interested in seeing, maybe from an economic development standpoint, how we work with our partners to make sure we get that direct injection. Not that we don't love you always asking us, but we might not always be here. And I want you all to be on stable foundation where if we're not here and you don't have this board, that you're in a better position and there's a fund where you can build the way you need to build. Thank you.
Okay, are there any other questions? Well, we just want to thank you for all of you for the work that you're doing, and you're doing some extraordinary, innovative things that we have been wanting for years, and now they're happening. And we want you to know that we absolutely support you, and we thank you for all the things that you're doing to enhance the citizens of Durham. That's what we wanted. So thank you again.
Thank you, Madam Chair.
You're welcome.
I will now invite Mr. Frederick Davis Jr. to come and share highlights on the Durham Public Schools projects. We've talked about them probably more than the others, so this will be very high level, and we will answer any questions.
Good afternoon. I'm Frederick Davis, the second, my father would say, so we'll just, but Frederick Davis is fine since there's only one in the room today. But thank you for the opportunity to provide you an update. We presented this, I think, in October to our board, and so this will really, again, as General Manager Hager stated, give you a high level of our plan to let you know that we do have a plan and how we're carrying forth our plan to really update and capital improve DPS facilities. A part of our 5-year strategic plan was in Priority 5, Goal C, to make sure that 100% of our buildings were adequate, appropriate space and size, as well as making sure we are responsive to the state statute of reducing the class sizes from kindergarten to 3rd grade. The other part of the strategic plan, Priority 5, was make sure that we were improving our physical environments for adequate student learning and safety. If you travel among the 50-plus sites of Durham Public Schools and the 33,000 students, you will notice that a majority of our buildings have trailers. We believe when we talk about education and suitability, it's not fair for some students to have to take some classes outside of the normal learning environment, and thus that's what we talk about, improving our physical environment to enhance student learning and ensure safety. Also, unfortunately, some of our buildings were built in the 1980s where walking from a campus approach outside to maybe a 3rd grade classroom was appropriate at that time, but unfortunately due to several events of security and violence, I want to make sure that we enclose all of our facilities, and so that's a part of the strategic plan. In order to do that, we established several benchmarks. Lions Farm, which is currently under construction and will be opening this August. Elementary F, which is currently in design and planning. We plan to open that in the fall of 2024. And then we have the 6 school renovation additions that all would achieve the adequate class size for the state mandate. In terms of the educational suitability, we do have pre-K and EC programs at some of our sites, but in order to be equitable, we want to make sure that we have a pathway, a regional approach. So we want to make sure that we have pre-K and EC opportunities at all of our schools. And again, we want to enhance our campus security, ADA accessibility by replacing mobile classrooms. And then we looked at, as we move forward and to higher education in the high school level, we are doing a new state-of-the-art Northern High School, which has a culinary focus, among other great programs. And then among the other renovation projects, we want to make sure that we modernize our efficiency in our building systems, HVAC, mechanical, and then look at another great performing arts in a new Durham School of the Arts building. This was the 2019, actually, we came before you with the list of prioritized projects. As you see, that number here was over $500 million. In 2020, working with the county, they provided us some funds to look at a tabletop, in 2019, we had a Cummings report that, let me go back, brought to you these numbers. That report was done by Cummings that assessed all of our facilities, and from this list, this is the prioritized list. In 2020, we took that tabletop approach and really looked at going under the hood and make sure that we would detail enough that if we were spending this money, our stakeholders and our community partners would see how best to utilize this money. And so we look at higher efficiency building systems, enclosing the building envelope, sustainability goals in terms of well and LEED. And we found that at the height of this research, there was something of a pandemic that happened. Unbeknownst to us or out of control, we found that the numbers and the costs associated with some of these facility condition assessments skyrocketed due to labor shortages as well as material increases. We also wanted to make sure that we were able to sustain another perhaps pandemic, and when we looked at moving kids spatially, we knew that we didn't have enough facilities to do that, and so we had remote learning as well as in-person learning. However, if we were able to build new facilities, we could strategize a little more to move students around and to not jeopardize or reduce any instructional time. And so these were, again, the 6 priority projects originally in 2020, but due to the pandemic as well as rising construction, inflation costs, we presented to our board in October the new proposed budgets. Again, this ranged from academic quality learning environments as well as making sure that we had the educational suitability that we talked about earlier. There was a mention of a green bond request. Currently in our ask on the current bond, the sites you see here on your left, they will have the necessary sustainable and energy goals that we've talked about. To your right, we anticipate strategizing. We just allocated $3 million of our 2016 bonds to, one, put a solar roof on the new Alliance Farm Elementary, as well as doing energy suitability to see how we can utilize additional funding at the sites that are not included in the bond. So we do have a lens for energy. Our board signed a resolution for the 2030 and the 2050 to reduce our carbon footprint. This is our totality of the 10-year capital improvement plan, as you see here with the list of those 6 prioritized projects. In terms of schedule, there's been some, rightfully so, some haste about would DPS be able to follow through on this work. I can assure you, under my leadership, we have the capacity and the knowledge to do just that. Elementary F will begin bidding in August of 2022, start construction after this bond is passed in December of 2022 with a fall completion. The six elementary school renovations, we look to do some bidding in September of October of this year. And when assessing those numbers, we look to start on any one of those projects with the phased construction or move in the winter of 2022, with those projects establishing about a 34-month lead time currently due to those being occupied sites for a fall 2025 completion. And then Durham School of the Arts, we've done a RFQ for a design. We should have a recommendation to our board in May, giving us a year of planning and design, followed by bidding in the summer of 2023 with an August 2025 completion date. So that rounds up kind of our schedule, our approach to how we want to achieve efficiency use of the 2022 bond. With that, I will take any questions. And seems like a deposition, so I don't have any backup with me, so I apologize if I'm not able to answer any of the questions, but we definitely will get that to you in a timely fashion. Thank you.
Commissioner Long?
Thank you. Thank you, Chair Howerton, and thank you so much for this presentation. I had a question that if you want to share it after, that's also helpful.
Can you speak a little louder, Commissioner Long?
Is this better?
That's better.
Is that after this bond request, what will be the expected deficit still needed for DPS improvements?
So in the 2019 Cummins report, we had over $700 million of need just in HVAC improvements alone. Now this bond will help fulfill that, but the longer that we wait, more things will come up. So I cannot put a monetary value on what that is, but of the 51 sites, and we're only touching 6 here with 3 new ones, we still will have more work to do, yes.
Commissioner Jacobs?
Thank you for this presentation. I have a question about, I know that we're doing together a joint study related to MWBE contracting. Is that correct? Are we doing, what is?
We're supposed to be doing,
Yes,
disparities? Yes. Right now, I think it's probably in the next 2 weeks or so, we'll come back to the board with that.
Okay. So, focusing on the opportunities with both the county and the school projects for that. Are wondering, we talked about this a little bit this morning. Do you all have plans to actually do a full-blown renewable energy assessment or plan, the kind of like the county did and the city did?
So we've allocated some funds that we received from the 2016 bonds to do an energy audit that will look at totality of our schools and what renewable sources, not only solar, but what other renewable opportunities that we do have. So we actually have that in motion now, and hopefully would have a report in the next coming months.
Right, and I know you have a sustainability person on board now. So
that is correct.
And then my last question is, are you going to conduct any type of assessment related to the school properties that are no longer going to be used? So I'm thinking of the original Northern School site, DSA, and then you're probably one of the biggest public property owners of all three governments. But and just what in terms of available land on your school sites that could be used for other purposes or possible funding for school needs?
Yeah, so in our 10-year priority list, we did have how we're going to allocate some of those vacant buildings, such as DSA and Northern. We do have limited admin space as well as limited kind of incubator or innovation space. So we're looking at turning those buildings such as DSA and Northern as an opportunity to test fit maybe some additional programs, as well as you mentioned, some public-private partnerships. We know that Durham Tech, who just presented to the northern part of our county, perhaps could share some of the resources that we have at Northern High School, the existing Northern High School. So we're in conversations. We do have some funds from the county to look at some feasibilities, but we definitely hear you and look to strategize on some public-private partnerships.
Yeah, I would really encourage us having a very robust community engagement and joint planning process around that, especially when we're looking at things like affordable housing and other, public-private partnerships and ways to address community needs, even to generate revenue for the schools. So I think we can do some really exciting, innovative things with some of those sites. So I look forward to that process together. Thank you.
Commissioner Burns?
How you doing, Mr. Davis?
How you doing, Commissioner Burns?
Good, and you? I do echo those sentiments that Commissioner Jacobs brought up, but I really gotta, this is not for you. I want us to do that work. Commissioner Jacobs brought it up during a joint school board and county commission meeting, and people did not jump on it. And I just want to say to everybody on this board, it's not you. The first thing you said, and I have been a critic, and so is Commissioner Jacobs, and a couple of about whether or not some of this stuff can be implemented. You are but one person. I trust your leadership. I have seen you on those sites with a hard hat on, the same way I see you sitting here with a suit. But it is also up to individuals around you to be supportive of you, to make sure you have what you need. I've heard that you have met with that MWB consultant we had. If you need additional support there, by all means, let us know. It's not missed on me that it's $1 billion in funding. I know that you've been very intentional. I've seen how many Eventbrite programs, even during COVID, you have been very intentional about making sure that we have minority contractors and minority professional services be at the table and actually know that they can access some of these things. As we talk about what this land could be used for, until I had a conversation with Commissioner Jacobs, I didn't even know the extent to the entire inventory. And so I do want us to be creative about that, but I don't want us to just put that on him or one individual staffer. So that's why I'm elevating that. Number two, we're sitting here and we're talking about, I have seen 12 emails about this green energy bond. I'm not against green energy. I get it. I'm black, so we like to paint people of color against green energy. Don't know where that craziness came from. but it's been 12 to 15 emails. I've asked people on my board, I've asked people on the school board, and not one person can tell me what the $40 million is for. I've watched 2 school board members over the weekend say that they advocated to this board. I've asked my board, they have not been advocated to. So again, this is not for you. I know how intentional you have been about making sure that we are looking at how we can put solar panels out, how we can make sure we're putting more renewable energy practices into our schools. But what I want folks to know, we cannot get so ginned up by a few people that we make this an issue that splits us. We were able to move the what was it today, from 3.5% down to 2.5%. I don't want us now that our staff, through their hard work, they've been able to move this percentage down to now say, well, let's throw this $40 million on there, right? I'm not against this. Everything, Commissioner Jacobs, you brought up a good point. We had so many things in that CIP we had never seen. I'm asking everybody in this room, we need to see what it is, and nobody can tell me, and this is the gentleman who is in charge of making sure a lot of this stuff is implemented and built in. And I'm going to ask you right now, Mr. Davis, this is not to push on, has anybody given you anything that can explain what all $40 million of that request is?
So I will say that we have been in constant contact with community partners, some that are part of DPS and some that are outside, on what sustainability looks like. And I will say that while that is a actual number, I'm not sure if that is been given due diligence. And I think the number that has been given is based on some assumptions. We have not done our internal audits energy-wise, and so when you talk about putting solar on buildings, you need to look at, one, the energy use index. And so I like to use analogies because everybody's not vast in construction. If you have a house with no siding and no insulation and open windows, but you spend millions of dollars on a solar roof and complain that your energy use is not in effect, that's because you didn't take care of the things that you need to take care of. And so what we want to do is, be attentive to those stakeholders who care about sustainability, but help them understand that we need to make sure our insulation and our windows are updated. And then we can make a response to how much money we really need when it comes to solar. And so that number is based on some assumptions. But we agree that to do solar, to do sustainability, takes some dollar amount.
Right. No, that's helpful. And I think Perry brought up something earlier today when Commissioner Jakes, I got educated today about what we could put on top of Stanford. You said, well, the majority of the equipment is actually on the roof. It might not be. So I do think that those are conversations that we have to have. Like, she had a question today. He was able to answer it about what we could do with that roof. I had a conversation. I'm asking Mr. Davis about it. We need to be in a position to ask questions and not be so fearful when we get a couple of emails that ask us to expend $40 million. And the last thing I would say, because I know we have to go, I also echo these sentiments about what we can do for affordable housing. That plan predates me. I watched somebody on the school board, quite frankly, I can't even say that they lied yesterday and said that they had advocated to all 5 of us in the last week about an affordable housing initiative and a plan, and that has not happened. So I am interested in seeing what is in that inventory for our land. I appreciate this presentation. Yeah, it was really high level. I want you to be successful, Mr. Davis. I don't plan on encumbering your success, and I want our kids to be able to learn in a really nice place. So thank you for at least giving us this high level presentation.
Mr. Davis, I don't know if I can recognize you without your tennis on. You know exactly what I'm talking about.
That's right, yeah.
So we work out at the gym, and he has these real bright tennis shoes that he wears. Just a question regarding the utilization of the schools. If there are any where the pupil numbers are decreasing, are there conversations about how that particular school will be managed?
So while I'm not at liberty to talk on the academic side, I do know that if you build it, they will come. And so what we do know is the majority of our growth is on the southern part of the county.
Yes, right.
And in order to, again, address that education suitability, we have some schools like Creekside that are in mobiles. And so with the addition of Lions Farm, we're able to reduce that capacity of that school and then feed into Lions Farm. We hope to do the same thing with the new facility in Elementary F. And what would that allow us to do is then provide additional spaces so that the population growth would then take toll. I think a lot of people would like to be in Durham Public Schools, but because the area that they live in, we don't have enough opportunity. Funding this bond would allow us to strategize and make sure that everyone has an opportunity to be a part of DPS.
Well, this might be a bigger conversation, and I don't mean to, and it's not to put you on the spot. There are some schools that are, the percentage is not as high as you would like for them to be. And the growth in those particular areas is not increasing, but decreasing. So that's where my question is being targeted.
And we're
It
doing
might be a conversation we can have later with the board.
Yeah, we are doing a working together, growing together on our website that looks to address some of those inadequacies and something that you mentioned. We are looking at, I won't say redistricting, but we are looking at some things that can address those as well.
Okay. All right, thank you.
Question. Sure. Mr. Davis, just real quickly, and I want to commend you. Thank you for addressing the diligence and making sure we get projects completed in a timely manner. But I'm just interested to know, do you all use program managers or project managers, externally program managers to oversee projects? And if not, would you be open to that with the bond project?
Yes. Nice to meet you. We have currently under our employment 4 project managers that oversee millions of dollars. And so what we want to do for this bond project is to allocate a bond management firm. And so we'll start the RFQ process as soon as we finish this meeting on a conservative third party to manage just this, and then we could have our in-house project managers manage the day-to-day capital improvements.
Great, thank you.
It manages so well. Right before we started this conversation, the budget team and I and Mr. Davis had conversations about that and how on our side we can help make that a seamless process because timing-wise, that's just real crucial.
If I could, I just want to say thank you for raising that, and thank you, Claudia and Mr. Davis, for the partnership that's evident between Durham County and Durham Public Schools. I think everyone feels much more comfortable moving forward with the bond package as proposed, and a good bit of that I think is attributable to your leadership and to the partnership between the county and DPS.
If I could, I would say that would help our schedules to make sure that being good partners, inspections and stormwater, we know what the anticipated schedules will be. Oftentimes, beyond our control, some of our schedules lag because of those review times. So if we could just make sure that we're on the same page on what those expectations are, we can make sure that we're on that.
Thank you for raising that. And what I would recommend is that we have a preliminary meeting to talk through timelines and make sure that we are routinely staying in contact to keep things moving. We can make that happen.
Okay, no other questions. Thank you so much for your presentation. Appreciate it. I'll check you later.
I just had one request, is if we could get a copy of the last 3 presentations.
Yes,
that would
we
be
can
great.
do that.
Thank you.
We will send that to the board.
Okay, our next presentation is Go 220206, Go Triangle Computer Rail Opportunity Analysis. The board is requested to review a presentation from Triangle J Council of Government on the opportunity analysis for the Greater Triangle Commuter Rail Study. Ellen Beckman, Durham County Transportation Manager, and John Hodges Copperall, Metro Planning Director, is here to start these conversations.
I can give a brief intro while John's handing that out. Ellen Beckman, Durham County Transportation Manager. Great to see everyone in person.
Great to see you.
So this is a follow-up to your series of presentations that you've gotten on the Greater Triangle Commuter Rail Project. Triangle J Council of Governments has completed 3 studies related to that. That's what's been handed out and will be presented today. So this is like a sub-study, a part of that bigger Greater Triangle Regional Commuter Rail Study. So John Hodges-Coppels here from Triangle J to present it. Also, Jay Hikus is here from Go Triangle if there's any specific questions about the project. And I do want to take this time before John starts just to acknowledge John's long history of working in the transportation field. He is retiring at the end of this month.
Oh, no.
And I've worked with him for the whole time I've been around. He's been all the meetings I go to all the time. So John has a long history of fostering regional cooperation, making sure that we're all paying attention to the connection between land use and transportation, and just, logical, rational decision-making. If John has a position, he's going to back it up with a lengthy email or paper that describes all the reasons why. So I appreciate that, and he will be missed.
Thank you, Madam Chair, members of the board. Appreciate the opportunity to come before you. What I'll do is start with a couple of just sort of framing slides, and then I'll probably rush through some of the more detail, and we can return to any of the pieces that you might have questions on. So one way to think about this is that there's really 2 parallel analyses that are going on. One we've kind of called the service analysis. So think about what's happening inside of that 200-foot wide North Carolina Railroad right-of-way. So what has to be built, the track, the stations, the structures, what the service would look like in there, how many trains, where they run, when they run. Then the capital and operating costs, right, that are associated with whatever you have to build and whatever you have to operate. The ridership, depending on what you're running. And then all kinds of operational and environmental considerations, right? And that's all being led by Go Triangles, with Jay here, and their consultants. Then what Triangle J has been doing is what we've called the opportunity analysis. So rather than what's happening within that right-of-way, what's happening along the right-of-way, right? If you're looking outside the windows of the trains, what might you see in terms of land use, in terms of affordable housing, in terms of the travel markets, who would use this service based on what we know. And then there's another consulting firm, HR&A, that has done an economic impact, which is separate but related, especially to the land use. That's one way to think about framing it. Here are those 3 analyses that Triangle J has been doing. The first one we did, I think we actually wrapped it up sort of late last spring, was affordable housing, right? So looking specifically at existing types and locations of different kinds of affordable housing. I sometimes joke that we refer to them as the Old Testament prophets, LBAR and Noah. So LBAR is the legally binding affordability restricted housing, the kind of things like a low-income housing tax credit or Durham Housing Authority project, right, that has those restrictions. And then Noah, the naturally occurring affordable housing, that's stuff that because of its age or location is affordable at some proportion of area median income on the market. Now, obviously, nobody needs to tell you the market's changing all the time, so that's a constantly changing number. So that's existing. We then looked at what's planned. So think of, this body obviously knows about 300 Main Street, 500 Main Street, the projects you're doing coming out of the ground. Some of the things that, Anthony Scott and the Housing Authority are planning for their land. So kind of those things that are planned, wanted to capture that. Then we also looked at what we called opportunity sites. I'll talk a little bit about that. Other places where you could maybe have housing should folks want to do it. And then we had one little piece to this where we use 2 3-letter acronyms together, FTA CIG, so that's the Federal Transit Administration, and CIG is their Capital Investment Grant Program. So this whole project, if it moves forward, is going to be relying on federal funding. That federal funding is partly driven by scores that you receive on different metrics. One of those scores is around affordable housing, so that's included there. Travel market analysis, and I'll say this again, but this is all pre-COVID information that we're looking at there. It's where workers live, where residents work, the connections between where people live and work. And then we kind of focused in on two key elements of that. One we just called key hubs, so where are those especially large, especially intense job centers in the region? And then key neighborhoods based on race and ethnicity, on income, on vehicle availability. All those things are the most influential in whether people use transit to get to work. And then also the status of affordable housing locations, so we added that in. And then the land use analysis, the last piece we've done, and this is very much tied to what you're doing with the Durham Comprehensive Plan update. So we worked real closely with Kayla and Scott in the planning department on place types or land uses, the development status of different parcels, so where existing population and jobs are, the capacity for added ones based on that land use. And then we emphasize particular topics. The last one up there, I'll talk a little bit about the FTA Joint Development Program. I won't read this. I think you may actually have a longer version in your packet. But obviously, one of the questions one always wants to ask is why would we do something? Why might this matter? So we did go to some of the experts in the field and just pulled out some quotes directly from those on the importance of land use, importance of density, importance of understanding the travel markets in the region. So all three analyses that we did look at the same three areas. We start with a 4-county region, so Orange County, Durham County, Wake County, Johnston County. Now, Orange County isn't part of the discussion on the first investment, mostly for fiscal reasons, but we wanted to make sure we captured all these topics along that whole corridor. And Johnston County may or may not be in, right? They don't have the half-cent transit sales tax that Durham and Wake do. So this big grid that you see kind of represents the size of those 4 counties, and the portion to the left of the dotted brown line, that's kind of the Orange County piece. So if you looked at all 4 counties together, it's that whole grid. Then the 8 little boxes down there in the lower right-hand corner, that represents the relative size of the corridor itself. And the corridor was defined as the first mile, last mile distance from the tracks. And then the last single little dark brown grid there at the bottom, that's the combined size of the 15 sort of phase 1 station areas, right? So the corridor as a whole, about 4% of the land area of those 4 counties, and less than 1% within those station areas, and that's going to be real important in some of the stuff we discuss. So here's kind of a representation of the corridor from West Durham on the upper left by Duke and the VA Medical Center, all the way to Clayton in Johnston County down there on the lower right. And the map on the left there shows the existing municipal boundaries in 2022. So you think about who makes land use and affordable housing decisions today. That's on that left side map. And then on the right, we just put in the long-range planning jurisdiction. So in that one, we actually treat RTP as a separate planning entity. Obviously, RTP in Durham County is under the county jurisdiction. In Wake County, it's under Wake County jurisdiction. And the reason we show this is just that, I'm going to talk a lot about opportunities, and to the degree one can leverage opportunities, you're probably going to do it more successfully, right, if all of these jurisdictions are kind of rowing in the same direction. So that's just something to be considering. Okay. In each of the reports, we do spend a little time up front defining terms, right? Because nobody loves acronyms and crazy terms like transportation planners, and of course LBAR, NOAA, right? Housing folks as well. But I really just want to talk about two concepts up front here. One, opportunity, and the other, descriptive analysis. So opportunity is not benefit, right? Opportunity plus actions can lead to benefits. So opportunity is not destiny. It's not, these things aren't going to happen by accident, right? A lot of things are probably going to take some very hard work. And then those opportunities are going to vary throughout that long corridor, right? What's an opportunity on the Durham side might not be on the Johnston County side, for example. So although we'll talk generally about those, there's always levels of detail. And then finally, this was a descriptive analysis. And so Triangle J wanted to be very careful that we're not recommending any particular thing, right? We're not trying to sell a project. What we're trying to do is help everybody have sort of a common foundation of information and evidence, that it's all transparent, that it's all documented, that you can slice it and dice it many different ways. And, you know, we kind of preach out at Triangle J that really good decisions, you know, have one foot firmly planted in evidence and another firmly planted in engagement. And hopefully both of those things, when they talk to each other well, then help folks like you make decisions. So that's kind of, that's the framing for what we did. There's rules of thumb we use. So this graphic there kind of depicts those. We talk about these station study areas. That's just a half-mile circle, radius circle around a point. And that's a rule of thumb in the transit industry about a walking distance, right? Now, some people can walk and roll more than half a mile. Some people aren't comfortable walking or rolling even half a mile. So there's no wall at a half mile. But it's a good rule of thumb to just kind of understand some things. Similarly with that first mile, last mile, right? That's an area where you're probably beyond a walking distance. But if you do really good seamless connections, whether it's shuttle services or regular bus service or bike share or whatever, if you pay attention to those, you can take advantage of some opportunities. And then outside of that 1 mile, you're really talking about bus service or park and ride access. And we didn't really look at that. That's more part of the service analysis that Go Triangle has done. And any of those opportunities, right, are highly dependent on the type of service that is run, right? So it's not just whether or not a train or a bus or any vehicle runs, it's how that service is operated also influences those opportunities. Okay, so here's a messy look at that simplified version, right? And so this is just kind of a snapshot. This is actually from the land use analysis for portion of Durham. The little red circle at the top there, that's downtown, right? So the dot there is at the Amtrak station at the bus center. The second one is at Alston Avenue, and the one down at the bottom is at Ellis Road. And the reason I put this up here is that, again, there's nothing magic about that half-mile distance or that 1 mile distance. There's lots of things. I was really glad that Durham Tech was ahead of us on this. You know, Durham Tech, NC Central, they're not in a station walk zone. They're clearly within the corridor, but the degree to which service helps them is going to be highly dependent on really good quality, seamless first mile, last mile connections. And I'm probably going to say that phrase 5 times during this presentation, so sorry about that. And here's a similar same snapshot for the affordable housing. So in this case, just looking at what we call the L-bar units, legally binding affordability restricted. We've called out some of the examples. There's a lot of this housing that is, you know, just on the edge of those half-mile walk distances, including some real important ones. You know, so Fayette Place, when that, Anthony Scott and the Housing Authority, you know, move forward one of their proposals. Could be within a station area, depending on where the platform is, might be just on the edge of it. You know, 300 and 500 East Main. You know, lots of opportunity on this side on those. Okay, here's a summary.
Before you go away from John, are you saying that affordable housing will be within those circles? Is that what you said?
Yes. So so the circles here, the darker brown ones, are the existing legally binding affordability restricted units. So think of a housing authority project. Think of, in this case, the brown circle isn't the new Willard Street apartments. When we started this, they were still in process, so they're actually a yellow circle. But all the housing authority projects, for example, in this case, would be a brown circle. The yellow then are the planned ones. So 300 and 500 Main, Oldham and Liberty, Forest Hills Heights actually is both existing and proposed, right? It's only a few units now, planned to be more. So the difference in the colors is whether they were on the ground and open to people in 2020 or whether they are post 2020. Does that answer that? Okay, great. So here's kind of the land use summary. I put those 4-page executive summaries at your place. All of these have like a 30-page report behind them, which I certainly encourage you to read. It has a little more detail, but I'm just going to really go through things kind of quickly. And so this map, or these 3 maps, proceed this way. So the first one is the situation in 2020. The middle map is what is forecast to change over the next 30 years from 2020 to 2050. And then the last map is really those first 2 combined, what the situation would look like in 2050 if those forecasts are correct. So in 2020, in the station areas, right, those circle areas, about 14,000 households in the station areas today. Over the next 30 years, the forecast is another 38,000 households, so for a total of 52,000 in another 30 years. In the corridor, which includes the station areas, so that yellow line includes what's in the green line, roughly 90,000 households today in the corridor, more than 100,000 forecast, and so you end up with close to 200,000 in 30 years. Each of those blue dots shows a household. And then this is the corollary for jobs. We forecast households and jobs separately. Station area is almost 100,000 jobs today, another 150,000 over the next 30 years, to close to 250,000 jobs in 2050. And in the corridor as a whole, roughly 300,000 today, another 373,000, so you get close to 670,000 in the future. And I'm going to flip back and forth between these just real quick because households have always been sort of more spread out in our region, and that's expected to continue. If you look at that one in the middle, right, there's going to be growth that occurs in the corridor, but also a lot of growth outside of the corridor, and most notably in Wake County and portions of Johnston County. Whereas jobs have always been more concentrated, they want to be along these major corridors. And that trend is expected to continue, so that in the future we'll still have a very kind of corridor-focused job distribution. One of the things that kind of at least was encouraging to me, looking at the 2050 one, you can almost pick out the corridors that have been long talked about for transit service in the region, not just the rail corridor that's outlined there in green, but the 15501 corridor between Durham and Chapel Hill, that pops up on the map. The 5440 corridor from Chapel Hill into the park, it pops up. The US 1 corridor from Raleigh up north to Wake Forest and Franklin County. So I think these are all corridors that have long been talked about, and they seem to be the right ones.
John, that picture, it's amazing how the 2050, it almost becomes a solid red in some places.
Yeah.
Especially the part of Wake County that,
yeah, and I haven't remembered the numbers, but yeah, Wake's job growth is projected to be quite large over the next 30 years. So it's obviously already a dominant market. It's expected to become more so. So here's zooming in on that corridor a bit again. I think I mentioned all those place types. There's actually 40 of them in the list. We kind of roll them up into these 5 development patterns. And the reason I show this is, I skipped through those quotes in the beginning, but everybody would say it's real important to have sort of dense or intense development in a corridor to make it cost effective, make it be as successful as possible. And so one of the things this jumps out at us is there's like 10,000 acres of land in the corridor that would be in that city and town development pattern, but is not yet fully developed. So there's clearly opportunity there for more transit-oriented development. There's a series of maps. I'm only going to show this one for Durham. I'm not going to show the other ones. So in land use, we start with that development place types. Think housing, commercial, office, industrial, but then also development status, so whether it's already developed or not. So the top one, the top map, are those place types, and we happen to use a blue color for institutional, university, medical center place type. So you can kind of see Duke and NC Central there called out. The little dots along there, the one on the far right, that's the West Durham station. Then you go downtown, so the Durham CBD, the Alston, and then Ellis neighborhood stations, a lot of residential. And then this map goes all the way out to the RTP and their hub development. The blue line there is the Wake-Durham County line. Now, if you flip down and look at the bottom one, anything that's in that sort of dark brown is already assumed to be fully developed, right? Wouldn't have significant new development. Doesn't mean you might not have sporadic infill, but a lot of the opportunity in this segment really is between the East End connector, which will not open up before I retire, and the park, and on into Wake County. And then for each of these, we kind of highlight just some kind of key elements, right? So obviously this section includes two major universities, it includes the downtown, it includes the RTP and its hub, has some key neighborhoods with established neighborhoods at Alston and Ellis developing very quickly. A lot of opportunity between East End Connector and I-40. And pointing out again that places like Durham Tech, like NCCU will be heavily dependent for good service on having these seamless first mile, last mile connectors. I know, Commissioner Howerton and Jacobs were on the South Florida tour. There was a lot of discussion about the importance of that, integrating it, not treating it as an afterthought. And then key transit connectors, right? So you've got the Durham Transit Center downtown, which just got a great federal grant to improve, and then Go Triangle planning to relocate their regional transit center to be right near the rail line in the RTP. Flipping over to the affordable housing, that was it for land use, because we're covering a lot today. Flipping over to affordable housing, the maps here kind of show, in this case I've just done the first segment up in Durham. It's a little harder to negotiate here. The top one looks at those legally binding affordability restricted housing units where they're located. The bottom one is those naturally occurring affordable housing. And so I'll just focus on the top table there and the Durham line. So in Durham County today, in the corridor, 2,700 legally binding affordability restricted units, of which about 800 are in those station areas, and then you can see the other numbers there. Where we get this data, so the LBAR units, there's a national database that we start with. We then go to the housing authorities. Know about the LIHTC projects, add those in if they're not in there, check to make sure things are in the right place. Sometimes they're geolocated incorrectly, and so that's where we get that. Now the naturally occurring affordable housing, NOAA, comes from a subscription service called CoStar that we subscribe to, and then we calculate based on asking rents and unit sizes and the area median income, whether and to what degree units would be affordable. All these dots here we're showing at 80% AMI, but all of our data has both 30%, 60%, and 80%. And 30% there's virtually none, no surprise. And usually the 60% AMI units are about 1/3 of the total. So about 2/3 are in that 61 to 80% AMI level. So most of your NOAA is up towards the top end of that workforce housing range. And then the planned units. And this is, this relies a lot on folks giving us information. Housing Authority's been great. And so we just kind of plot where we know things are in process. These numbers will also change, right? As projects move through the pipeline, the unit numbers will change. And then the final one on housing I wanted to emphasize was this sort of opportunity sites and leveraging opportunities, because I think that's something we sometimes don't maybe pay as much attention to as we could. So all the little pink dots, which obviously you can't see at this scale, are places that are owned by the public, are not in a wetland, or they're not a park. They're of a size and a shape where, at least theoretically, you could fit housing on them. And they're not, it's not like this building. We're not assuming you would tear something like this down. So it's really just a first pass at if folks wanted to look at more opportunities for affordable housing, where you might start. And then another part of the analysis reminds us that the federal government has what they call a joint development program, and Jay knows a lot about this. And what that does is it lets you take some of the project money, apply it to either site acquisition, infrastructure, site preparation for joint development in proximity to stations. And a couple of benefits of that is any money in that joint development line doesn't count against your cost effectiveness score, doesn't penalize you in your scoring process. And then, to the degree you might use that for affordable housing, right, it helps fill some of the gap for land, infrastructure, site prep. Yet you use some federal funds to do that, and then helps your affordable housing score, right, if that's what you end up doing. So it can be a triple win. Not simple, right? I'm not going to pretend that's not complex. Doesn't involve a lot of work. It does, but it's an opportunity. And then finally, the travel market analysis. This is probably the most wonky one, so I apologize. Again, encourage you to kind of read some of the other material or follow up. But one of the things we wanted to show, and this is all based on pre-COVID data, national data sets, is the connections, right, across the region. And so, kind of have the bullets there. 45% of the workers who live in those 4 counties, right, who live in either Wake, Durham, Orange, or Johnston, their employer is in another county, right? So that's significant. The Wake-Durham flow between those 2 counties in both directions is 96,000 workers live in one county, have their employer in the other county. And that is far and away the largest in the state of North Carolina. We hunted around, the second biggest we could find was like 57,000 between Mecklenburg County, Charlotte, and one of its neighboring counties. So I know we talk about that a lot, but I think people maybe underappreciate the scale of that interaction. In the chart there, let me just explain a little bit, focusing on Durham, which is at the bottom there. So that's folks that have their primary job location in Durham. Primary job is the one where you earn the most money for those that have more than one job. And the purple bar, the percentage of that, those are the folks who live in Wake County and work in Durham. At the very top, with the Wake County one, you see a little asterisk above the red bar. That's the folks who live in Durham County, work in Wake County. Those 2 added together get you that 96,000. So that was the region, focusing in on the corridor itself. Here are where people live, their home location, for those that have a work location within that corridor, within that 1 mile, first mile, last mile. So 180,000 people live in those 4 counties. Their primary job is in the corridor. 70,000 of those live in one county, have their job in the other. And then there's 56,000 folks that both live and work within the corridor itself. So that's kind of a sweet spot. Now, obviously, if you live in downtown Durham and you work in downtown Durham, you're not going to be taking a commuter rail to get to work. But that's the folks that...
What is it, Wake County Orange Line again?
Say again?
What is it, Orange Line, Wake County again?
Oh, okay, so the Wake County line, so that's like 110,000 people who work in the corridor, work in somewhere in that 1 mile corridor, and live in Wake County. And then the orange line at the top there, so that's like about 50,000 people live in Durham County and work somewhere in that corridor. Could be in Durham, could be in Wake, could be in Johnston. So that's what that represents.
Another name for that is called traffic.
Yeah.
Yeah.
It likes this slide. Oh, there we go. I'll go through the rest of these kind of quick. We wanted to look very closely at both the key job locations and then kind of equity-centered residential locations. So the first one we just called key jobs. We took all the places in the region that, based on some research work that others had done, you would define as high density, very high density, extremely high density jobs. We then ranked them by the actual number of jobs in the region. So actually the area up around Duke and the VA Medical Center is the top job hub in the region. And then kind of calculated that that these top hubs, whether they're in the corridor or not, right, we're looking at the whole region, they've got about 40% of our region's jobs on just 3% of the region's land. And the rail line runs through 8 of these largest 10 job hubs. And those 8 hubs that it runs through have about 200,000 jobs pre-COVID. We then actually dove down a little bit to look at low and moderate earning jobs. So this data set lets you look at jobs with different earnings levels. So low and moderate is $40,000 a year or less as an annual income. And if you then recalculate all this stuff, just looking at those top hubs for low and moderate earning jobs, it changes a bit. Seven of the 10 are the same regardless, whether it's total jobs, whether it's low and moderate earning jobs. 2 drop out near RTP if you're only focusing on the low and moderate jobs, as does 1 at Wake Med. And then 3 rise into the top 10. They're all in Wake County. They're all retail centers, so Crabtree Valley, Crossroads, and 1 in Northeast Raleigh. So we wanted to see how job earnings change the equation. I won't go into great detail on this. There's a lot of detail in the full report where we use the same technique that the transportation planners with a long-range plan used for environmental justice communities. We then kind of combined them into kind of key neighborhoods. And the bottom line was that 12 of the 15 initial station areas either met thresholds for a key reinvest neighborhood or met a threshold for one of those top job hubs, or both. You kind of see down by Garner, there's a big one that meets both. There's smaller ones that might not show up well here around the between the Alston and downtown station, and also one up by Duke. Think of the Duke Manor area. So, takeaways. Again, these are all there. I'll just go through them real quick. Remember, the rail corridor, only 4% of the land in those 4 counties, but it's got 30% of the region's primary jobs, those top earning jobs, the top job that anyone would hold, and that equals 280,000 jobs, roughly today. Also, 23% of the region's jobs with those earnings below 40,000 per year are located in the corridor. So it's also close to a quarter of those jobs. That Wake-Durham connection, 96,000 workers living in one county having their employment site in another. 8 of the top 10 job hubs along the corridor, so that's downtowns of Raleigh and Durham. It's Duke University Medical Center. Rail line goes right through the center of North Carolina State University, and of course goes by the Research Triangle Park. I mentioned the 56,000 workers that both live and work in block groups along the rail corridor. And the last one, that safe and seamless first mile, last mile connection, super important. 70,000 people live in neighborhoods along the corridor. that achieve those thresholds for the amount and concentration of BIPOC residents, lower income, zero-car households, or legally binding affordability restricted housing units. And again, there's abundant evidence that those characteristics are folks that use transit far more than the average citizen. On the land use side, forecast, if you look at remember those 2050 maps, it's forecast to hold about 20% of the region's households and 45% of the region's jobs by 2050. So 1 out of every 5 households would live in that corridor. Not quite, but close to half of the jobs in the region. And that involves adding about 100,000 housing units, 370 jobs over the next 30 years. And one thing that I was kind of glad to see is even doing that, there's still plenty of undeveloped capacity beyond 2050, right? So I'm always suspicious if you completely load up the land anywhere. But we'd have plenty of land that the forecast doesn't fill up beyond 2050. Now, and again, I think that I say this in every slide. I said I was going to say it 5 times in the presentation. It'll probably be closer to 8. Much of that land is going to be beyond walking distance of a station, right? This is not light rail or bus rapid transit where the stops are real close together. So those high quality connections, whether it's by transit, whether it's by active transportation, are going to be a key. And if the corridor land use is going to serve a spectrum of users, then it's going to take sustained, deliberate efforts to create equitable transit-oriented development, TOD, right? But there's public land, there's the joint development program, there's anchor institutions that we can collaborate with, but opportunity is not destiny. And finally, on the affordable housing, significant numbers of that legally binding affordability restricted housing already in the rail corridor, many of them in station areas. I should note, though, that about 15% of that current legally binding affordability restricted housing, it's not permanent, right? Their requirements will sunset, some sooner than others. So again, efforts to reserve them. A lot of that naturally occurring affordable housing in the rail corridor today, again, subject to market change, which is happening rapidly. The Johnston County end of the line is especially important for that. We score well on our affordable housing metrics today. Based on that first pass analysis, the opportunity sites, if we collaborate with partners, we might be able to improve that. And of course, I had to put the first mile, last mile connections in there, because if you remember that circle in Durham, a lot of even the legally binding affordability restricted on the edges of some of those station areas. So making those connections, super important. I mentioned this was descriptive, right? And actually a lot of this data we're putting up online so you can have zoomable maps and figure out where stuff is. We're actually presenting to the Coalition for Affordable Housing and Transit Committee last week on some of this. We want this to all be real accessible. We're not defensive about the data. The data will change. All these data sets are updated every year. So, we want to keep tracking changes. Commissioner Howerton, Commissioner Jacobs, who were on the South Florida tour, know that they heard repeatedly, right, that you can't talk about transit and land use in separate conversations, right? You've got to be talking about them together. They even mentioned having this kind of regional vision in South Florida, so everybody was kind of knowing where we're headed. We don't have that really here. It's something we might want to consider. Multifamily housing developments can be super important. That's where you get your density. That's where you get a lot of your affordability, even on the workforce housing side. So leveraging land, leveraging the joint development program. And I will resist another first mile, last mile comment. I've beaten you up with that enough. So in all of these, there's a detailed analysis report for each topic. The land use one isn't posted yet. We're still finishing that up. Those are like 30-page reports where the data came from, appendices. If you're having insomnia, they might be good for you. The 4-page executive summary, so I put those at your place. We have PowerPoint presentations on each of these topics. They're already posted. This is kind of a combined one, shrunk down. And then a lot of detailed data and mapping, which we are more than happy to share with anyone or come present. We have some great data folks, at Triangle J, Jenna Coling, Ben Bearden, who did a lot of this work. And we really want to make sure it's, it's available, it's transparent, and we can explain the challenges with it, right? There's no data set that's just, perfect and going to tell you what to do. And they'll all be on this readyforrailnc.com site. Much of it's up there now. So that's it. I've probably taken too long. I apologize. But be happy to then go back to any slides or try to answer any questions that I can. Thank you.
Thank you so much, John, all of you. Ellen, remind me your name again.
Jay Hikas. Oop, that was loud.
I didn't hear that. Say it again.
All right. Jay Hikas, Senior Transportation Planner with Go Triangle.
Thank you, Jay, as well, for this presentation. It's a lot of information. It's kind of like being on the trip last week. Lots of information. It's kind of like you need a brain dump when you get back to try to figure out where it all compartmentalizes in your brain. Are there questions from commissioners? Commissioner Alum? You gotta hold it up or speak louder, one or the other.
Hello.
Okay.
My mic light turned off, so I think it's dead. Yeah. Okay. Thank you so much for this presentation, and congratulations on your retirement. Very exciting. I had a question around, I know you put a lot of maps in this, and kind of going to ask for maybe another map that shows the proximity of like bus stations to the different stops along the commuter rail, and then as well as along the commuter rail stops, will there be access to like bike racks for individuals who maybe like bike and leave their bike there, or parking if an individual wants to park in Durham and then ride it to somewhere else, what that would look like?
Yeah, so part of the work that Go Triangle is doing, so they've looked at initial park and ride demand and location. So not all the stops would have park and ride, but many obviously would. And so they've done an initial kind of memo on how many cars they think how many park ride spaces would be needed. They're also doing sort of updated ridership estimates very soon, and that might then tweak some of those numbers. But that's available. And then of course you all are heading towards a Durham County transit tax plan, which will define where some of the bus lines would be. You can obviously know where they are now. It's it does suggest it'd be good to, in some of that online mapping we're doing, to overlay at least the existing bus routes. So yeah, we can those are great ideas. And in fact, I think we were talking about, we're trying to do individual station summaries as well, and indicate in each of those how many park ride spaces, at least initially, are thought to be worthwhile. Thanks.
And if I may, I just wanted to reiterate John's last point. We are, as part of producing information that's in a summary form and readily accessible, want to produce a summary for each station that includes much of the work we saw here, but really looking at the station that might be in folks' neighborhood or the place where they work, so that they can sort of see how does this affect my daily life or my community. And it would include information about both existing and proposed bus routes to the extent that that information becomes available out of the transit plan.
There were several of us came back from this weekend. I had a conversation with about 5 people, and we came back with more questions than we did answers. So at some point, probably with the board, with Go Triangle, will express those questions, but we have more questions than we did answers about how do you do commuter rail. So that's where we were left, questions, and we'll get to those.
Thank you, and thank you so much for this information. It's really fascinating information and incredibly, I don't know, it really does reinforce in my mind the challenge that we face with how to spend our transit tax dollars, because it's clear from the evidence and from the engagement of our communities that the commuter rail is important to people. It's not the number one important thing based on the engagement surveys. But boy, do all these numbers justify a need for a regional spine, backbone, connecting us all. And then, in addition to that, in order for the regional spine to be effective, we've got to have the improved bus services and pedestrian and bike, facilities, infrastructure. So everything that you have told me today just reinforces the difficult decision I think that we have ahead of us. How to do all of it, how to stage it so we can do it all in the most effective, efficient way. So thank you. I don't have any questions, except how to do it all.
We'll be back soon.
Well, thank you, John. This is just such excellent work. Really appreciate all of this, and I really wish you were not retiring, at least till we got through the Durham County how we're going to use the transit tax dollars and thinking through the commuter rail project. When you were speaking about the corridor, I thought, gosh, we actually couldn't design a better corridor in terms of, 8 out of the 10 job hubs, including all of our major universities, educational institutions, including both of our transit hubs in Durham, and then 37% of our legally binding affordable housing. It's like we couldn't get it all in. Could you speak a little bit about the last mile connection? Because that is something that we saw a lot of in Florida, in South Florida. That was just amazing, and just throwing out some of the things that we saw and that people are doing. And it's not necessarily buses. Right. It's really beyond that. So could you talk about that?
Yeah, and the main point was those things, they need to be considered as a package, as a whole, not that one's important and then you figure out the other. And the thing that struck me, I'll use the Brightline example. I'm not a huge Brightline fan, but that's just me. But one of the things they did was they said, okay, we know that, their system only has 3 stops, and they're very far apart, more like an intercity rail. But we know that we've got to get people to and from the system. So they actually integrated what they call Brightline Plus, and right now it's free, so who knows what it'll be when it's not. But they said 40% of their patrons then take advantage of Brightline Plus. And what Plus is 4 different first mile, last mile connections. So if you want an e-bike, right, you can use the e-bike. If you want what is, in my view, sort of a souped up electric golf cart that carries multiple folks, they have that, all branded, right? So their e-bikes are Brightline branded. So they contract with a company, Circuit, for these electric souped up golf carts. They're enclosed and comfortable. So if you want to use that, you can do that. If you want more of a shared ride, you can sign up for that. And then their top of the line is simply Uber, but their own Uber using Teslas. So it's all electric. So one of the things they said was anything we're going to do, whether it's the bikes, whether it's the circulator, whether it's the vans, whether it's the Uber type service, is going to be electric. So they've recognized that's important. And built it in. And they actually have a 5-mile distance that they'll do. So it's more than first mile, last mile. I don't know of other systems that have maybe quite taken it that far, but I think it's a good model, not necessarily for actually what you would do, but how you would approach it, and then work with communities and institutional partners, right, to do what would work. But it's all integrated.
Right. So, I was amazed. What I saw was people get off the train, and then they just look at their phone, and then whatever they've chosen pulls up, and they go to where they need to go. And so, I think we need to really understand this is where things are headed. That's what we saw in South Florida, is they are cutting edge. This company Circuit that's in other markets, they provide these electric vehicle shuttles that will, you know, within a certain radius, it's for free. They will pick you up, drop you off on demand. And, you know, it could be something that the employer pays for, you know, whatever. But just there are lots of possibilities out there because the whole idea is getting people to where they need to go seamlessly. Could you talk a little bit more about the reinvest neighborhoods? You kind of,
Yeah.
you didn't go into that too much.
Right. And the data lets us slice and dice things all kinds of ways. But that can also often sort of be confusing, I think. So we wanted to just do one way to do it, one summary. And so, you know, we looked at the data actually from Nelson Nygaard on what they call the propensity to use transit for your work trip. And so they broke it into race and ethnicity, into income levels, into vehicle availability, whether you were a zero-car household or a one-car household. And so race and ethnicity, RE, income, IN, vehicles, VE, and then we did status of affordable housing, ST, so we had a nice little acronym of reinvest. And we simply said, okay, for all the block groups that have these different measures of those characteristics, which are the ones that are in the top quartile, the top 25% of all block groups for that metric. And then we said, okay, let's look at all the ones that are in the top 25% for just one metric, for two of the metrics, for three of the metrics, or all four of the metrics. And I think it's mostly 2 and above that we then just called reinvest neighborhood. You know, those were the ones that where clearly you were looking at multiple characteristics, and then we kind of ranked them by the number of people, right? So the 25% threshold, that, you know, you could have a block group with 10 people and one with 100, but you'd probably care more about the one with 100 people, even if it was a slightly lower percentage. So we just ranked them by number of BIPOC, lower income, zero-car households, and then ranked them that way. So I think this is in the travel market report. If you look at that one, and it's only a couple, 2-3 pages on how it's done. And we made sure it aligned with what the two metropolitan planning organizations did in defining things for their metropolitan transportation plan, which they both, the Durham Chapel Hill Carborough MPO and its sister organization to the east, Campo, just adopted in February. So it's all, amazingly enough, consistent.
So you said there were 70,000 reinvest neighborhoods that are
households in the block groups that meet that threshold.
Okay.
Right.
Okay. Thank you.
Commissioner Burns?
Good afternoon. I wish I could say morning, but that is long past. Wait a minute, make sure. Hodges Koppel or Copel?
Koppel.
Koppel, okay. Like Ted Koppel, but with a C. Okay.
That's right.
All right, so Mr. Hodges Koppel, this is gonna sound really random, but you're an experienced man. You got nothing to lose. You're out of here in a month. So I want to ask, I have 2 questions. My first one is, when you were asked to come here today or invited, and thank you for coming and thank you for your presentation. Hey, Ellen, thank you for being here too. What was your instruction today?
To present the results of the 3 analyses: the land use, the affordable housing, and the travel markets.
Okay, well, if that was the case, you did perfect. All right, great. So that was easy. I promise you, I only play a mean lady on TV. Here's where my struggle is. One of my colleagues last month, this was right after we saw the sticker shock of the bond, asked the question, what is the rationale for this commuter rail? And I have said, and I don't know how many meetings between MPO, between here, between Social Tax Board, 1,010,000 of them. And I get that I was not on the trip to go down to Florida, right? We all didn't make it down there. But here's where my struggle is. I can appreciate that 37% of our affordable housing portfolio is in that. But you know what else I appreciate? The fact that 23% of the people who live in that corridor make less than 40,000, right? So nobody's even giving me rationale that poor people can even pay for a ticket, right? So you understand what I'm saying? Like every time you gave me a good fact, there was one that and that's, and that's not for you because you came in here and gave very honest information, which is what we needed. But I haven't seen anybody that I know that rides the bus in my neighborhoods. We haven't had those folks to present in front of us. So I don't know what the rationale is. Like, I recognize that we're doing a great job of building affordable housing, but I also know that I think Nicole Thompson told us that there are 9,000 families moving to downtown. There's 9,000 families moving to downtown. Less than 1,000 of them are going to fit into this low-income scenario, right? So I know who we're building this for. I just don't know why. And so with less than a month left, I don't know, you might become a consultant, so this might not be the end of it. Might not be the, he was like, no, save myself. I'm just, and your volunteered expertise. This is your neighborhood. I mean, the Triangles is where you live, where your family is. Like, I've asked every consultant this, and I've asked poor people this, and I asked my colleagues to do the same. What would you say is the rationale for building this now? And I'll stop this. I'll throw this one more thing out. Commissioner Carter hit on it pretty well. We recognize that you got the half a mile where you can walk, then you got the corridor, right? And so I know how close Central is to these points. I know how close RTP is to IBM is. I know how close the hospital is to these points. I know also how far away they are. And I know what it's like to have to walk to a bus stop. I know what it's like to walk from the projects to Durham. I promise you, I know I got the shoes to prove it. And so we talk about the implementability of the school board. I kind of sort of throw that, on our 3 or 4 governments. Which one is going to come first? Because we know we need bus rapid transit to get people to the stops. I'm not confident in 4 governments that the bus will be built in tandem or before this commuter rail. And that is very discouraging for me and the community that I have to go back to. Because if you build a nice new thing for them first, once again, we are left behind. So I just want to know, in your volunteer expertise, do you have an answer for what is the rationale? Because we keep getting asked that.
Yeah. So I'll take off my analysis hat.
Okay.
I'll put on my judgment hat rather than my personal hat. That would be something entirely different. So, and this is probably based on, what they say, where you stand depends on where you sit. So I've been sitting for 30 years in thinking about the region and connections, right? And so this is something that, in my view, would take another 8 to 10 years to build, right? So what we're planning for is however people need to travel in about 8 years for this particular project. So it doesn't necessarily, right, if we thought about the way Durham was 8 years ago, very different than the way it is now.
Oh, yeah.
And it's going to be, in the region, not just Durham, it's going to be very different in another 8 years. No doubt about that. So, we know that Wake County is going to have, for every job that gets added in Durham County, 3 are going to get added in Wake County.
Right.
That's been the history. It's almost certain to be the future and maybe even accelerate. We heard, you mentioned Durham Tech and down Miami Boulevard, Wake Tech, right? So Wake Tech, their campus at RTP, right at the McCrimmon rail station. So the rationale, to me, if I'm wearing a professional judgment with a Durham slant, is this is a way to connect to all these things that are in fact lined up along the corridor, right? If you said, hey, I want to be able to get to downtown Raleigh, I want to be able to get to the RTP, I want to get to downtown Cary, I want to get to NC State and all the jobs that are there. Well, gosh, you'd draw a line right over something we already have, which is the rail line. So the rationale would be seamless, fast, reliable connection for Durham residents to job opportunities and educational opportunities up and down the corridor. Now it's just one corridor, right? And it's clear to me you never want to invest in just one thing, right? So you mentioned cost. So there's the cost to an actual rider. What would that be? But then there's obviously the cost to the county in terms of the contribution. Those are conversations you're having now. So if the cost were zero, it'd be an easy answer. If the cost were we won't get the federal funds and we have to do it all ourselves, that's an easy answer on the other side. But it's navigating and negotiating where in the middle the value lies. I feel pretty confident from a professional judgment sense that you cannot replicate this level of fast, reliable service with buses, right? Right now, you can take the DRX from downtown Durham over to Raleigh. It'll stop a couple places.
Yeah.
It'll take you 40 minutes if it leaves at 7. It'll take you 50 minutes if it leaves at 8 because it's in traffic.
Right.
But you're not, you can't take it to the RTP. If you live in East Durham, you first got to go back to the Durham Transit Center to get the bus. So
I know the DRX very
yeah,
well.
so all this stuff is lined up, but it's not inexpensive. But it's the regional connection in the future that we sort of have to decide now. That's the challenge. But I would say that's the why of it. If that's not important, then you probably wouldn't make the decision to invest. But I do not believe there is a transit alternative that's better for making that regional connection, as long as the cost provides value. I mentioned Brightline. The other rail line down in South Florida called Tri-Rail, which doesn't line up with any of this stuff, doesn't go through downtowns. But I rode it a couple times, including back to the airport, loaded with students, loaded with folks in service worker uniforms and construction. So it's clearly being used by folks that aren't office workers making $100,000 and above. And a lot of, interesting enough, a lot of them bringing their own bicycles on. That was how they were doing the first mile, last mile, because they don't have Circuit, they don't have the Teslas, they don't have all this stuff. But it was being used. So that actually gave me, gave me some optimism. And every station along there, you didn't see a building over 2 stories. So it's not even good land use wise. So people were finding their way to get to it. Cost them about $5 a ride. But they obviously judged it was worth it for them.
Thank you, sir.
Does that help? And again, I'll now take off my professional judgment hat and put back on my analytic hat, unless I'm asked.
Congratulations on your retirement. Thank you, sir.
Yeah, you can keep back on, and Ellen probably gets in this conversation. One of the conversations that I appreciated the panel having was a conversation about collaboration, funding. There was one conversation that was talked about was the decision was made about going forward and coming up with resources, but what wasn't discussed was the maintenance afterward. So there's a lot of conversation around funding that we've been talking about. How do you fund it if the federal government doesn't give us the money? And how do we fund it going forward? Do we end up having to raise taxes on the citizens again? And how do we do it all? Because we can't negate buses for commuters. So it's those kind of conversations that we need to manage and come to some resolution about how do we manage all of this. And we can't do that today, but just to let you know, those were some of the conversations that I had with people. And they're grappling with, how do you do that? Commissioner Jacobs, and then it's after 3.
I just wanted to thank you for your answer to Commissioner Burns. And I would say to Commissioner Burns, a lot of it's going to be on us. And I appreciate that a lot of what you said today, John, it's about opportunity. And we also have to think about what happens if we don't take advantage of the opportunity.
He also said opportunity is not benefit. See, every good thing he said something bad.
Right. Yeah. So what I saw, for instance, in South Florida was the incredible investment of the private sector and public-private partnerships. And we've traveled on 3 different rail lines. We traveled on the Tri-Rail, which is their commuter rail, the Bright Line, which is really more of a intercity rail.
Right.
Then we also traveled on a commuter rail system a light rail system.
They're Metro Rail, which
Right,
is.
the Metro
yeah,
Rail.
Yeah.
But what was really interesting is it was a region because we were Miami-Dade, Broward, and also Palm County. But they talked a lot about the collaboration, the partnership, thinking outside the box, being creative, and also thinking you can do things one step at a time. You may not be able to do things all at once. But what was amazing about the Bright Line is that is a privately built rail line. Is that the only one in the United States?
I believe so. Jay, you may know better.
I believe so. That's the only private.
Privately built. And guess what? They don't care about transit. They care about real estate. And so their model is they have bought up the land around the stops because they recognize that real estate value around the trail stops. But guess what? If we actually control, you said how many acres of public land is controlled within you said it in your report.
I think I did, and now I forget what it was. I'd have to look at that.
It was like
it's a lot.
It was like 15. It was like thousands of acres that you said that we control, and then leveraging private-public partnerships plus the federal matching grant program. But again, that's all on us to make happen. I will say that what was very positive and exciting was we had 80 people on the trip. We had the Secretary of Transportation from the state of North Carolina who spent 3 days with us, and all of his lead staff. We had the lead of the North Carolina Railroad with us for the entire time. So the partners and the stakeholders were there, and I've never seen that before, ever. So as you said, though, it's on us to bring everyone else in, and all the partners we all need to be having the conversations together. So thank you.
So thank you for your presentation. If there's nothing else for you,
Thank you. We'll be back.
Good afternoon, Commissioners. Once again, I've sent you a fresh link. It's the same link that you've been sent before, and so, again, you can access this sheet anytime you like to check on the status. Monica and her staff continue sending me minutes, and we keep plugging things in and correcting things and trying to keep them up to date and making sure that the staff who are responsible for the various items are aware that what their directives are and what the timeframes are for responses, and so I'll just leave it at that and see if you have any particular questions. Okay. That would be great. Appreciate it.
Thank you. So, Commissioners, there is a comment time. If Commissioners have something they'd like to report at this point, I know that we had a trip to Florida and transportation, but, if there's nothing hot and heavy, Mr. Jacobs, I know that there's a lot of information that we've gathered. Sharing this booklet with Commissioners, and I brought back one for you, so how to share it with Mr. Long, another one, but one there. So there's a lot of information with this done together, what we did and what we saw, and you shared a little bit of that already. If you want to share something else. And I also want to mention the email that we received that I sent
attorney about school and affordable housing that we received. We all received an email from Natalie about future housing. And I sent it to the attorney. Did you get it? One of the things I'd like the attorney to check into, Attorney Darby, it is the school's property.
Where they want to build the housing?
Yeah.
Yes,
We've had these conversations before.
yes.
And we've tried to get bills through the legislature before. It hasn't, we haven't been able to do anything with that.
That's correct, and I'm still kind of waiting for the school board's attorney to show me and convince me the way we can do it as they want to have it done.
Yeah, I'd like to know what is it that we would need to do, because it is the school's property, it's not the county's property. What is it that we need to do? And I know that Commissioner Carter had a conversation with a community member. So,
We would have to convey it to them with restrictions.
so if you could follow up on that and let us know where we need to go with that conversation.
I will.
It's interesting, because I was going to bring that up during commissioner comments. That was the third thing. I said in 2 forums, and since she sent an email, I was the one that requested that board member Byers send us that email, because she got up in a room in front of a bunch of people and demanded that those people in that room advocate to us about affordable housing. And I asked her very clearly, I was like, where's the plan for it? I've had long discussions with Commissioner Jacobs about affordable housing. I've talked to Mike Lee, and I have talked to Zach Hawkins, who was working on that bill that did not go through. So I'm not a naysayer. So I asked about it, and she says, well, this predates you. So I was like, why would we ask a room of engaged about it at all? I did ask her this weekend, and I said, you've never talked to me about this. I don't know who on my board, and I actually talked to 3, so I know who she's talked to. So that request did come from me, and I do agree that we need, how is it it's coming to us, and your attorneys should be working with General Assembly staff. I'm not a naysayer, I'm not saying that we can't do it. That is not that I don't want affordable housing for our teachers, but I am asking my board members, when we see other elected officials stand up in a room and demand things of the 5 of us that we know absolutely nothing about, I'm respectfully requesting that we say, stop. Do not do this to my board that is already under extreme pressure. We have ARPA funding, we have a budget, we have clearly some issues with transportation. So to bring about, same thing, same comment was made about not just affordable housing. It was demanded that we had, the other thing that was said, now I'm gonna say it here, and I'm so happy it was recorded, I don't know what to do. It was said that the 5 women on this board were the reason why the teachers were not getting their $5,000 that we had been advocated to, and we had held up all of those promotions. In no way had anybody talked to me about that at all. So we have got to start talking. And I'm so happy they recorded that conversation, because that's what was said. And I've talked to you all about how we can improve teacher funding. And I've been on board with a lot of work we can do. But what we can't do is let people in this community continue to lie on us. That happened with the youth center. That was unfair to you. It has happened on a lot of very critical issues. And if we want to prove to this community that we are connected and united as a board, then we have to defend each other like a board. And so I'm not going to take up more commitment. I had 2 more things with commissioner comments, but I'm happy that she sent that email. But I asked her to send that email because she had never, in her life has maybe emailed me once. I did want to throw this out here just so everybody knows that I'm not a naysayer. I'm so proud of the University of North Carolina at Chapel Hill, but what I will say is that Coach K has coached for 47 years, 42 seasons at Duke. That man played his last game the other night. I respectfully request the leadership that we do a proclamation in his name. He has 3 Olympic medals. He's won over 1,200 games. He's a Naismith award-winning inductee, and I think, and just the work at the Emily K. Center, I'm a true UNC fan, but I don't want us to miss this opportunity to say farewell to Coach K in style.
Mr. Jacobs knows the history of that conversation. So this is not something we have refused to do. It's somebody's opinion, and excuse me, but you know what opinions are like? Okay, so are we ready to move on to other items that people want to bring up? If not, is that something else for you?
Well, I know I already spoke about the trip, but I just want to say the Regional Transportation Alliance, RTA, did an amazing job setting up a tour where we were nonstop and we're able to hear from elected officials, transportation planners, transportation leaders, business leaders, economic development people. I mean, everywhere we went in every community, in Miami, Miami-Dade, Fort Lauderdale, Broward County, Palm Beach. It was really a logistical feat, especially with 80 people. And then getting to go on, like I said, 3 different rail systems, plus a bus, of course. But I just want to say I learned so much, and I look forward to speaking with each of our board members about some of the things that I learned. But what I appreciated was a lot of the conversations. People were just glad to be together and talking to each other because, you know, we just haven't had that, and building relationships. And there were elected officials I met somebody from the Selma Town Council, and there were elected officials from all across our region on the trip. And it was just a great learning opportunity. And I think that we have great potential to work together on this. And I will want to follow up what John was saying about creating a regional vision. This is just really important, and for us to do. I know Lee Worsley was there, head of Triangle J, Council of Governments, and they are ready to really take the lead on helping us as a region come together, because that's what the fact is. You know, every day, 65,000 people in Durham wake up and go to work in Durham. And 65,000 people get up and they leave Durham County to go to work. And then we have about 120,000 people who drive into Durham every day. We are a region, and to plan for the future and to deal with economic mobility for people in our community, to manage our growth, to deal with climate change, we need to work together. So I know we have a hands-on active board, and that we'll all be jumping in, and it's going to take all of us and to engage the whole community as well. So I'm excited to do that work with everyone.
He's telling me my mic was off. Okay. So if there's nothing else, I will entertain a motion to adjourn.
So moved.
Okay, we are adjourned.
Commissioner Lum,
Aye.
Commissioner Burns,
Aye.
Commissioner Carter, Chair Howardton,
Aye.
Vice Chair Jacobs.
Aye.
Now we're adjourned. Okay.